इसको इंटरनेट इसको 60% मतलब उनको बोल भेजा लाइक अंधेरा हो रहा है ना उसमें और फुल फिंगर बस.
A very bright welcome you all to the Third World Dental Sciences and Oral Health Conference. This international conference is brought to you by CynoDent, Indian Society of Dentistry and Cynomedics. First of all, I would like to introduce CynoDent. CynoDent brings you CynoDent International and CynoDent India. CynoDent is a unique international digital healthcare platform first time in the world. So moving on to the first lecture for the session, I would like to introduce Dr. Puneet Gupta sir. He is an Associate Professor, Department of Public Health Dentistry, Government College of Dentistry, Indore. So please come on stage.
To all of you, and my thanks to the organizing community to present my talk, and later down the line, but I had some urgent work, so they allowed me to present it first in the day. And the title of my presentation is What After BDS, or as I say, BDS is a launch pad, right? So as you are, so you know there is a of people, somebody BDS or preparing. Few people whose parents probably are doctors, dentists, they probably have the first option that they take BDS by choice, but generally it's we the line, and a lot of people uh, BS over MBBS at many places, right? But then now you are in a stage where you have completed your BDS degree, so you are at whether you want to start earning, or whether you want to learn. You want to learn more and more, right? There are people who may have loans, or they may have some family commitments, or due to any reason they want to cousins and your friends who have gone into engineering or other branches, and around the same age they are or 2 years in service in a corporate or a multinational, and they are earning well. So you feel that yes, I should also start earning as early as possible. But the thing is, for a doctor, a dentist never retires. So you will be earning till you can work. But the other professionals, they do fade out even in the engineering field. They have a stage after which they generally retire, or their progress fades off. But a dentist or a doctor, as and as they become more and more senior, their experience increases and probably their practice also improves. So that should be considered. And the second thing is, why I want you to go more towards the learning aspect is, medical is a profession wherein you have to learn a lot. You specialize. Human body is very complex, so you have already specialized in head and neck, but within head and neck there are super specialities. You can pick one aspect of dentistry and super specialize yourself in that aspect. So what happens is, many people, there are basically three options with you. You decide that I will start earning and I will proceed with earning. The second is, no, I will continue and complete my education, and then only I will start to earn. And the third option is that you say that, okay, let me start earning for a few years, let me settle down, let me clear my loans, let me fulfill my commitments, and then probably after a few years I can always pursue my masters or any other program which I feel. And I think all the three options are valid based on your you start earning. So let us start. I don't want training period, and once you complete your internship, ideally you are trained well enough to start a dental practice all by yourself. But at times you can definitely work for some place and gain a little more experience, but it's all your personal choice. At a dental clinic, you are your own boss, but then again there are advantages as well as disadvantages to the aspect. Being your own boss means you have to ensure that you are generating good amount of revenue to sustain yourself. But very frankly, any business, when you start, it may take at least 6 months to probably break even, right? So you should have some investment amount with you and a backup for at least 6 months, which will sustain you in a way that you can then try to expand your business. When I started my dental clinic for a small time, I had a dental clinic for nearly 1 year, then I got into academics totally. But what I experienced was, whatever money I was earning in the initial phases, I was buying newer equipment with that and upgrading the clinic. So probably I think up to 3 years, your take home or your savings would not be great, and it is a good advice to keep investing in your clinic. Like you will upgrade your X-ray, OPG, then you'll get lasers and other equipments, right? So these are different aspects of running your own dental clinic. Where will you open it? What is the scene there? Right? How many patients? Do you have your connections there? So everything has a positive and a negative side effect, right? If you open in a hometown, you will have a lot of people who know you and they'll come to your clinic immediately. But then they'll have some reference, so sometimes it is difficult to ask them to pay the complete amount, or you have to oblige them in different ways, right? So everything has its positive as well as negative aspects when you are your own boss and running your own dental clinic. But then, as we said, that you went to earn and you avoided learning, but that is just the formal education. What I meant by learning was more of a formal education. Education is not something you can finish, right? So even if you start your own cleaning and if you start earning, it's definitely you can go ahead and you should attend CD and CME programs like this. You should attend conferences, and you should regularly update yourself, right? Because when we were in BDS, we did RCTs with K files, but presently I've seen interns trying hero shapers and pro tapers. So I have to upgrade myself with these newer techniques so that I can, even if I'm not a clinician, but as an academician, I have to upgrade myself. So what are the different options wherein you can upgrade yourself in a way that will be beneficial for you to run your dental clinic and improve your practice in a dental clinic? So there are various PG diploma programs and certificates, but there's a word of caution that how many of these are approved by the Dental Council of India, because in India the Dental Council of India is a legal authority which can give you rights to conduct courses which are legally valid in India, right? So you have to look into the legal validity, but definitely if you are talking about skill improvement and enhancement of your knowledge, you may find a lot of these PG diploma programs or certificate programs. Some of them are very relevant to clinical dentistry like cosmetic dentistry or implantology or laser dentistry. Way back in 2002 when I was in my internship, I remember Manipal University had started a certificate program in implantology, and the faculty of our college had enrolled as the first batch to train themselves in implantology. And the general trend is that the first batch they invite the international speakers, so they train their own staff, and then their staff can take those courses further. So I think that, and if I'm not wrong, even aesthetic dentistry was introduced as a certificate course in Manipal University back then. So it's been nearly 20 years since these courses are running, and I am sure you may be knowing much better as to how what are the good places which runs these courses. But if you move out of the clinical aspects, there are different other fields related to dentistry wherein you can train yourself, and there will be avenues there. So the first is forensic dentistry, and I am sure CynoDent have their own programs for forensic odontology, and also the Indian Academy of Forensic Odontology have IBFO, which conducts forensic training of 6 months at various institutes. So forensic dentistry is a field related to dentistry which is quite interesting and has some scope as of now because it's a new branch. And then the other fields are sports dentistry and space dentistry. These are very new terms, but definitely if you talk to me, like public health dentistry, as we say, 30 years down the line, there were no people who were trained in public health dentistry, or maybe 20 years down the line, there were no people who knew about forensic dentistry, right? So you all can be the pioneers of areas like sports dentistry or space dentistry with the proper training, which probably may not be available in India right now, but you can train yourself in these two areas and then get these two branches to India, and you'll probably be the pioneers for establishing such areas of exploring such areas of dentistry, right? So that was about being your own boss, but then a lot of people may not have the investment amount with them, the capital to open a clinic, set up a clinic and run it, right? So what you could do is you can look for a job where you'll work under somebody as a dental surgeon, as a BDS doctor. So the avenues there are like, I think the favorite is Indian Army, and recently nowadays they they call the top 1,000 NEET rankers, and then they have a very strict interview, and if you fulfill their criteria for medical fitness, you may be selected for the Indian Army for on short service commission, and then as I said, it's another avenue wherein you can work for a few years and then you can pursue your masters within the Indian Army institutes itself, right? So it's definitely, I hope, Indian Army is definitely one of the top jobs which you can get after you complete your BDS. Then also we have the state government jobs at PHC level. The dentists are being recruited in different states, and even in Madhya Pradesh, 3rd July there's a exam and a lot of people are writing that, and they'll be selected for the not under the medical education department but under the Department of Health and Family Welfare for these government jobs which will be controlled by the state government. And then Railways has a few posts for dentists, and ESIC hospitals and various other government bodies do give jobs to BDS, can be contractual or can be a full-time job. Also, a lot of corporate hospitals do employ dental graduates for their regular work, and they may have specialists as well, but for the regular work in the dental department, you can find a job as a dental graduate itself. And then the last is dental colleges. Way back in 2004 and 2005, I served as a tutor after my BDS at Seema Dental in Rishikesh. So even that time, the Dental Council of India requirements were such that they needed BDS for starting BDS courses. So there was good scope then. But of late, what is happening is a lot of colleges are going for post-graduation, and in the newer regulations of MDS, the role of tutor is diminishing slowly. So I'm not very sure about the dental colleges, and that's why I've kept it at last, because the dental colleges would prefer postgraduates over dental graduates for jobs there. Now, these were the job opportunities in India, but there are also job opportunities abroad, and I know a lot of dentists do try for this, and even in our place a lot of them do clear international exams and practice in various parts of the world as a dental graduate. So I think the top 5 are UAE, Australia and New Zealand. They have a common exam, and UK US, I guess probably every state has their own different rules and regulations. So you should know those rules, clear the exam, and then probably get a license and practice dentistry in those countries. So we don't want to study further, but we are dental graduates and we have some bit of knowledge about medicine and a lot of things. So beyond clinical dentistry also there are some jobs which you can explore. So what are the different career options for a dental graduate? So what are the jobs beyond dentistry? So something like a medical writer. So you can write, there are companies who can hire you for writing short articles on related to medicine and dentistry and other aspects of health. You can become a dental blogger, so that again can generate some income for you. You can also get into the medical transcription area, so wherein you may get probably audio clips from US doctor and patient conversation, and you have to type it in English in a medical, convert it into medical terms, and write it so that it becomes a concise document on which a doctor can act, right? And then you have avenues with respect to medical tourism as well. So you can explore dental tourism and medical tourism and work as a consultant for guiding international travelers in India to get proper treatment when they are visiting India. And then bioinformatics and is a new branch, and biotechnology. All these are different avenues wherein your training as a dental graduate, right? So you have some basic training as a dental graduate, and which includes a lot of medical terminology. So how are you going to use those that knowledge together with the technology people, the information technology people, to develop something? And we know everybody is developing vaccines and newer equipments and newer machines. So there's still a lot of scope for bioinformatics and biotechnology in times to come. And you're definitely, as a BDS graduate, you have an upper edge in these jobs compared to other graduates, right? So these are the then options within there. Now, the other option which I said is at the crossroad. No, you don't want to start earning immediately, but you want to spend some more time and get to learn more. So, if you plan to learn more, then the first and the straightforward choice is doing an MDS. So, after we have 9 branches which are recognized by Dental Council of India. A few of them are clinical and some are non-clinical. So you can select some of these branches and pursue your masters in that. So I am sure, but the trend changes every year. So some year the prosco is the topmost demand, and some ortho, sometimes it's oral surgery. So it's all trend changes, but definitely based on your NEET rank and which state you are and how the counseling goes, you'll select a branch. So at my level, I am involved with the counseling procedure. Both I have been in the counseling committee of the state government, and presently I am at the college level. I do take care of the counseling and admission, so I have an idea as to how things go and how students select branches, right? So I've seen many a times people do take government colleges for a good stipend, and then they always have options to prefer a clinical branch. But at some point of time, there was a huge demand for non-clinical branches as well, because there was a lot of job opportunities in respect to academics in the dental colleges. So that was the phase when even the non-clinical branches were doing quite well. But of late we have seen that it's the clinical branches, and definitely still I have seen a lot of people who have their own personal preferences as well, right? So some people have personal preferences and they do pick up branches of their choice, and I would suggest that because during the 5 years of training of BDS you are exposed to all the departments. So wherever you find it interesting, you can go ahead and choose that branch. Personally, for me, I have been a student of Dr. Soben Peter. We have seen him perform. He was an international faculty, very vibrant personality, right? So I have seen Dr. Soben Peter work, right? So I would not say public health dentistry was my first choice, but it was my top 3 choices. Among the top 3 choices for pursuing MBS, I had public health dentistry. So that's one reason. You definitely, there are a lot of factors: the infrastructure of your college, the faculty with whom you get interact with, and your personal choices. So all of these will decide which subject you would take for an MBS course, right? Now the other option is, and I think a lot of you were waiting for this when I talk about what after BDS. I think a lot of you are looking for these options, which I'll cover in the next 4 or 5 slides. You all feel that the dentistry world is small and there's not much, like this fish, there's not much to swim around, and you want to get into a bigger bowl and explore a bigger and better world with more and more opportunities. So, do you think you should change for better? Yes, obviously, right? Because it's not something, even if you complete your BDS, you would be somewhere around 22 to maybe 24, 25 maximum. So you are supposed to work for another 40 years, right? So what field or what you will do should not be based on what you did for the last 4 or 5 years. But if you feel that within the dentistry you are not finding yourself enough freedom and enough space to move and develop your skills and all that, so it is a good time to change for better. And now there are many things which you can do. I'll just enumerate a few. So the first is public health. And as we know, we have masters in public health. But the masters in public health, BDS is one of the prerequisites for MPH. So your basic knowledge of BDS would definitely help you in your MPH. And especially if you have read the book K-Park, a lot of things are from K-Park which you will be reading in details when you are doing your MPH. Now, the two options which are available to you are going abroad to do your MPH or doing it in India. So, which are the best countries to study public health? My suggestion is, if you are going abroad, look for a course wherein the placement is good, because you would be earning a good amount of money. You will be spending in dollars for your education, tuition fees. So you should probably work for at least a few years in the same country, earn in dollars, so that you can break even when you come back to India. So you can go abroad, but even in India right now, there are a lot of institutes which are giving good public health degrees. IIHMR is one of them in Jaipur, and KISS Mumbai is the other one. I am just naming the government institutes. And you can always go to the Ministry of Health and Family Welfare and see what are the latest guidelines when we talk about the Masters MPH course, right? So they may have these curriculums, and if the course matches this curriculum, it's a good option to pursue. Next is hospital administration. So there are basically two courses. One is MBA Hospital Administration, and the other is MHA or Masters of Hospital Administration. And yes, BDS again is a prerequisite for pursuing these courses. MBBS, BDS, and other medical students, undergraduate students can pursue Masters in Hospital Administration. And yes, there are corporate hospitals which will hire you, and there are a lot of rules and regulations which are coming by the government on how you should run a medical practice. So such a degree would be actually helpful for you. The other field, and I'm not very sure, is clinical research. Now, clinical research was it was very in at one point of time, but then due to some unethical researches which were done in India, slowly there are a lot of regulations which were imposed. Right? So very initially they said that any drug which you develop, you can try it in India. But then the government came up with very heavy regulations, and then slowly the clinical research could not flourish that much. But then again, you see that after COVID, the development of the vaccines and trial of those vaccines, right? So even we are still in phase 4 of the vaccine trial, right? So the vaccine is launched, but we are still collecting data on how the vaccine is affecting us every day, right? So clinical research, yes, again, I think it is going up because we will be coming up after COVID, the vaccine and the side effect of vaccines. So we will have another new round of a lot of research and see how the world copes up after the COVID vaccine. And yes, definitely management. When I talk about management, it's a very broad term. MBA is a course in which you invite applicants or graduates from all fields like arts, commerce, IITs and all that, right? So it's a very broad thing to do an MBA, and even a lot of BBS graduates do pursue their MBA. However, you can go for some specializations in MBA like healthcare management or health policy or public policy, right? So if you want to use some of your knowledge and skills from your dental graduation, you can select a very specific MBA degree related to healthcare management, health policy or public policy, or you can do a generic MBA and find jobs in different institutes and organizations around the globe. And now the last few slides, I would suggest that you should follow your passion. If you are a dentist, for me, when I joined post-graduation, I was my passion is to learn and teach, and also data analytics, right? So I found that when I joined public health, it gave me the platform to explore and fulfill my passion, which was data analysis, and which I am doing. So the only thing is, if there is a conflict between your inner self and what you are doing, I am not very sure how much good you can do. So I think you find what is, if you are very much into clinical dentistry, go for it. If you feel that no, clinical dentistry, I don't want, or I am very good in aesthetics, so go for things like that. I have seen even dentists opening clinics related to dental cosmetologist as well as the general aesthetics as well, right? So when I say follow your passion, I would end my last presentation. These are a few people whom I know, who are dentists, but they have followed their passion. The first one is this one is Abhi Sampa. She's a dentist based in UK, but I don't know her as a dentist. She's a wonderful Indian singer, and her Sufi music is superb. So I've been following her for the last 1.5 years. And since I listen to Sufi music, I just found her on YouTube. They suggested me, and very excellent. But later I came to know that she's a dentist. And this Akshata Prabhu, she's again in Mumbai based, but she's also into modeling. And Arupma Soni, she had come here for the Indian Dental Conference 2 years back. So we came to know about her. She's also into modeling and beauty. And the one below on the bike is Niharika. And when I was in Sudha Rastogi as a lecturer, she was an intern there. And later, from somewhere I found that she had the passion for biking, and she has pursued that and made her name in that area. And finally, all females, so I put Anmol as well. So she is pursuing her passion and taking the medical and dental education further with her venture of CynoDent. So I wish her and the entire team of CynoDent all the best, and I wish all the dental graduates all the best for your future self. And with that, I have just exceeded by a minute, so sorry for that.
Thank you very much, sir, for sharing your profound knowledge with us. I would like to request Dr. Ashish Chandra, sir, and Dr. Hemant Gadge, sir, to kindly come on the stage and felicitate Dr. Puneet Gupta, sir. I would now like to request Dr. Poonam Dholakia ma'am to come on the stage and kindly deliver her lecture.
Namaskar, Suprabhat, Sarvebhyo Devebhyo Namaha. I welcome you all on the ground of knowledge sharing. Thanks to the organizing committee here of the CynoDent. Before beginning with the knowledge sharing among each of us, let us surrender our knowledge under the goddess of knowledge, that is Lord Saraswati. So I would like to give you an example. Imagine we are sitting on the flight, flying from Ahmedabad to Bangalore. Yes. And as we approach the Bangalore airport, it's a very beautiful evening time. You see the small dimming lights of the traffic of the nearby city showing glow in the darkness. So we enjoy that moment. It's beautiful, really, yes? So with that beauty, when we end up actually landing in that airport of the Bangalore airport, तो हम क्या देखते हैं कि पूरा ट्रैफिक जैम है, तो हमारा माइंडसेट कैसा हो जाता है कि oh God, we are supposed to reach, we are running late, we have other commitments, that's a sequence that starts to occur in our mind. Few moments back, where were we? We were enjoying the same beauty, but at a distance, as an observer. So the purpose of sharing this thought is whenever we observe something at a distance, the higher the ability of understanding any problem or the surroundings, the easier is the process to go through it. Be it any topic, be it any situation, be it any circumstance, it becomes very easy. Easy with respect to going through that process, it helps us to build up the patience, first thing, as a person. Second thing, it saves time. We just have to maintain that momentous beauty throughout. जो हमारा inner self में जैसे डॉक्टर पुनीत ने mention किया था कि if your inner self is balanced with what you're doing, then nothing is complicated. Everything becomes easy. So, when it comes to decision making, now there are two aspects. We'll follow everything two. Generally, the aspects, perceptions are two. जब भी कोई पेशेंट आता है हमारे क्लिनिक पे या हमारे प्रेमाइसिस पे या हॉस्पिटल पे wherever you are working, they come with lots of hopes. They still think, अभी भी यहाँ पे ऐसे लोग हैं जो सोचते हैं कि डॉक्टर भगवान है. Yes? तो कुछ जगह पे इसको प्रोफेशनलाइज भी किया जा सकता है, कुछ जगह पे उसको नर्चर भी किया जाता है, यही थॉटफुल. So when you see that willingness of the patient as your own, तो वो जो ब्यूटी का पॉइंट है वो इजी हो जाता है इम्प्लीमेंट करने का. Always remember that momentous beauty whenever you are working anywhere in any situation in the most complicated, nothing becomes complicated. It's all in the thoughts. What we are doing is we are adding thoughts to the life. You just have to reverse it. If we add life to whatever we are thinking, to whatever we are hearing from the patient, अगर patient कहता है कि मुझे दांत निकलवा के नया लगाना है, तो that is his willingness. Will power अगर patient का strong होगा, तो that adds to the motivation to the operator. Be it the dental surgeon, be it a specialist, anyone. तो वही motivation से एक चीज क्या बचती है? Time. You get more focused to what they want without going into much detail. First thing. तो decision making वही simple हो जाता है. You don't need to go into the chain or hierarchical trees, right? Now there are two ways to decide. One is analytical, another is intuitive. Analytical, usme that is more based on the literature, facts and figures, which one knows. And intuitive, matlab based on the experiences, judgment and the instincts, following your instincts. But if we combine both, analytical as well as the intuitive aspect, then comes the factor time. Implementation. Yes, you know your skills well. You know you can do it. So what you have to do, you just have to follow in a right path. Correct direction, guide the patient accordingly. So main thing important here with respect to time is the counseling. How well we are able to convince the patient for this IIP. Okay? Now again for this procedure, there are two ways. One is patient dependent, another is operator dependent or the doctor's dependent. So there are many factors which actually influence the decision making whether to do or not to do. What factors will actually affect the therapeutic outcome of the immediate implant placement. Now, why immediate implant placements? Immediately after extraction, when we see there is more loss of the bone with respect to the width as compared to the height. Yes. Now, preservation of the width is of more importance. दांत निकालने के 3 महीने में ही more than 50% of the width loss takes place. So when hard tissue loss is accelerating at this pace, can we correlate it with the soft tissue loss as well? Yes, right? So what is the first choice of preservation for this case? Width, horizontal width, yes? So why immediate implant placement? Point 1 to maintain the bone volume. Then second point, to allow a stress-free healing period. Yes. And to cut short the treatment time. Reduce the time of edentialism, shorter treatment duration. The negatives of the delayed implant placement can be the positives of the immediate implant placement, right? And as I discussed, the mindset, psychological impact. It all begins how beautifully you counsel the patient. That saves your time as well, and for the patient, it's a win-win game. Yes? Now, talking about the complications, अभी मैंने एक पॉइंट वही बोल दिया कि अगर आप वही ब्यूटी लेके हर जगह वर्कआउट करोगे तो क्या ये सारे पॉइंट्स पे मैटर करते हैं प्रैक्टिकली स्पीकिंग? Yes, that beauty will motivate you to further excel in the placing the placements in these conditions as well. There are survival rates, successful survival rates as well of the implants in these cases, ranging from 95 to 98%. Yes. So what are the two main aims for the IIP? One is restoring the health and function so that patient is able to eat well. Second is aesthetics, where the tissue biotype is of higher consent. Now, these are a few points which help us to diagnose the IIPs, the cases where we can do the IIP. Case selection is of paramount importance when it comes to deciding the IIP. For every nature of the socket, there is modification in the procedure. This is one indication. Failed endo with periapical pathology. This is another case where we can attempt. These are a few clinical photos which indicate the inclination for the procedure. This is another case. See, everywhere it's the front teeth, aesthetics. Again, crown root fracture, failed endo. So the success of this procedure begins right from the reason of the tooth loss. So focusing on each and every detail, picturizing them, visualizing them, and then it's like a mind map. वो आपके mind में पहले ही आ जाएगा कि in this case what will be the long term outcome of whatever you are going to do. So it starts from why. Reason for tooth loss, furcation involvement. So there will be alteration in the bony tissues in the socket at the perca level. अगर root insufficient crown root ratio है, तो architecture कैसा होगा? There are again architecture में दो ही तरह के होता है, एक bone होता है और एक gums होता है. Yes? See, this is a case, another case indicative of the procedure. Furcation loss, GD, root stumps, failed endo. Then available bone is another parameter which should be taken into consideration. How do we evaluate the available bone? Based on the CDCT sectional layer. We can easily appreciate the width and the height, also the available bone right from the apex of the root to the apical area of the bone. So a minimum of 4 to 5 mm of bone width at the crest. So first criteria is 4 to 5 mm of the bone width should be present, and 10 mm of the bone length from alveolar crest to the safest distance. Safest distance, that is 2 mm above the closest anatomical landmark. Zone of safety. If this is closest anatomical landmark, at least 2 mm of the distance should be left behind. This is actually the formula that will help in determining the length of the implant just by knowing how much bone is present right from the crest of the alveolar bone to the safest point in the anatomical landmark. Zone of safety, that is another parameter. So satisfactory aesthetic result in the aesthetic zone requires the interproximal bone height to be 5 mm or less. So how do we measure the interproximal bone height? From the contact point to the adjacent bone. Now criteria for case selection. First is achieving primary stability. These are the basic aims. Okay, first is achieving the primary stability at the apical area of the base of the implant. Then bone quality and the bone quantity to achieve predictable results. Then anatomical site considerations and external site, extraction site morphology. That is the nature of the socket itself, because that socket will act as a guide and determining the parallelism of the implant positioning. Then maximizing aesthetic results in soft tissue maintenance, surgical technique, the presence of any periapical infection or the pathology, and implant design. Now there are 5 rules or the triangles, you can say, in the decision making process. For primary stability, at least 2 to 4 mm of the bone should be present apical to the, at the most apical area of the alveoli. So, in order to have a greater possibility of a stable anchor and thus stability, it can be enhanced by the tapered design type of the implant. Then second is presence of the buccal plate. At least 2 mm of the buccal plate should be present to allow the proper contouring of the soft tissue and avoid further aesthetic complications. So presence of 2 mm buccal plate is crucial to avoid soft tissue recession, and the horizontal buccal bone width of at least 2 mm should remain at the end of the resorption phase. At least 2 mm of the buccal bone width should remain at the end of the resorption phase, allowing for the conical peri-implant bone resorption to remain inside the width of the bony wall. So, the mean vertical difference between buccal and lingual alveolar crest was approximately to be 1 mm. Then another is the jumping distance. Jumping distance is the distance between the implant surface and the inner bony socket wall. It can be present or absent. Two aspects again. It can be present or absent. With respect to this clinical scenario, there is no jumping distance present with respect to this clinical scenario. Am I audible? Yes. So when it is not present, when the horizontal gap is not present, means there will be primary healing. Okay. And when the horizontal gap is present, then what we are supposed to do, whether we have to use the graft or not, bone graft, that we'll discuss again. As you can see, the gap is present here between the implant wall and the inner bony socket wall. So, how to cover? Now, what should be the value for this? If it is more than 1.5 mm or more than 1.5 to 2 mm, then it is indicative of the bone grafting procedure. So in order to compensate for the expected horizontal bone resorption of the buccal plate, the use of bone substitutes with a low resorption rate has to fill the gap. As you can see here also there is a gap. We have done the grafting and will close the site. Eventually there will be bone remodeling, new bone formation, fill the gap, stabilize the implant, achieve the osseointegration, yes, and then plan for the second booster. So what are the benefits of filling the gap? What are the benefits of closing the jumping distance? One is there will be hard tissue healing process that is modified, right? Because we have added the bone graft. Then another is recession can be prevented because we are preserving the bone, and the bone and soft tissue walks together. They are never up there, never down. They are together wherever they go. So it helps in preserving the soft tissue as well. Yes. And there is an improvement of the marginal bone to implant contact. So here in this case also after immediate extraction, atraumatic extraction, you see the gap. The gap can be present on any aspect, be it buccal, mesial, distal, palatal. It can be circumferential as well. But even in those cases, whether we have to graft or not to graft, again the question remains. So implants with horizontal distance of less than 2 mm, spontaneous healing and osseointegration takes place, provided the texture of the implant is rough. Yes, and if the horizontal distance is more than 2 mm, it helps in achieving the bone healing by bone fill. Okay. But what is the again texture of the implant here? It's different. So the nature of the implant, the type of the implant also affects the healing process. So when to consider bone grafting procedures around the implant, again you see there is like on long term, there is slight exposure of the implant on the labial aspect of the front tooth. So here not only bone grafting but soft tissue grafting may also be required. So when there is residual exposure of the implant body, or when there is translucence of the implant on the labial or the buccal bone, be it any region, then or if there is primary closure of the soft tissue flaps, or when vertical releasing incision is necessary, then grafting needs to be done. Fenestration or dehiscence case. See, we have achieved the primary stability of the implant by engaging it in the palatal bone as well as the apical bone, but there is no bone on the buccal aspect. The buccal alveolar housing also plays the important role in preserving the soft tissue and creating a beautiful marginal gingival collar around. So, in dehiscence of fenestration cases also, grafting needs to be done. Sorry. Now, when there are circumferential osseous defects, these are a few cases where grafting can be indicated. I am just showing you the clinical scenarios, how different it could be. Each type of jumping distance may vary from another. See here this is in the molar side. We have achieved the stability by placing it in the interdental septum. Yes? In this side, here the premolar extraction was done. So we have achieved the primary stability by placing the implant in the palatal socket, not the buccal one. So we have done the grafting in the buccal area. This is the defect. This is a case where the defect is circumferential. The title and the picture, they are very well correlating. Circumferential is not only on one side; it's on the mesial as well as on the distal. Then another is tissue biotype. Thick or thin. There is a periodontal probe, yellow color का probe आता है, वो use होता है. अगर visible है, मतलब जो biotype है, that is thin. When you insert the probe through in the mid-labial region, and if it is visible through the gums, it means the tissue biotype is thin. So again, the question comes whether we should go for IIP or not. Yes? And if we go, then what modifications needs to be done? And if the probe is not visible, then it will be thick biotype. And the implant design, different implant designs influence the biomechanics of the environment when immediate implant is placed. To ensure primary stability, self-tapping implants will develop which compress alveolar bone as the implant is inserted. Now, what are the advantages of this? These were the 5 rules that help us to decide whether to proceed with the IIP or not. Now, what are the advantages of doing the procedure? First is patient acceptance. If patient for the socket itself acts as a guide for the placement of the implant in parallelism to the adjacent tooth. and surgeon can position the implant more favorably than the original position, facilitates spinal restoration. Here's the direction of the placement of the implant should be prosthetically driven. That needs to be taken care of always, and minimizes need for severely angled departments of fabrication of the copings. Then implants in extraction sites can be placed in the same position as the extracted teeth. The long axis of the tooth that was present, failing tooth, can act as a paralleling guide for the implants at the same size. तो हमारा जो इमेजिनेशन होता है कि इम्प्लांट का एंगुलेशन ऐसे होगा वैसे होगा, वो वहीं कट ऑफ हो जाता है. पॉइंट नंबर 6, क्योंकि हमको पता था, वी हैव अ पिक्चर, वी हैव सीन द फेलिंग टूथ कि उसका एंगुलेशन कैसा था. तो अगर वो माइंड में है तो इट विल बी वेरी इजी. तो हमारे जो नेचुरल टीथ है, दे आर acting as a guide to allow us to do the procedure in a better way. We don't need any other guide. Everything is there in front of us. Everything is there in the patient's mouth. We just have to be present with full stability and you'll get the result. Maintaining the soft tissue profile. Prevention of the bone loss in both vertical and horizontal direction. If the soft tissue profile is maintained, if the bone is adequate on both sides, you have beautiful alveolar bone of the socket present circumferentially, then that will prevent the further bone loss and allow the aesthetic outcome. What could be the disadvantages here? It is thinking in a more better way. It is actually technique sensitive. More skills are required, especially when doing it in the anterior region or aesthetic region. And sometimes extensive soft tissue manipulation is also needed depending on the case. Or the site morphology, again, it can be a misnomer that it may complicate the optimal implant placement and affect the anchorage, and thin tissue biotype may not be a good indication for IIP at times. And potential lack, the potential lack of keratinized mucosa again for the flap adaptation, and the cost factor for the grafting. So, as we have discussed the indications and the disadvantages and the advantages, so contraindications will be the missing soft tissue, fenestration, dehiscence, lack of the buccal bony wall, or absence of the adequate apical bone, alveolar bone, inability to attain a restoratively driven position, the angulation and depth of the implant, and unfavorable extraction site morphology. So these are the ideal indications where we can proceed with the procedure, that is the aesthetic zone, anterior, as I said, we have more predictable response in the posteriors. Then soft tissue bulk, we have good amount of area present in the anterior area. Then resolution of the pathology. First you have to rule out what is abnormal to bring to the normal. Then compromised buccal plate. Soft tissue bulk and pronounced scalloped biotype. The pictorial margin scalloping should be uneven, or should be even and good. So these are the different clinical scenarios which further affect the process of doing the procedure, that is only implant needs to be placed, or only implant with the bone graft needs to be placed, or it is implant plus bone graft plus soft tissue graft, or only implant with soft tissue grafting. Mostly connective tissue graft is said to give the more predictable results here. The site for the connective tissue graft is palatal or the tuberosity area. So in this case, the buccal bone is intact, as we can see. The buccal bone is intact. The soft tissue is also very good. So flapless implant placement was done. This is another case where the atraumatic extraction is done beautifully. This one picture itself demonstrates atraumatic extraction to preserve the soft tissue. We have bifurcated the root stumps, and with the support of the interdental bone, we have placed the implant. Then another case where the buccal bone is thin with more scallop gingival biotype. So again, here the IIP was combined with the CTG. That's a staged approach. And in this case, as we can appreciate in this clinical picture, you see that there is missing buccal bone. So here, deficient buccal bone within the housing and indicated to have limited acceptable results with IIP with GBR and CTG. We can perform the procedure, but the long-term prognosis is still questionable here. These are a few cases where here we see there is no buccal bone present. We have done the augmentation procedure, graft placement, membrane placement, suturing and closing. Then here also the cases where the procedure may not give significant results. So these are the cases, it's like yes or no, which cases to do and which cases not to do. तो ये उसमें से एक है कि हमें कौन सा नहीं करना है, वो भी हमें पहले मालूम हो तो हमें पता चला कि हमें कौन सा करना है. So there is deficient buccal bone deviating from the alveolar housing, and implant placement within the remaining palatal bone may result in off-axis implant position. So if performed immediately, the long axis of the implant inclines towards the buccal and will result in a significant aesthetic compromise of the definitive restoration, in this case, class 4. So for such cases, delayed approach is advised. Now these are a few positions, 3 positions: ideal, towards palatal, with primary stability, and prosthetically driven. Then acceptable, these 2 are the acceptable positions and this is the incorrect position. The picture itself depicts कि हमें किस डायरेक्शन में अप्रोच करना चाहिए और कहाँ पे नहीं. ठीक है, ideal, acceptable and wrong. So to correct this problem, the profile extending from the implant head to the gingival margin requires a straight or negative angulation. Immediate placement generally cannot be performed in wrong position without aesthetic compromise. Even if we plan, the aesthetics will be compromised. So then there are some hard tissue variables like the height of the alveolar bone, which can affect then available bone. This is how we check for the available bone in the CT clinically. It should be more than 4 mm. The palatal angulation less than 5 degrees should be ideal for placing the implant positioning. Otherwise, more than 5 will get the compromised results. Again, treatment recommendation based on the purpose classification. type 1, 2 and 3, adequate, compromising, deficient. Whenever the so if the soft tissue and hard tissue are adequate, we can definitely go with the procedure. When compromised, immediate or delayed approach with simultaneous regenerative procedure a good choice. And if it is deficient, then we'll have to wait for the area to heal by soft tissue or hard tissue augmentation, followed by orthodontic procedure. Now the surgical procedure, first atraumatic extraction is performed. There is an instrument specially designed for atraumatic extraction, that is periodome. With the periodome will incise the transseptal fibers, that is transseptal fibrectomy is done. That will loosen the tooth with the adjacent periodontal fibers. And with the gradual luxation, we remove the root stump. And the clinical situation will dictate if the tooth should be removed flaplessly or not. If the margin, if in case of fractures, it may not be removed flaplessly. And in the aesthetic zone, the buccal flap should not be elevated to avoid recession after the treatment. So this is the instrument periodome. The working end is gradually inserted, luxated, and it is inside used for incision. After extraction, the site is thoroughly degranulated, if necessarily with a large round burr, and the socket should be carefully examined whether the walls are intact. The apex of the socket should be penetrated for implant placement, and special attention should be paid to preparing the recipient site for parallelism and significant extension beyond the apex. This will ensure the stability after proper alignment of the implant. So here only main 3-4 points are there which needs to be taken care of. One is the base of the apex, the available bone at the apex, the angulation or the parallelism of the implant, which can be still under the operator's hand, and the stability after proper alignment. Now we can always verify the parallelism of the implant while drilling first, that is using the surgical guide. Okay, you can take an X-ray and verify whether the pin is going parallel to the roots of the adjacent tooth. Or surgical guides are also used to do the drilling. The implant should usually exceed the diameter of the root, providing mechanical retention. And it is advisable to place an implant a minimum of 3 to 5 mm apically to the bone. And it is possible to place a tapered implant into an extraction socket with minimal to no osteotomy preparation, thus relying only on the implant thread to engage the lateral socket walls. The stability of the implant can always be checked on long-term basis using the RFA. This is a few literature supporting the use of the bone graft to cover the jumping distance, as I already mentioned. So in practice, when a bony gap is present, no effort is made to surgically advance the flap. There is no need for the flap procedure. It's separate to place a bone grafting. Only a small amount of allograft or alloplast. You can use DFTBA, Rocky Mountain or Tata. Then Nova bone is also most commonly used. You can use TCP or BioOS. And the material is left exposed within a few weeks. Some of the material may exfoliate and gingival mucosa will migrate over the exposed material, providing an uneventful healing. So we have to make sure that the material does not remain exposed at the working site. It is important to recognize that the placement of bone or bone substitutes with or without the membranes may support or improve soft tissue contours. It cannot only be relied based upon the osseointegration. Now, what are the takeaway recommendations when considering which implant protocol might be most appropriate? The clinician must take into consideration the few factors. One is the patient-oriented, that is intrinsic factors, extrinsic that are under the operator's control, and the anatomy of the extraction site. As for any other surgical implant protocol, the patient should be free from oral infection, as we know that sterilization is of paramount importance. And in patients affected by systemic diseases influencing wound healing after implant surgery. So in terms of location, the factors of major concern are the thickness and the integrity of the bony socket walls and the gingival biotype. So whatever interplay we have to do is only between the two major factors, the bony architecture and the soft tissue biotype. The implant placement must therefore be guided by the ideal prosthetic position as well as by the assurance of the primary stability in the apical portion of the socket and the creation of an adequate gap dimension between the implant surface and the inner buccal bone plate in the coronal portion to allow for adequate bone healing. So we may sometimes fall late to learn anything, but it's never too late to be an immediate beginner. So I hope you guys got a good takeaway message from this lecture. Thank you for your patient listening.
Thank you very much, ma'am, for sharing your insightful knowledge with us. Now, I would like to call on stage Dr. Anil Sharma, sir, reader at Department of Conservative Dentistry and Endodontics, IDES, Gwalior. So, please come on stage.
A very good morning to all of you. I myself Dr. Amit Sharma from Gwalior and would like to thank you, the team CynoDent, to invite me here. Now I will share some of my cases. It's about the healing and regenerative process in the endodontics. Hello. Hello. और किसी भी स्लाइड को शुरू करने से पहले हमेशा मैं प्रभु श्री राम का नाम जरूर लेता हूँ. Hello. So moving to our topic, सबसे पहले श्री राम का नाम लें. जय श्री राम. So what is endo? Simply कहूँ तो endo is a root canal therapy, everybody knows. और जनरल डेंटिस्ट्री में गए तो क्या है रूट कैनाल? पेशेंट आया, ओपन करो, बीएमपी करो, इरिगेट करो, ऑब्चुरेट करो. But it's not all about endo. If you talk about endo, then or anaerobic bacteria within the canal, and then you have to seal it. As per my topic, the first time the use of antibiotics was given by Dr. Grossman. Everybody knows Grossman. It was given in 1951. Then in 1996, Dr. Hashino and others gave the concept that each antibiotic has a different role on different bacteria. Then in 1996, Dr. Sato and others developed the concept of triple antibiotic case, which consists of metronidazole, ciprofloxacin or minocycline. And here it is. It is the combination of ciprofloxacin, minocycline and metronidazole. Minocycline you have to take it 100 mg, cipro you have to take 200 mg, and metronidazole you have to take 500 mg. It should be mixed with 1:1:1 ratio. As per the studies, if it is mixed with normal saline, then when we put it in canal, it gives results. But as per my experience, I have used it. If it is mixed with local anesthesia without adrenaline, it gives very far away very good results. Now what is composition? if it is mixed in 1:1:1 ratio. Metronidazole, ciprofloxacin, minocycline. Minocycline easily available नहीं होता है, you can use doxycycline. You can also use it. Now what is metronidazole? It is, everybody knows about it. Pharma सभी पढ़ते हैं. It's a very good broad spectrum. It is very toxic to anaerobic microorganism and it's bind with DNA to disrupt the helical structure of that bacteria. What is minocycline? It is a derivative of tetracycline. But disadvantage क्या है इसका? Also discolor your tooth. Tooth staining. It is a semi-synthetic derivative of tetracycline within the similar spectrum of the antibacterial activity and also give very good result against gram negatives. What is Cipro? It is fluoroquinolone with a rapid bacterial action and has a very potent activity against the gram negative bacteria. And in case you are working or you are doing practice in rural area, you can't get Cipro, then you can replace it with amoxicillin plus potassium chloride. Simply कहीं augmentin mix कर लेना. Because the combination of amoxicillin and clavinic acid has been found to be against 100% of the endodontic bacteria. Even I have used it. That's why I have added this. And it was justified by Nikita B and others and was published in Journal of Endodontics in 2012. Its high concentration has a harmful effect against the stem cells from the apical papilla. Now move on to the indications. To dry the wet or weeping canals, to eliminate any remaining microbes, to render root canal contents, and to act as a barrier against the leakage from inter-appointment dressing during the symptomatic cases. What is the leakage? Anybody knows? लीकेज अगर होगा तो इन्फेक्शन वापस रैपिड स्प्रेड करेगा. How to apply it? It is used against the revitalization and in regeneration process, as I already told you during my first slide. So how to apply it and what we do in our first appointment? According to the American Association of Endodontics, the protocols are first appointment, and in the first appointment you have to assess and disinfect the canal. Got it? Assess करो, disinfect करो. केस सिलेक्शन कंफर्म हो जाएगा. डिसइंफेक्शन के बाद स्कैफोल्ड करो, सील करो. Sorry. While doing this, we have one thing in mind. Due to minocycline or doxycycline, this thing causes stain. So how to prevent that stain? You have to use dentine bonding agent, which is easily available in the clinics. Because if you go through the study, you can use MTA, you can use biodentine and other materials which are not easily available, especially for the beginners. But dentine bonding agent composite kit तो सबके पास होती है यार. So you can apply it within the coronal structure after doing the SS opening. You have to cure it. After that you have to put the triple antibiotic paste up to the apex. You have to change its dressing from 15 days to 21 days. 2 to 3 weeks, 4 weeks. तक हमारे को यह ड्रेसिंग देना है. Got it? In the second appointment, we have to assess and respond to the initial treatment. If there is any sign and symptom of the persistent infection, and we have to consider additional treatment within the antimicrobial or alternative microbial, we have to recall the patient. Simply dressing change करना है. 2 से 3 ड्रेसिंग देना होता है, हमारा काम हो जाता है. we have to irrigate. Most important thing is irrigation. A very good copious irrigation should be done, because you are not using in a simple case. If you are going or you are opting to triple antibiotic case, then simply I have to say one thing, that case is complex. Either it is space infection or it is a cystic lesion. क्योंकि ऐसे केसेस में इंटरकेनाल मेडिकमेंट्स जो बाकी के आते हैं, लाइक कैल्शियम हाइड्रोक्साइड हो गया, मेटापेक्स हो गया, दे आर नॉट सो गुड. दे गिव रिजल्ट्स बहुत लंबा टाइम लेंगे. So you have to do very good irrigation. You have to do irrigation with normal saline. After that 2% chlorhexidine, and you have to do irrigation with EDTA to remove the smear layer. Yeah. And then you have to dry it with paper corn and then repeat the dressing. While you do the dressing, what should you do? After doing the access opening, pathfinder should be used. 10 number, 8 number, 15 number, whichever you want. But you have to keep in mind one thing. After taking the working length, suppose there is a trauma in central incisor. Patient having a history that you are stuck with football or cricket ball 5 years ago, 6 years ago. Now he is having swelling or he is having pain. He has broken tooth. Now you want his treatment. After having his CBCT or RBG, you find there is a radiolucency. You confirm it with a CBCT, there was a cyst, okay, and it's grown up now. Now what you do? After doing the SS opening, taking working length, you should go beyond the apex, up to 2 to 3 mm. Yeah, that should be painful, but by doing this, you have to bleed the canal, and after that, all that debris and necrotic material will come out of the canal. You will do the copious irrigation, as I told you. Then we place the intercanal medicament there. And what will we do in the last? The follow-up of the case. The clinical and radiographical examination should be done. There should be no pain, no tissue swelling. Resolution of the apical radiolucency should be reduced. Increase in the width of root and increased in the length of root should be observed before we do the final packing. Now I was talking about space infection cases. Have you heard about this thing? Space infections? You heard about it? Okay. Triple antibiotic paste dressing should be changed every week until the elimination of the symptom of the facilitated bone healing. I told you about changing the dressing in 15 to 21 days, but they are not for cystic lesion case. If we move to the space infection case, it should be changed within 7 to 10 days. And in the cases of space infection, the triple antibiotic results shows the result after 10 days. One of the case. There is a case. You can see this. This was pre-operative radiograph. Then its working length was determined by using apex loader. Then here was master cone. Because हम apex के नीचे गए थे, master cone आना ही था ऐसा. ठीक है? मास्टर कोन जब ऐसा आया तब हमें पता चल गया कि हमें कितना जीपी कट करके ऑब्टुरेट करना है. देन this was the obturation. See, it's gone. Here it was. Now कुछ नहीं है. And this is the healing. Width is increased. Here is another case of mine of this case infection. You can see the phoenix-like area. You will see. Then its working length was taken, and then we go beyond the apex for the drainage. काफी सारा एक्सेस निकला, काफी सारा. After that, triple antibiotic paste dressing was given and was repeated every 12 days. Then irrigation was done by using normal saline, chlorhexidine, and 17% EDTA. In this, we use glide for irrigation, glide during BMP. In this case, BMP was done with hand protector F2 up to F2, and in this case, the sealer of my choice was zinc oxide ethanol, classic zinc oxide ethanol, जो हम dental colleges में करते हैं. You know the reason why I use that? Not opting for nowadays sealer are being marketed like CynoDent or EA+. Everybody have idea? Because ZOE has a property which fight against the infection and having an oxidant property to give a good result during cystic lesion, during abscess or during space infection cases. So keep this thing in mind. If you ever see any space infection case, any cystic lesion case, you should use ZOE instead of resin-based sealer. That will give you a very good result. Here it is master cone on day 36, and now lesion is gone. And I think जब सितंबर में जब ये रिकॉल्ड होगा after 3 months, जो ये छोटा सा एरिया दिख रहा है ये भी चला जाएगा. Now I was talking about last periodical cystic like lesions. Triple antibiotic dressing should be changed twice every month until the elimination of symptoms to facilitate the bone healing. During first visit, assess करो, working length लो, beyond जाओ, then कैल्शियम हाइड्रोक्साइड या ट्रिपल एंटीबायोटिक पेस्ट जो आपके पास है इजीली अवेलेबल है, चेंज करो. कैल्शियम हाइड्रोक्साइड रिजल्ट नहीं करेगा और फिर तो here is the case. डेंटल कॉलेज का केस है. कोई क्लिनिक्स पर कोई भी आदमी 3 से 6 महीने आएगा नहीं. तो इस टाइप के सारे केसेस जो ऑपरेट करता हूँ मैं डेंटल कॉलेज में करता हूँ पर्सनली इस वाले. इनने बाहर रूट कनाल कराया था, इनके चोट थी और क्रिकेट का बॉल पड़ा था इनके, तो कहते हैं ना कोरक का बॉल आता है, इनके वो पड़ा था बचपन में. You can see here the lesion. Here it is. It was 11.7 by 13.2 mm lesion. This was his pre-operative, and this was the huge lesion, cystic lesion. अभी क्या हुआ कि मैं नया ज्वाइन हुआ उधर और इसका काम चल रहा था बहुत दिनों से. लोगों से और स्टाफ ऐसे ही रहा था, नया स्टाफ था, फ्रेशर्स पास होते. और उन्होंने कहा सर क्या करें साहब निकलवा दें. मैंने कहा एक बार एक्सरे तो दिखाओ मुझे. उन्होंने कहा सर देखो ओबले से केस. मैंने कहा नहीं एक बार सर CBCT करा. उन्होंने कहा ठीक है सर CBCT हो गया, इमेज मैंने दिखाया, प्री ऑपरेटिव भी आ गया. मैंने कहा एक काम करो ट्राई मारते हैं. क्या ट्राई मारोगे सर? मैं ट्रिपल एंटीबायोटिक थेरेपी ट्राई मारते हैं. ठीक है. उन्होंने कहा ठीक है. पहले कहते क्या होगा तो नहीं कह रहे सर. प्री ऑपरेटिव हो गया 15th डे, 30th डे, 45th डे, 60th डे, 75th डे मास्टर कोन डाल के देख रहे थे हम लोग। हमने सोचा था कि ट्राई करते हैं, अगर कुछ होगा तो। नहीं हुआ। 90th डे पे दिस वाज द रिजल्ट फाइनली। और अभी इनका शायद ऑब्जर्वेशन कब हुआ था, जनवरी में या फरवरी में हुआ था। अगस्त में इनको रिकॉल करेंगे। सो एक बार इसको फिर से देखो आप, ये इस लीजन को, और ये दिस वाज ऑन द डे व्हेन आई स्टार्टेड दिस केस। सो दिस इज एज मच एज इफेक्टिव एज स्टेपुलेटेड। सिस्ट खत्म, हीलिंग चालू। Here is another case of cystic lesion. अच्छा ये वाला, ये मुझे अच्छा नहीं आता। लाइट बंद हो सकता है क्या? चलो ठीक है। सिस्ट का साइज था 8.1 बाय 7.0। ये था इनका प्री ऑपरेटिव एक्सरे। चालू किया, फिर जब हीलिंग आई तो वहाँ पता पड़ा कि इनका ओपन अपेक्स है। ओपन अपेक्स दिखना चालू हो गया, हीलिंग चालू हुई। 45th डे, 60 डे, 75th डे धीरे धीरे जो है वहाँ पे रूट लेंथ, रूट ब्रेड बढ़नी चालू हुई। फॉलोअप में भी हालांकि लंबा चलेगा ये केस, फॉलोअप इसका लंबा जाएगा, बट यू कैन सी द रिजल्ट्स। एंड दिस इज ऑन द 90th डे वी डन द ऑब्जर्वेशन। और लगभग साल भर बाद इनका एक्शन लिया जाएगा, सो दैट वी कैन कंफर्म इट रूट अपेक्स इज फॉर्म्ड और नॉट। बट दिस वाज ऑन 90th डे and its obturation was done on 95th day. MTA plug was placed at the apex, just below the apex, above the apex, sorry, and then it was obturated. Here is another case. This was the difficult one. Patient बहुत cooperative था, पर healing में time ले रहा था, मतलब समझ में नहीं आ रहा था। Here was the reason. It was maybe it's here it is. इसमें 3 दांतों का एंड होना था। Working length was taken. Then this was on 30th day. It was on 60th day. Then its master cone was taken on 90th day. You can see. And its obturation was done on 90th day. इनको रिकॉल किया जाएगा जनवरी में। तब तक इनका ये जो दिख रहा है आपको रेडियोलुसेंसी नहीं, मतलब थोड़ा सा, ये पूरा गायब हो जाएगा और वहाँ पे पूरा बोन फॉर्मेशन हो चुका होगा। So, what is biocompatibility of simple antibiotics? Is it biocompatible with human body or not? Dr. Evaya and others told about metronidazole and ciprofloxacin that it caused the pathosis healed and increase in the root length. Dr. Branch and Trope told about the apical pathoses healed and root length increased by using metronidazole, ciprofloxacin and minocycline. But what are the drawbacks? It may stain the tooth, जैसा कि मैंने पहले बताया. It can cause allergic reactions and concentrated triple antibiotic paste may cause bacterial resistance. भाई टूथ स्टेन के लिए तो आप जो है वहाँ पे डेंटिन मॉडलिंग एजेंट लगा दोगे, टूथ स्टेन बच जाएगा, ठीक है। आगे एलर्जिक रिएक्शन के लिए क्या करोगे? किसी केस में सिस्ट इन्फेक्शन है और अपने को समझ में लेना है, केस भी अच्छा करना है, अपना नाम भी खराब ना हो, क्या करना है? तो कुछ नहीं, 1 दिन का समय लगेगा। ऐसे पेशेंट को एक बार लैब पे भेज दो और उसका वो करा लो, ड्रग एलर्जी टेस्ट। उसी केस से ड्रग से एलर्जी है, क्योंकि तो थर्ड वाले केस में एलर्जी आई थी, सिप्रो चेंज करके उसको उस केस में हमने एमॉक्सिक्लेव यूज़ किया था थर्ड केस में। उसको जब सिप्रो वाला ट्रिपल एंटीबायोटिक केस था वो दिया तो उसे इन्फ्लेमेशन हो गया। हमने क्या करें, उसको तुरंत भेजा गया। भेजने के बाद पता पड़ा कि भाई साहब को सिप्रोफ्लॉक्सिसिन से एलर्जी है। तो फिर जो दूसरा वाला ट्रिपल एंटीबायोटिक केस बना था, दोनों पे अलग अलग मेंशन है, ये वाला वो वाला, ये एमॉक्सिक्लेव वाला। फिर हमने चेक की रिपोर्ट, एमॉक्सिक्लेव से नहीं है, उन दोनों से नहीं, फिर वो वाला यूज़ किया तो दैट गिव द रिजल्ट। तो एलर्जिक रिएक्शन कैन हैपन और it may cause bacterial resistance to the patient. What is the ultimate goal for using triple antibiotic paste? In clinical trials, decide immature permanent tooth with necrotic pulp. Regenerative endodontic procedure therapy has to be employed to treat to mature permanent teeth with necrotic pulp and the teeth with persistent apical periodontitis. And for the traumatized tooth, like root resorption, avulsion, horizontal root fracture, बहुत बढ़िया healing करेगा. And what is the conclusion? The use of intracanal medicament differs from the case to case and person to person depending on their clinical experience. The use of only root canal medicament is to control of the infection. Root canal medicament are only adjuvant to the root canal therapy. Efficient biomechanical preparation with copious irrigation along with the use of intracanal medicament will increase the success rate and prognosis of the endodontic treatment. Thank you. अभी आप लोगों को इसमें कोई डाउट है? अगर किसी को डाउट है तो पूछ सकता है। किसी को कोई डाउट? नहीं है? कुछ है पूछ लो बिंदास। मैं रोज रोज इंदौर नहीं आने वाला। ओके, थैंक यू।
Thank you so much, sir, for sharing your insightful knowledge with us. The delegates who have registered with hospitality may please proceed to the breakfast counter. The lectures will start within 5 to 10 minutes.
was to create such machines which could perform the task without any human input. So now how this artificial intelligence works in dentistry? The various methodologies through which artificial intelligence works in dentistry are as follows: artificial neural networks, machine learning, fuzzy logic, convolutional neural network, and deep learning. So we have seen machine learning and deep learning. We'll be seeing what is artificial neural network. Now, artificial neural networks are highly interconnected networks that will work almost similar to that of a human brain. Okay, this system solves the problems which are too complex for any conventional method. I'll give you one example. Recently, a Google Brain was launched. The idea behind launching such an online search engine was to create such an engine that could think similar to that of a human mind. What is fuzzy logic? Fuzzy logic, it is a science of principles of human thinking, human reasoning, and uses real world phenomenon to interpret outcome and diagnosis. I'll give you one example here. Supposing you go to a restaurant, you have your dinner. Now you want to give a tip of the service that you have received. You start thinking, how much tip should I give? So this is where the fuzzy logic comes in play. Now this fuzzy logic will tell you exactly how much tip to be given according to the quality of the service that you have received in that restaurant. So this is fuzzy logic. Now the applications of artificial intelligence in the varying aspects of dentistry include endodontics, prosthodontics, orthodontics, diagnosis and radiology, periodontology, and so on. In endodontics, it is used to assess the apical foramen, okay, to check any perioapical pathologies. In prosthodontics, the CAD/CAM system is in boom. In orthodontics, it has increased the telemedicine marketing. How? In case of invisible aligners, nowadays you must be listening what are invisible aligners. So what they do is, a software is created. Through that software, you have to take the impressions through that software only. No need to go to patient, or patient doesn't need to come to you. So that impressions are sent to the laboratory, the aligners are formed there, and they are delivered it to the patient. So this is how the telemedicine has been taken boom in orthodontics. In case of oral diagnosis and radiology, in radiology, now this artificial intelligence system will tell you, okay, there are so many carious teeth in patient's mouth, there are so many implants in the patient's mouth. So diagnosis becomes very less time consuming when you use an artificial intelligence system. In aesthetic dentistry, digital smile designing also in boom in aesthetic dentistry. Now, the area of interest here is application of artificial intelligence in periodontology. Now, periodontitis is one of the most worldwide chronic disease affecting billions of people in the world. Okay, so this is characterized by soft tissue loss as well as bone loss. Okay, so in order to treat periodontitis, early detection, active periodontal treatment, and supportive periodontal treatment is very important. So if you don't diagnose it at an early stage, what will happen? It will increase the risk of the systemic diseases such as diabetes, cardiovascular diseases, rheumatic diseases, preeclampsia, preterm low birth weight, and so on. See, clinical attachment loss is one of the very important parameter to assess the periodontal disease by assessing the probing pocket depth as well as gingival recession. But to check all these clinical parameters, it is very much time consuming, and it is sometimes unreliable. So now what can be done? How to check these clinical parameters? Here comes into play the automated systems, that is the artificial intelligence. Convolutional neural network. Now what is a convolutional neural network? This is such a neural network. What it will do is it will take an image as an input. It will divide the part of the image and then it will give you an output. One example I will give you here is, see, there are n number of images of cats and dogs that are fed into the CNN system. Okay, now I put this image of a cat and I ask the CNN system what is it. So what the CNN will do? It will crop the image in different parts, such as the ears of the cat, the eyes of the cat, the nose of the cat, and then it will combine it and it will tell, oh yeah, this is an animal. And then it will tell you, yes, I got it, this is a cat. This is a CNN system works. So how it is applied in periodontology? It is used for detection of dental plaque. Now, in 2020, Wenzel et al. Carried out a comparative study of clinical assessments and deep learning in detection of dental plaque. So when compared to experienced pediatric dentists, the established artificial intelligence model had acceptable better performance levels clinically for identifying dental plaque on primary teeth. The accuracy rate here was 100%. In this picture, picture A is taken by a intraoral camera. In picture B, the yellow markings which you see is the presence of dental plaque by a CNN system. Picture C, this is the picture taken by a digital camera, and in picture D, the green lines, what you see, the green markings are given by an expert pediodontist on the presence of dental plaque. So here you can see the difference wherein the expert has missed the presence of dental plaque in the interdental area when compared to the CNN. So your CNN system is working 100% in this case. Now, it is also applied to detect gingivitis again by using convolutional neural networks. In 2020, Dima et al. Used this system of deep learning based approach for detecting gingivitis in patients who are undergoing orthodontic treatment. According to the findings of this report, artificial intelligence has provided dentistry an improved non-invasive way to diagnose gingivitis using intraoral images that will help to minimize the complications of untreated gingival diseases. Detection of periodontally compromised teeth. Lee et al. In 2018 used a CNN system to determine periodontally risky teeth from 1044 periapical radiography images and classified the teeth as healthy, moderate, or having severe periodontitis. They stated that their CNN system seemed promising in providing good predictions of teeth with periodontal insufficiency. Okay, now here you can see an example how the CNN system works. Image A will show you a digital panoramic view. Okay, here are certain periodontally compromised teeth present. In the image B, a CNN system has separated the periodontally compromised teeth from the healthy teeth. Okay, except for in two cases where with respect to 1.7 and with respect to 3.1. Here you can see that the expert is saying that it is a periodontally compromised teeth, whereas a CNN system is saying that it is healthy. So yes, it is a software, there are chances of error. So this is an ongoing advance. Okay, so chances of error are still there with the software. Detection of bone loss by artificial intelligence. Escort et al. In 2020 used CNN system to determine periodontal bone loss. Of 105 cases with bone loss, the CNN system detected 99 cases successfully with presence of periodontal bone loss. In this picture you can see the first image on your left side is a digital image. On the right side there is an intersection over union, which means you can see two markings there. One is the pink one and one is the purple one. The pink marking which is there, it is by an expert who is indicating that yes, there is bone loss present between the second premolar and the first molar, sorry. And the blue marking is given by the CNN system, which also tells that yes, there is bone loss in that region. So this image will tell you how accurately a CNN system is working. Now, mechanical plaque control is still the mainstay of the periodontal therapy. So the oral hygiene maintenance by the patient is very important. But what if the patient can't come to you again and again to get his teeth cleaned professionally, or if the patient is in such a hectic life, the patient doesn't have that much time to check, oh yeah, I'm brushing like this, I'm brushing like this. So what, in this scenario, what can be done? Now nowadays a AI based toothbrush has been introduced. How this works? Okay, there is an app which is linked to this brush. Okay, so you have to download that app on your phone. You will get, once it is downloaded, you will get certain color codings on your phone. You have to choose one color. Okay, the similar color will appear on that toothbrush exactly here, the LED light. Okay, now this will tell you yes, the brush has been linked to the software correctly. Okay, now once you start doing the brushing, once this is done, what will happen is, after it is done, the software will show the images in the phone wherein the patient has left certain areas wherein there is presence of dental plaque. Okay, otherwise also one more thing, this software will tell you where the patient is putting more pressure while brushing the teeth. It will indicate in red color as seen in the picture. So here it is telling the patient to reduce the pressure in the maxillary anterior region while toothbrushing. This is how the AI based toothbrush works. Application in implantology. In 2020, J. Hong Lee et al. Used panoramic and periapical radiographs to evaluate the effectiveness of CNN system for classification and detection of dental implant systems. The researchers discovered that the CNN is a novel technique for identifying dental implant systems. I'll give you one example here. Supposing a patient is walking into your clinic, okay, the patient doesn't has any records of the implants placed and you want to carry out the further treatment. Now what you will do? You will obviously advise an OPG to the patient. But still you won't be able to know which system implant has been placed into the patient's oral cavity. Okay, like what are the dimensions of those implants? So this is where the CNN comes into play. If you put that OPG image into that CNN system, the CNN system will give you which system implant has been placed, okay, and what are the dimensions of those implants. What is DiagnoCat? DiagnoCat, it is a computer program that uses artificial intelligence to view dental computed tomography images. It consists of massive pre-trained data set that compares the features of unseen data to 20,000 dental computed tomography images. This is one of the example of the DiagnoCat. Okay, this is an OPG here. The color white will indicate healthy teeth. Color blue will tell you it is treated. Color red will tell you it is unhealthy. And cross will tell you those are the missing teeth. So this is how it will help you to diagnose in very less time. What is an oral cam? Oral cam is a smartphone app that helps users self-examine oral conditions. Other than smartphone, no other equipment is required to upload the images. It encourages the maintenance of the oral health. One example of this is, see here the patient, what she is doing is she is taking the photograph of her oral cavity and then she will be uploading it into the software which is there in her phone. So that is the oral cam. Now once she has uploaded the images, that system will tell you, okay, right, these are the problems in your oral cavity. For example, you have so many caries, okay, you have so many restored teeth. So this is how this oral cam works. But one error is there, like it is very easy to take photograph of the labial aspect. Alright, but when it comes to the lingual aspect or the palatal aspect, it becomes very difficult for that person to take the photographs. So this is one of the disadvantages of using oral cam. Dex voice. I hope everybody has used Alexa or at least heard of it, what Alexa does. So this is similar to Alexa but used in dentistry. So Dex voice is among the first dental virtual assistants similar to Alexa but for dentistry. This technology was developed by Simplify Eye and the dentist can use it to pull up the charts, the patient's records, x-rays down to the image of a particular tooth or part of the mouth. The advantage to do this is that it improves the efficiency and cleanliness as the dentist does not need to pause, take off the gloves, check the records, wear the gloves again and then you check the patient. So this will prevent infection as well as time. Yes, every technology has its pros and cons. So the AI pros are improved accessibility to dental care. CNN based system help dentists to evaluate and record dental images in a more systematic, detailed and timely manner. Improved identification of issues such as cavity or risks such as bone density and tooth decay. Okay, then saving cost and time. It also eliminates the need of clinical tests and prevent infections in addition to being a cost-effective solution. The cons are it is less personal involvement since this is a software, it's not a person. Potential over-reliance on artificial intelligence for diagnosis resulting in incorrect or misdiagnosis. Yes, because the input data here is an image. You put that image in the software and what the CNN system will do, it will crop the image and then it will distribute and then it will tell you what it is. But in order to crop that image, sometimes an important anatomical landmark or sometimes an important, for example, bone loss, that area has been missed while cropping that image. So this is one of the disadvantages of that CNN system. In order to save processing time, power and storage space, as I said, these images are often cropped into segments or reduced in resolution. So, keeping in mind this ongoing artificial intelligence, its applications in periodontology, we carried out a study in order to check the attitudes and exceptional level of periodontists towards this applications of artificial intelligence in periodontology. So the purpose of this short perspective study was to explore the comprehension and acceptance amongst the periodontists regarding the application of AI in periodontology. An online study was conducted consisting of 12 closed-ended questions using Google Forms and they were circulated among the periodontists. The study consisted of questionnaire which was in the English language regarding the participants' view on developing applications of AI. So the results were majority of the periodontists, that is 91.5% positively responded to CNN that it can be useful in the periodontal aspect. 54.2% of them agreed that AI can ease diagnosis and interpretation of the diseases and 91.5% would like to use the software that can be helpful in periodontal radiographic diagnosis. So to conclude, artificial intelligence will increase the interpretability of the success in the field of periodontology. We believe that the promising results of a study on using a CNN system for interpreting periodontal aspect will encourage further developments in this area. Thank you. Any feedbacks are welcomed and also any queries are welcomed.
Thank you so much, ma'am, for sharing your profound knowledge with us. Next up, I would like to call on stage Dr. Sunil Ranwar sir for his lecture.
Hello. Myself, Dr. Sunil Ranwar. I am a professor in the Department of Prosthodontics, ACTM Dental College, Dhule. Today, my topic of presentation is rehabilitation of patients with mucormycosis cases. As you know, recently we have come across most of the patients due to COVID-19. So the most neglected part of our prosthodontic is maxillofacial prosthodontics. As most of them, we are very much interested in preparing crowns and bridges and placing implants. And I have come across very less people who are sharing in social media regarding the maxillofacial prosthesis. I know it is complicated or it is very difficult to understand, we don't know. But everyone who shares, we have come across everyone in the social media, they are sharing more of the implant cases, smile designing, aesthetics. When it comes to maxillofacial, I have come across very less. So I thought today this would be a best topic for me for the discussion in this platform. And I'm really thankful for CynoDent and Dr. Hemant Gadige and Dr. Anmol. Hello, is it clear? Audible? Hello. Hello. And Dr. Anmol for giving me an opportunity to talk on this. Is it possible for me to speak? So, mucormycosis. Hello. Hello. As you know, mucormycosis, it is a fungal disease which is most common. It was not most common before. Now it is most common because of
Hello.
Hello. It was a rare disease where we can see in a patient with immunocompromised and diabetic patients. It was a rare, hardly a 1% before. Now, because of COVID, because of the medications are increased in the doses of the medications, and most of the patients were suffering from mucormycosis. Okay. The aim of this clinical case report is to describe the prosthodontic rehabilitation of patients treating with mucormycosis. A patient with 54-year-old lady came to the Department of Prosthodontic ACM Dental College, and she was complaining of an extracted teeth. She gave a history of extracted teeth, and she was complaining of unhealed socket. The socket was not healing, and she came to the department regarding this chief complaint. And we have diagnosed and we have taken the biopsy of the site, and afterwards we concluded that it is a mucormycosis, and the rest we started doing the treatment. And the prosthodontic intervention, after discussing the possible treatment upon considering our health and medical condition, excision of the involved bone and the palatal mucosa was separated, and a split complete denture with retentive zygomatic mini plates was planned. See, this is a pre-operative pictures where you can see a complete resection of the complete total maxillectomy is done. There is a total maxillectomy done, and there is a communication between the antral and the oral cavity, complete communication, and the palate is completely gone. In such cases, it is very difficult for a prosthodontic, and it is a challenge for them how to reconstruct it, how to go ahead. This is a case which we have done. Hello. 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 This case has come to the Department of Prosthodontic in 2016, prior to mucormycosis, which was prior to COVID-19, prior to COVID-19 cases, where we have seen most of the cases which were coming to the hospital. In such situation, so how to rehabilitate this case? What we could have done? What is the possibilities you can think to do in such cases? Can anyone tell? Anyone can guess? How we can do the retentive? See, after COVID-19, we thought of coming, we are doing 3D printing, we are doing the framework, titanium framework for the retention of the prosthesis. Before that we are coming across what? Obturate. We used to fabricate the obturators for the palatal defects. It is a total maxillectomy case. So in such cases, what to do? Then we have discussed with the Department of Oral Surgery. We have a meeting with the Department of Oral Surgery, and thanks to Dr. Rudy sir, he gave an idea. So with the help of him, first we have done the impression. This is the final cast. See what we have done. This is not a jaw relation. This is just we are mimicking the ridge, the lost structure. The lost structure we are mimicking him in the wax. We are fabricating the complete lost structure. the one which we have fabricated, then we have flasked it, so that we will get a complete prosthesis, which is just a copy of a ridge, edentulous ridge. See, this is just a print of it, a duplicate copy of a ridge. Now, what we have to do? The next question comes is that how we are going to stabilize it, how we are going to place it or make it retentive, by what means? Then we have planned to just fix that with a plate into the bone. Here, this is planned. After this, see, you can see this. With this plate, we are going to fix the denture to the bone. Okay? Zygomatic bone. Then we have given two vents. We have created the vents here. Can you see this space which we have created? We are going to place the ball attachments. The ball attachments which we are using for a overdenture attachments. You have seen the overdenture attachments which are placed onto the implant. The second, the ball attachment is placed here in anterior and two in the molar region. After this is fixed, surgically fixed to the bone. See, this is completely fixed in the bone. It is mimicking the complete the palate, and we have reconstruction of the palate is done with the heat cure resin, and you can see the ball attachment as if it has been placed, as if it is coming out from the implant. Okay? And the conventional impression we have done with the conventional impression. So once we have placed and fixed and we have mimicked the ridge, then we are going to make the impression, final impression as a conventional. And we have got the master cast, and this is the triangle which we have done. Only we have not done the scaling of the patient. Then we thought of doing it afterwards because the patient was not ready for it. Somehow we are convinced that the flasking procedure was done, and this is the final prosthesis. This is the patient, before and after. So we have reconstructed the palate with the help of a heat cure which was stabilized with the plates. And we have to get the retention, we have placed the implant attachment to the ridge which is fabricated with the resin. Then we have done the conventional impression, and as an overdenture we have used this case. In this case we have used like this. This is before and after. You can see the difference. See, this was done in 2016. Now, after COVID, in our college, we have treated more than 130 cases of COVID surgically. So, once it is done in the surgery, definitely for the prosthetic rehabilitations, they are coming to the Department of Prosthodontics. So, now we have updated ourselves. How? We have gone with the 3D printing. See, before the patients who used to come with these cases, they were very economically weak patients, where they are not ready to pay 2-3 lakhs some money. Now, after COVID, we got patients with COVID-19. We started reconstructing the framework, metal framework, to gain the retention for the prosthesis. So we have, this is the case. See, this you can see, this is the pre-operative radiograph. This is the pre-operative radiograph. This is the treated. It is completely treated. Only the soft tissue is covering the palate. There is no bone. There is no bone, nothing. It is just a soft tissue. So there is no question of any sound foundation, so that we can make an impression and give a denture. And you can see there is a opening also. There is this opening, and it is a defect in the surgery because they could not close it, because it is shrink and it left with a defect. So somehow later we have to go for a reconstruction surgery. So this is the placement which we have done with taking the help of the zygomatic bone, and that is extending the extension of the. You can see the extension are into the oral cavity. There are this attachment. This attachment is 3D printing, and they have milled it with the titanium, and which we surgically placed in the zygomatic bone, and whatever the extensions which we have planned according to it, 2 in the anterior and 2 in the posterior region. This is the 4 openings which we have got, 4 attachments, in which we have splintered this completely. 1, 2, 3, 4. These 4 extensions where we have splintered it to make the impression. And we have recorded the jaw relation for the vertical height. And this is the trine, what we have got the trine in the patient. Checking for the occlusion in the posterior and overjet overbite. And this is the final prosthesis, and we are checking for any high point or any deflections in the contact. This is the picture on before and after. This is the before fabrication of the prosthesis. This is after fabrication. This is before and this is after. You can see the picture. I want to conclude this saying that dental profession must be aware of the possibilities of the serious and fatal complications, so as to avoid the unfavorable outcome in clinical practice. The major role of the prosthodontic in treating maxillectomy patient does not end by rehabilitating the lost functions, oral functions and aesthetic, but also to rehabilitate and restore the mental health of the patient. Thank you. If you want to ask any question, please, it is welcome for you. Thank you.
Thank you so much, sir, for sharing your insightful knowledge with us. Next up, I would like to call on stage Dr. Vijay Maitre, sir. He is an eminent periodontist and specializes in laser dentistry from Aurangabad.
Good morning, everyone. This is Dr. Vijay Maitre. I welcome you all from the historical city of Aurangabad. Today, I am going to share my knowledge about some fundamentals of lasers in dentistry. So, let's start with the session. I will prefer to be here. So I completed my BDS from Nair Hospital, Mumbai, and I completed my MBS from ACPM Dental College, Dhule. Right now, working as a reader. Hello. So we are going to have a session on laser dentistry, and trust me guys, it will be an interesting session for you all. And I haven't included much theoretical part as such, so I'm not going to make you slip. It will be an interesting session for you all. So let's start with the session. The science of today is the technology of tomorrow, and it is not that we use technology, we live technology. 3 idiot में तो हमने देखा है, what is a machine? Machine that reduces the work, right? In the same way, we use technology on day-to-day basis in dentistry. We have many recent advances in dentistry which made our work easier. Initially, we were using those hand files, K file, H file, जिसका फाइनल ईयर में हमको कंफ्यूजन रहता था कि H फाइल कौन सा है, K फाइल कौन सा है, राइट? बट nowadays it is outdated. Am I audible without mic? Yes. Yeah, that will be better for me. So we have many recent advances in dentistry which made our work easier. Initially we were using those hand files, K file, H file, and even hand pro-tapers for the root canal treatment. But nowadays we use rotary endodontics which made our work easier. As such, there is no hand fatigue for the practitioner, and it takes less time to perform the root canal treatment, right? Then we have recent advances, RVG. Initially we were using those IOPF films. It takes a lot of time to develop. कभी उसमें काला दिखता है, कभी सफेद दिखता है, कभी कुछ हो रहा है, कभी कुछ हो रहा है. Image तो proper दिख नहीं रहा है. So even the diagnosis part was not easier for us. But nowadays we have RVG. So with RVG we can get a good radiographical picture of the clinical condition. Okay. Then we have intraoral camera, in which we can have a proper and accurate visualization of the oral cavity onto the screen. Okay, and even it is very easier for the patient to understand about the disease severity, and so that they will get convinced easily for the treatment. Then we have apex locator, which is used to take a working length of the root canal treatment during the root canal treatment. We have endodontic microscope, which gives an accurate visualization of the pulp cavity, and many more other dental uses also. Then we have intraoral scanner, which can be used to take impressions, even in Invisalign cases and all, can be very easily performed with the help of intraoral scanner. Then we have advances in surgery. With electrocautery, we can perform the surgery bloodlessly and painlessly, right? So even if there is some sort of bleeding during your surgical procedures, in those cases, cautery can be excellent tool to help you to stop the bleeding. Then we have the monster lasers. It is different, better, and main thing, it is not a rocket science. What do you mean by it is not a rocket science? It is a easily learnable skill. Okay, if your basics of any procedures are clear, it is a very good tool to perform your procedures effectively, painlessly and bloodlessly. Okay, so let's see what is a laser. What comes in your mind when you think of laser? First thing comes in our mind regarding laser is this Star Wars, right? And my interaction about lasers in the past was limited to Superman. वो उसके आंखों से कोई रे आएगा और सारे एनिमल्स को किल कर देगा, राइट? इट्स अ सॉर्ट ऑफ ब्रह्मास्त्र कि किसी को भी कुछ भी कर सकता है, उससे कुछ भी हो सकता है, राइट? इवन आजकल तो ये शादियों में हर जगह पे देखा जाता है, इवन इन डीजे नाइट्स एंड ऑल. And you must have seen some Hollywood movies showing the laser wall protecting some like banks and money and etc. So these were the previous interaction which we had in the past, and all of us has done this thing in our childhood. Every one of us has done this thing in our childhood, right? Even ये तो childhood की बात होगी, मैं तो आज भी ऐसा करता हूँ. So let's see what is the laser. Definition क्या है? Laser is light amplification by stimulated emission of radiation. Okay. So what are the advantages of using lasers over the conventional treatment methods? There is a reduced need of anesthesia. In most of the cases, you don't need to inject into the patient. Topical anesthesia is sufficient for many clinical conditions. Then greater comfort during and after surgery, hemostasis and reduced risk of blood-borne pathogen. This is very important point. Then high patient acceptance for the treatment, then reduced stress and fatigue for the practitioner as well as staff. It is a leading edge technology for pursuit of higher level of patient care, and it produces less collateral thermal damage as compared to the electrocoordinate, and it overall improves the clinic image. And nowadays patients are all Google and YouTuber patient. They search everything on the internet and then they demand that particular treatment to your clinic. So if you have a laser in your clinic, definitely it will improve your clinic image. Okay. When used efficaciously and ethically, lasers are exceptional treatment modality for treatment of many clinical conditions that we treat on day-to-day basis. And nowadays patients today are well aware of lasers and their advantages and disadvantages. As such, there are no disadvantages with lasers. We have many advantages, and as I told you, patients today are well aware of lasers. The person who is using specs knows about what is ophthalmic lasers, right? चश्मे का नंबर कम करवाना है तो यार लेजर ट्रीटमेंट करवाओ आप, कुछ तो भी उससे आप मुझे ये चश्मे से रीड ऑफ कर दो आप, right? In the same way, we have seen many conversions with the ophthalmologist, right? So those who use specs know what is laser. उनको ये पता है बिना सर्जरी के नंबर कम किया जा सकता है, right? In the same way, in dentistry also, they will ask you कि ऐसा कुछ है क्या बिना सर्जिकली, नॉन सर्जिकली किया जा सकता है जिसको, right? So if you have lasers in your clinics, it will overall improve your clinic image, and जो ऐसे patient है जिनको ज़्यादा पता है, उनका treatment भी आप easily convince करके कर सकते हो, okay? So let's classify the laser. Lasers are classified into surgical lasers and non-surgical lasers. In surgical lasers, we have soft tissue lasers and hard tissue lasers. Then in non-surgical lasers, we have diagnostic laser, low-level laser therapy, and miscellaneous lasers. Now, in hard tissue lasers, we have ER-YAG laser, ER-YSGG lasers, and CO2 lasers. In soft tissue lasers, we have diode laser, Nd:YAG laser, and CO2 lasers. Now, what is the difference between soft tissue laser and hard tissue lasers? The name itself signifies it. hard tissue laser can be operated on soft tissue as well as hard tissue. Soft tissue lasers can be used for soft tissue only. Okay, all hard tissue laser can be used for soft tissue as well as hard tissue. So it is called as all tissue lasers. So you can use it on enamel, dentin pulp, gingiva, or any soft tissue and hard tissue, including both. Okay. Then in non-surgical lasers, we have diagnostic lasers, low-level laser therapy, and miscellaneous lasers. Okay. So this is all about classification of lasers. Now let's see what are the different uses of lasers in dentistry. So in periodontics, we have initial pocket therapy, non-osseous surgery, gingectomy, gingivoplasty, then phrenectomy, phrenotomy, then biopsy, periodontal regenerative procedures, then we have depigmentation, removal of granulomatous tissue. Osseous recontouring can be done with the help of lasers, but of course you need a hard tissue laser for that. Okay, then in implantology it can be used for second stage surgery and peri-implantitis. Okay, in fixed prosthodontics it can be used for crown lengthening, osseous roughening, then formation of ovate pontic, altered passive eruption management, modification of soft tissue around, and laminates. In remote prosthodontics, it can be used for epilis, denture stomatitis, residual ridge modification, torus reduction. There are many procedures which we can perform with the help of lasers. Then in pediatric dentistry, it can be used of exposure of teeth. Then any soft tissue management in orthodontic cases can be done with the help of lasers. In oral surgery, it can be used for biopsy, operculectomy, apicectomy, and many more surgical uses. In operative dentistry, it can be used for detection of caries, removal of decay painlessly. It can be used for removing the defective composite and GIC restoration, bleaching of teeth, and root canal disinfection. Kindly note one thing, root canal disinfection can be done with the help of lasers. You have to follow the conventional protocol only. You go ahead with BMP first, and after that you can do root canal disinfection with the help of lasers. Now let's see some clinical cases where we have used laser to perform the surgical procedures. If you see this case, this is a sort of horrible oral hygiene in case of orthodontic patient. So the gingiva is grown almost at the tip of the central incisor. I will say incisal edge of the central incisor. It is extending beyond the incisal edge of the central incisor. So this patient was not able to have food properly. Masticatory function was hampered, and also it is aesthetically very unpleasant for the patient, right? So in this case, we have performed gingectomy with the help of lasers. This is a pre-operative photograph of the patient where we have used laser with the setting of power 2 at wavelength 810 nanometer in pulse mode. So this is what we got post-operatively. This is 7 days post-operative healing, faster healing, no bleeding during procedure and all. So this is a pre-operative photograph, and we can see a beautiful output in post-operative photograph. Okay. Let's see a case of canine exposure for the orthodontic treatment. I'll show you a basic case where tooth is partially erupted and partially covered with the gingiva. Now in this case, orthodontist told us to have a proper gingectomy so that he'll be able to place the bracket. So in this case, we have performed canine exposure for the orthodontic treatment. This is a pre-operative photograph. In post-operative photograph, you can see a beautiful exposed crown. The major advantage of the using of laser is minimal amount of bleeding. See, there is as such no bleeding. So bracket placement can be done immediately, right? Now this is a partially erupted case. But what about completely covered case? I'll show you that case also. So this is a pre-operative photograph where we can see canine is impacted. On CBCT we can see there is a bony window present. Bony window is there. So only soft tissue covering is there. Okay. So in this case we have performed canine exposure for the orthodontic treatment. Let's see a video for this case. Now the crown is exposed properly. This is a fully exposed crown. So if you see in this case, immediate post-operatively there is no bleeding as such. So isolation can be maintained very well. In those cases, bracket placement can be done immediately, right? So it is a very helpful tool to perform the procedure. So bracket placement is done and you can see immediate traction can be applied. Or else if you perform this same procedure conventionally, then maintaining isolation is a difficult task. Okay, so laser is a good tool for that. Crown exposure in pediatric patient. This is typical erupting central incisors. We have waited till 6 months for the incisor to erupt, but ultimately patient's relative was reluctant to wait. So we went for an crown exposure for the pediatric patient, and we have exposed the central incisor with the help of elliptical incision given by the lasers. And after seeing this, patient's relative was so happy कि दांत आ रहा है, अभी आ रहा है बाहर. Okay. Let's see some common cases of crown lengthening which we perform on day-to-day basis in your clinic. Okay. So this is a pre-operative photograph, and this is the immediate post-operative photograph, and we have achieved a good height, crown height for the crown. Okay. Let's see a case of aesthetic crown lengthening procedure. This is a pre-operative photograph of the patient where patient approached us with this anesthetic central incisor crowns. So in this case, we have planned for the aesthetic crown lengthening procedure and changing of crowns. So this is an immediate post-operative photograph after the surgical procedure, and we can see a good gingival zenith level in post-operatively. These are the temporary crowns which were placed at that time. Now this is very typical case of aesthetic crown lengthening. Orthodontic treatment was done for this patient. In that case, we can see the squarish profile of the central incisor. So mesodistal distance and incisor-cervical distance is almost same. So in such cases, if you see this as a periodontist perspective, this is an ideal case for crown lengthening procedure. Okay, so let's see the case. This is a pre-operative photograph. This is the immediate post-operative photograph, and this is after healing. You can see a good gingival zenith levels. For central incisor and canine, it is at the same level. For lateral incisor, it is 2 mm below the central incisor level. Okay, let's see a video for this case. Now if you see right properly, there is zero bleeding as such. Right? Now imagine doing this same case with the surgical blade. There will be a lot of bleeding and it will be very difficult to manage, and you will not be able to see the margins properly. Right? So you mark the line first. It is a sort of external bevel gingectomy for this case. Now after that you remove that excess gingiva. The purpose of showing this full video is there is not a single drop of blood during this surgery. This is very important point. So after that you just remove the excess gingiva. Now while doing these cases, make sure that you are maintaining a proper gingival zenith level. Now what is the gingival zenith level? It is the level of your gingival margin. So you remove the excess gingiva. This is the post-operative photograph, and we have achieved a good gingival zenith post-operatively. Okay. Now let's see a case of operculectomy. Now many practitioners have lot of confusion whether to go for operculectomy or whether to go for disimpaction procedure. Any final year student over here? Any final year student over here? ये देखा है डायग्राम कहीं पे आपने? कौन सी टेक्स्ट बुक में दिया है? बहुत फेमस टेक्स्ट बुक है यार पेरियो की. करांजा? You read करांजा? अरे यार बहुत अच्छी बात है यार. आजकल तो वो करांजा का ट्रेंड चला गया. वो कौन सा बुक आता है वो छोटा वाला या क्या नाम है उसका वो शालू बाटला या राइट रेड्डी या आजकल उसी का ट्रेंड चल रहा है. बट गाइस ट्रस्ट मी, Karanza is a very good textbook. At least basics has to be covered from Karanza, right? So there is a lot of confusion between practitioner whether to go for operculectomy procedure or disimpaction procedure. I'll simplify it. If you have a case of third molar, just check three things. First thing, the tooth 8 should be at the occlusal level of 7. If it is supra-erupted or infra-erupted, don't go for operculectomy, there will be a recurrence for sure. Second thing, the tooth should be vertically placed. It should not be horizontal, vertical or lingually or mesially tilted. It should be vertical. And third thing, there should be attached gingiva present buccal to 8. If all three factors are meeting, then only you can go for operculectomy procedure, or else there are chances of recurrence in those cases. Okay, let's see a case of operculectomy. This is a typical case of operculum present on 3-8. As such, tooth is in the proper arch. It is at the occlusal level of 7, and there is slight amount of buccal gingiva present to it. It is not a very ideal case as such. So this is a pre-operative photograph, and you can see a beautiful post-operative photograph where the occlusal surface of 8 is properly exposed. And after healing also, we got a beautiful healing in this operculectomy case. Now everyone shares about their success. who shares about the failure. Let's see a case if you don't follow those 3 protocols for the operculectomy procedures. So this is a typical case where 8 is present under the occlusal level of 7. Okay. Second thing, it is slight mesially tilted. Third thing, there is no attached gingiva and this buccal fat is growing onto the 8. So in this case also we perform the operculectomy. In the post-operative photograph you can see the tooth is not in arch, so it is lingually tilted slightly. It is not at the occlusal level of 7 and buccal fat tissue is impinging onto the 8. So in this case, ideally it is not an ideal case for the operculectomy, but still we perform. Actually it was not performed by me, it was performed by my wife. The reason, it was my own tooth, so she wanted to have an experiment on me. कि यार तू तो सबको बोलता है ओपरकुलेक्टमी केस में ये करना है, ऐसा करना है, वैसा करना है. Let's try in your case. Okay. So ultimately it starts from here, but those 3 criterias were not followed. So क्या होना था? It started from here and ended up over here. So ultimately we went for a disinfection only. But make sure guys, joke apart, but if you are going for operculectomy, all 3 factors has to be taken into the consideration. Okay. So these were the basics of operculectomy. Let's see some frenum associated problems. This is a typical case of conventional frenectomy where we hold the frenum with the help of hemostat. We give the incision from the superior and inferior side of the hemostat, and this is what post-operatively we got, right? But in this cases, we are doing it very extensively, we need to suture it. Now consider this thing that we are going for a consultation in the clinic where you don't have an assistant. और ये ऐसे भी consider कर लो कि आपकी खुद की clinic में perform कर रहे हो और assistant ने छुट्टी मार दिया है time पे. तो is it possible to suture this area without the help of assistant? No. You have to have a proper assistant to hold the lip so that you can suture properly, right? Even if you consider these different techniques of the frenectomy, in these cases also you need to have a proper assistant with you so that you can perform those procedures very easily, right? But with the help of lasers, trust me guys, you don't need any assistant to hold the lip, you can perform the procedure alone. Even in cases of lingual frenectomy, giving suture on the ventral surface of tongue is very difficult task. So ये तो ठीक है. What about in pedo patients? Pedo में tongue tie अगर आप operate कर रहे हो, in those cases do you feel कि वो बच्चा आपको floor of tongue पे suture करने देगा? I don't think so. So in such cases, laser is very good tool to operate such cases. So this is a case of laser frenectomy where we have performed frenectomy. You hold the lip with one hand, you perform the frenectomy, you can operate it single-handed. Okay. Now ये तो ठीक है, labial frenectomy के लिए इतना कुछ ज़्यादा difficult नहीं होता है. What about lingual frenectomy? Even lingual frenectomy cases में, now this is a 5-year-old child, 6-year-old child, where we can see the tongue is attached to the frenum is attached to the tip of the tongue, right? And the other part is attached to the alveolus. So in preoperative photograph, the patient was not able to protrude his tongue. Okay. So with the help of lasers, we can remove this tongue tie very easily, very effectively, along with the cooperation of the patient. This is a pre-operative photograph and this is a post-operative photograph of the same patient, and this is a chair side output. Immediate chair के बाजू में बैठा है patient. This is a pre-operative and post-operative photograph where we can see a good protrusion of the tongue. Right. Let's see another case of lingual phreniectomy where you can see a proper bifidness of the tongue. This is a pre-operative photograph and this is an immediate post-operative photograph where patient is able to protrude the tongue. This is the third case of the tongue tie where we can see typical bifidness of the tongue and he is able to protrude the tongue properly, immediate post-operative. Now why I am showing multiple cases of tongue tie? It is not very easy to operate on the floor of tongue, floor of mouth and ventral surface of tongue. There are many vital structures present and giving sutures in that areas is a difficult task. So in such cases, laser is very good tool to operate. Now let's see a case of the gingival depigmentation. Now what is the gingival melanin hyperpigmentation? Gingival depigmentation, sorry. Melanin hyperpigmentation usually does not present as a medical problem, but patient may complain that their black gums are unaesthetic. And this problem is more aggravated in patient with the gummy smile and excessive gingival display. So in such cases, we can go for a gingival depigmentation procedure. This is a typical case of hyperpigmented gingiva where we have performed the gingival depigmentation. This is a pre-operative photograph and this is a post-operative photograph of the same case. You can see a hyperpigmented gingiva is removed properly with the help of lasers and we got a beautiful output for this case. Now, treatment of gingival enlargement. Can you see this picture? This is a typical case of gingival enlargement, right? So in these cases, if patient is medically fit, then it is very easy to operate. क्या करना है यार, उसमें gingiectomy blade लो, सर करके सब निकाल दो gingiva और हो गया, बस बात खत्म. It's a sort of external bevel gingiectomy, right? But now consider this case as a medically compromised case where you cannot perform the conventional surgery. Patient physician has not given you the fitness to operate. So what to do in such cases? Trust me guys, you will get very beautiful output and you can operate very easily in this case of gingival enlargement without any surgery. We have done photodynamic therapy for this case and this is what we got pre-operatively and post-operatively. We haven't touched the blade. Only with the help of scalers and lasers, we have reached from here to here, right? So in medically compromised cases, you can use laser to operate where conventional procedures are contraindicated. Now let's see the uses of lasers in endodontics. For root canal disinfection, it can be used very effectively. You have to do your access cavity preparation, then you do your conventional instrumentation, and after that you inject a laser specific dye, and after that you irradiate with the help of laser. Let's see a video for this case. From the tooth and gingiva. So this is laser root canal disinfection. Now dyes can be methylene blue dye or endocyanin green dye can be used for the root canal disinfection. If you don't have dye, you can use sodium hypochlorite and you can irradiate with the help of laser. The action of laser is bactericidal, so directly it will be a killing of bacteria. So it is very effectively, it can be very effectively used in the root canal treatment. Now let's see the cases of laser bleaching. If your patient knew about the whitening and could afford it, how many of them do you think that would like to have a whiter teeth? किस किस को चाहिए whiter teeth? Of course सबको चाहिए, लेकिन पैसा किसी को खर्चा नहीं करना है, right? There are many beautiful ladies in this auditorium who spend lot of amount in the beauty parlor, right? But how many of you have done bleaching in your own mouth? Hardly few, right? But beauty parlor में तो सब गए. My wife spent lot of amount in beauty parlor, so even I learned from her, and even I started going over there in the main salon. Joke apart, but people spend lot of amount on the face beautification and hairs and many other things, but they don't spend money on oral hygiene and bleaching, right? But in those cases, for bridal makeup, how much the beauty parlor वाला charge? थोड़ा अगर professional है तो 10-20 हज़ार तो आराम से charge करेगा, right? यार उतने में ब्लीचिंग भी हो जाएगा. वो अगर 20,000-25 हज़ार रुपये एक ब्राइडल मेकअप के लिए वगैरह स्पेंड कर रहे हैं तो डेफिनेटली लेज़र ब्लीचिंग तो आराम से करवा ही सकते हैं. लेट्स सी फ्यू केसेस ऑफ लेज़र ब्लीचिंग. This is a pre-operative photograph and this is an immediate post-operative photograph where you can see the yellowish tinge of the tooth is changed to white. Now shade selection has to be done priorly so that you will be able to show the difference to the patient. Okay, so shade selection pre-operatively is mandatory. Let's see a video for this case. Gingival barrier is applied. This is all about laser bleaching. Now make sure the choice of the laser bleaching agent should be depending upon the wavelength of laser you are using. Basically the bleaching material is activated with the help of lasers. Okay. Let's see some non-surgical treatment of the lasers. Treatment of aphthous ulcer. This is a typical case of aphthous ulcer sizing around 15 millimeter, right? So if you go conventionally, like if you apply some kind of ointment or you're taking some kind of antioxidant and multivitamins, it takes a lot of time to heal such kind of ulcer. But with the help of lasers, the healing can be accelerated and your patient can get relief immediately. Even though the ulcer may take more time to heal, but the discomfort of the patient can be reduced immediately. Okay, so this is a pre-operative photograph, and this is a immediate post-operative photograph where you can see these red dots. These are the neogranulation tissue formation which will promote the healing, and this yellowish tinge and slough is gone immediate post-operative. And this is after 3 days, and this is after 7 days. Within 7 days, ulcer can heal. And usually such kind of huge ulcers take at least 10 to 15 days. But with the help of lasers, we can reduce the healing time and we can reduce the discomfort level of the patient. Now let's see where laser can be used in implantology. Lasers can be used for second stage surgery. This is a pre-operative photograph. We have placed 2 implants over here, 6 and 7 region. This is a immediate post-operative. We can see the covers too over here. And after that we have placed the gingival former, and this is a follow-up visit. We can see a beautiful gingival collar is formed in the case of implant. Okay, let's see a video for this case. How many of you perform implants over here? Okay, many of you are going to perform implants in the future. For second stage surgery, if you reflect the flap and expose the bone, ultimately there will be some amount of bone loss in those cases, right? And again you are suturing the lesion, you are reflecting the flap. It means it will take more time for the healing, right? But with the help of lasers, you are not exposing the bone, right? Many of you will ask, sir, we are using the laser onto the bone. This is a soft tissue laser. Lasers will not be absorbed onto the hard tissue. So even even if you are performing the same procedure on for crown lamination and all, the hard tissue structure will not absorb the laser. So you can do the surgery very safely without harming the hard tissue. Okay. So this is a post-operative photograph of the same case where we got a beautiful gingival collar. Now let's see some cases of skin tag removal with the help of lasers. This is a pre-operative photograph where there was a small wart on the scalp of the patient, and this is an immediate post-operative photograph where we can see with absolutely no bleeding we have removed the wart, and this is an immediate post-operative photograph. So zero bleeding as such. Another case of wart which was present on very unusual location. Now, do you think for removing this wart, giving LA is feasible? No. Even if you try to think like, if you are trying to give infiltration in that area, it is very difficult to give, because already वो eyelid का thickness जो है वो कम रहेगा और उसमें आप inject कहाँ करोगे यार, right? This case was operated with the help of topical anesthesia only, with the help of laser. This is a pre-operative photograph, this is an immediate post-operative photograph, and we can see the beautiful healing over here. Now challenges, there are many challenges to operate such cases. Clinically अगर आप blade use करोगे तो there will be a bleeding which will be a trouble for you all. Second thing, giving anesthesia in these cases are very difficult. And most important thing, manipulate the eyelid. To manipulate the eyelid is again a difficult task. So with the help of laser, it can be very easily done. Now let's see few cases of lasers in oral surgery. We'll see few cases of biopsies first. This is a typical case of peripheral giant cell granuloma, sizing around 17 millimeters, 17.7. I'll say 18 actually. So in this case, if you are operating conventionally, then there will be a lot of bleeding for sure. And to manage that bleeding and get a clean surgical field is very difficult task. So in such cases, laser can be a exceptional tool and very helpful for performing such cases. This is a pre-operative photograph and this is immediate post-operative photograph with zero bleeding, and I can say a beautiful healing in post-operative photograph. So we got a good gingival contour in the central incisor, lateral incisor and canine area. Okay. Next case, this patient has approached us for this anesthetic lobule present on the lower lip of the patient. So what it seems like, क्या दिखता है लोअर लिप्स में, क्या आता है यहाँ पे फाइनली स्टूडेंट्स? म्यूकोसिल, राइट, very good. So this was a typical case of mucocil and this patient approaches to us and saying कि सर ये बहुत गंदा दिखता है, इसकी वजह से मेरी शादी नहीं हो रही है and all. He got few rejections because of that particular ballooning of the soft tissue. So he came to us, we operated for the mucocil. This is an immediate post-operative photograph where we can see zero bleeding with proper protein layer formation onto the surface. Okay, so this is what we got post-operatively, and you can see joy on his face also. Okay, now let's see some cases of incisional biopsy. This is a typical case of traumatic ulcer where we have performed incisional biopsy for this case. This is a pre-operative photograph and this is post-operative photograph where we have removed disease as well as healthy lesion with the tongue. This is a typical case of traumatic ulcer present on the 8th region. Patient has approached us for the extraction of 8, but ultimately after seeing this lesion, we advise the patient for the biopsy. This is a pre-operative photograph and post-operative photograph of the same case, and the diagnosis was squamous cell carcinoma, that too well differentiated. Now make sure guys, if you have a case of traumatic ulcer, go for biopsy. Ultimately, if you remove the etiological factor, that is a irritating tooth or something, that will heal. But if it is not healing, or we can say a non-healing ulcer, has to undergo biopsy. Okay. Now let's see a case of leukoplakia excision. This leukoplakia is a non-scrapable lesion present from central incisor to the 8th region, and also it is extending onto the buccal mucosa. Right. In such cases, lasers can be very easily and atraumatically used for the excision. This is a pre-operative photograph. This is immediate post-operative photograph. This is 4 days post-operatively, and this is 8 days post-operatively. Within 8 days, proper healing can be achieved with the help of lasers. Okay. Another case of leukoplakia present on the tongue. It was on to the tip of the tongue, then lateral surface of the tongue, and also posterior 1/3 of the tongue. So in this case also we have went for leukoplakia excision with the help of lasers. This is a pre-operative photograph and this is a post-operative photograph of the same. Let's see a video for this case. Another case of lesion present on the lateral surface of tongue. Can you see the appearance is bluish black? So it seems like a what? What is the diagnosis? Anyone? See, it's a sort of blood-filled cavity. Okay, so my clinical diagnosis was hemangioma, right? Okay, so we operated the case with the help of lasers. This is the pre-operative photograph and this is the immediate post-operative photograph. And someone will say कि सर आपने तो बोला था bleeding नहीं होता है lasers में, इसमें क्यों हो रहा है? See, tongue is a very vascular structure. So even if you operate with the help of lasers, there is going to be slight amount of bleeding and you are going to cut some capillaries. And also hemangioma arises from a capillary क्या बोलते हैं उसको, I don't remember the word exactly. So जहाँ से bleeding start होता है, so you need to cauterize that particular area. Okay. So this is a pre-operative and this is a immediate post-operative photograph. We have intentionally sutured this lesion. Now why? आपने बोला था सर, आपने तो बोला था यार suture की जरूरत नहीं है, इसमें क्यों suture दे रहे हो, right? Guys, this kind of lesion may take months to heal, and there will be a depression onto the tongue, which I don't want. So after sutures, we don't have any depression as such, although the tongue size will be maybe 2 or 3% reduced, but healing will be faster, and there will not be any non-healing type of ulcer in such cases. So this is a excised tissue. So such kind of cases can be operated well with the help of lasers. This all guys, this all cases are operated at our center only. These are not Google or any taken from any book. These all cases are performed at our center, and purpose of showing so many cases and so many videos is if I am able to perform it, even you will be able to perform it very easily. But you need to know the basic behind that. You need to know the science of laser dentistry to perform such kind of cases. And trust me guys, if you learn it properly, you can use lasers for many clinical conditions that you perform in your clinic every day. Okay. So this was a cavernous hemangioma. Now closely have a look on this picture and tell me कि इसमें आपको क्या finding नजर आ रही है? One flower is red, other flowers are yellow, right? How many of you are facing competition in your practice? Every one of us. किसी को बोलने की जरूरत नहीं. I'll tell you, every one of us, right? कि यार बहुत मेरी एरिया में तो बहुत सारे डेंटिस्ट है यार, क्या मतलब बहुत इतना सैचुरेशन है कि क्या करना है, कैसे करना है. Where I practice, no, in my area, 1 kilometer of radius, we are 28 dentists. Now imagine the level of saturation in our area. But ultimately, if you have some specialty or some special procedures that only you can perform, it will be a specialty and USP for you, unique selling proposition, right? So these all are your neighboring dentist and this is you. If you want to have a good competition proof practice, focus to a particular area, particular specialty, I'm saying. Okay. See, it is not about only laser dentistry. Maybe it is implantology. Maybe someone will be having endodontic microscope in the practice. Someone will be having CBCT in your practice, right? So if you do a specialty practice, जैसे ये बाकी फ्लॉर्स में रेड फ्लॉर आगे आ रहा है, वैसे ही आपकी प्रैक्टिस भी आगे आ सकती है. Okay? So to conclude, for conclusion, usually I don't have any written message, I show a video. So telephone is replaced with a cell phone, TV sets to the LED screens, radio transmitter to the iPods, letters to the email. But did you ever imagine this? So they are driving and they have stopped at a particular signal. So some street vendors are approaching them to take their products and all. Now a beggar will come to them. Now listen this conversation carefully. He's offering the change. See, that beggar is carrying a swipe machine. So my take home message is, if you don't upgrade yourself, you will lose your income and you will lag behind into the competition. अगर उसके पास वो स्वैपिंग मशीन नहीं होता तो he must have lost his income, right? छुट्टा तो उसके पास था लेकिन इनके पास कार्ड था देने के लिए, right? तो if he don't have that swapping machine, he must have lost his income. So you need to upgrade yourself with time. आज जो 1957 का जो 1857 का या जो भी है वो टाइम का जो टेक्निक है डेंटिस्ट्री करने का, वो अगर आप आज भी वही यूज़ कर रहे हो तो यू विल लैग बिहाइंड. So it is not about only laser dentistry, but you need to upgrade yourself into the dental practice to sustain in the competition. Okay, so this was the take home message from me. Upgrade yourself, that is most important thing. We do conduct courses on lasers across India. So far we have conducted in all metro cities of India, Mumbai, Delhi, Bangalore, Chennai, Kochi, then Kolkata, Hyderabad. These are all workshops across India. Our upcoming program is in Navi Mumbai on 17th of July. If you want to learn laser dentistry, you can come and join us for this session, where we include introduction, history of lasers, classification of lasers, then laser physics, generation of lasers, then different wavelength used for dentistry, then laser safety protocols, laser tissue interaction, part of laser machine, कौन सा machine का कौन सा part है, क्या कैसे operate करते हैं सब कुछ, then how to choose a right laser for your clinic, then uses of lasers in dentistry, case discussions and videos, how laser can enhance your practice, then how to start your laser practice and laser practice management. We have a separate section of 1 hour for laser practice management, where we teach how to use laser to promote your practice. Then we conduct one-to-one interaction and hands-on on the goat jaw, vegetable and meat piece. This is as good as performing on the patient only. This is my clinic address where I practice in Aurangabad along with my wife. You can have a screenshot if you want. You can contact me anytime if you need any help regarding lasers. And thank you for your patient listening. I would like to thank organizers, my friend Dr. Ivan Gadge and Dr. Kalyani Gadge, for giving me this opportunity to perform in front of you all. Thank you all. If you have any question, you can ask. Any questions? No questions? Good. Thank you. Thank you all.
Thank you so much and valuable knowledge.
Fine. Fine.
So, our speaker for today believes that life is always positive and negativity doesn't exist. Give him few minutes of your time and he will prove it. I know you all might be thinking, how is it possible? But Deek is here with us today to tell you how. With over 20 years of work experience in marketing, sales, engineering, and psychology, it gives him a wide spanning experience to draw from. He is working as a regional sales manager in Middle East and South Asia. He has completed his Bachelor's of Science from USA, MBA from Birla Institute of Technology, India, and then MSc in Business Psychology from UK. He has talked to thousands of people of various age groups and touched their life with positivity. Majority of his sessions are Q&A sessions, as he believes whatever motivation is given, people, if their core problems are not solved, then no motivation can help. He is active on social media with over 500,000 people in his community and has a WhatsApp group with over 10,000 plus members where daily positive messages are shared among the group members. Today, you're getting an opportunity to interact with Deek directly, so feel free to ask all your life doubts and get it cleared. This is more of a question and answer session where you have to ask your doubts about anything. As he says, you can ask me any question from birth to death. Please join me in welcoming Deek Parisani with a round of applause.
How do I switch this on? Am I audible? Yes? How she gets it always right? Her voice really. Okay, this is what I wanted. Because yesterday I did a session for an hour, and I went almost for 2 hours. And after that I had met most of you personally. So I've been talking for the last maybe 8-9 hours, to be frank. And today morning I had a session with another person. So my throat will be a little bit low because I've been talking with various people out here, right? Because how many are new to this thing? Can you raise your hand so I know you've been there? Who's new over here? Who was not there in the last session? Okay, there's a lot of new people. Okay, good. So that's good. That makes it more interesting. You can ask me any question from birth to death. That's what I keep saying, right? Any questions which you have about life, about positivity, or whatever's bothering you. Well, thanks a lot. All the audience are coming back. So that's good. So that's interesting. So one thing I saw, I'm a person, when I see some negativity around in this world, I make sure, I give my point of view with regards. One tip for the youth in general. Whenever you have empty seats, make sure you come and sit in that empty seat. I'll tell you why. When a speaker is speaking, they give out a vibe also. The more closer you are to that vibe, the more easier you will understand. Right? For example, I'll give you a simple example why I'm saying. When I'm talking here, your whole focus is by force going to come to. But if I'm going back there, what happens, I will tell you. It's quite interesting. If I'm standing here, I'm seeing all your heads. One will scratch the head, your head. Right? They will start moving there, your eyes are going to go there. So there is so much of, so the backer you sit, every single thing in front of you is one kind of a distance. Right? So that's why, I was an okay student in my class, but I made sure I sat in the front seat. Right? Because something you will get sitting in the front. So that's just one tip I found, because sir was talking, if you go really stand now, thanks a lot, she's come forward now. That's smart, right? So that is the other joke of life. You know the truth and still you don't want to take that action. Last time I was saying about this soft drink example, right? I don't know if most of you people will repeat it again. How many of you drink soft drinks? Soft drinks, everyone drinks soft drinks. You all know it's bad for health. Right? And still you have it. My question. So the world is gone in such a way that you know the truth. I have told the truth. Still people are sitting back. Right? Because okay, that's good. I'm just motivating you to take that step, because the first step towards positivity is basically taking that first step of action. Many people tell, think positive, be positive. That's all marketing principle from my point. As I keep saying, thinking positive is sitting in hell and saying everything is great. Right? Everything happens for the good. So, as I said, now people who are new, because I'm just interrupting my talk because there are old people and there are new people, so how do I balance this up? That's what the problem is. So for the new people, you can ask me any question from birth to death. That's what I say. Anything which is irritating you. Because what I truly believe is that each one of you sitting here have 5 problems maximum. God or universe won't give more than that. Because you can't take it. Most of the people don't find solutions to this and they go for some shortcuts to forget or run away from these problems. That creates various health issues and mental issues and etc. etc. Now people who manage to come, who have come here for the second thing, I have to tell something new also. So what I'm doing right now is make sure you trigger yourself to ask any question which is bothering you. There's 2-3 different ways you can ask me. One is directly a topic. You can say, anger management, or how do I be disciplined, or anything. How do I get out of a breakup? Most of the youth comes with that problem only to me. 70% of the girls and boys who ever came to me came with a breakup issue. Like every personal call I had, every second person is having a breakup issue. And you're going after this dentistry career with all this breakup, forget your career there because you need to fix your breakup first. So most of us are trying to suppress these problems, are trying to, see that, let's forget it, let's run away, let's run away, let's run away. So my point is to make you understand what these 5 problems are, provided you ask. If you don't ask, you make my life easy, right? Because it's quite easy to do it. I've done sessions to 5th grade students to 60-year-old group of people. So age is not a problem, right? So you feel free to ask, give a try, give a test if you want to, ask a testing question until you build a confidence and trust. There are so many ways you can ask me. One is to ask a topic, anger, depression, topic based. The other way you can ask me is, I have this problem. I can't manage my family. I don't have a work-life balance, or whatever it is. It's your problem. The third way you can ask me is, don't tell me it's your problem. Tell is, today's generation have this. Today's husbands are facing this. Today's, youth is getting addicted to this. So don't tell it's your problem. So no one knows it's your problem, right? It's very clear. So you can ask me that way also. My sessions are really strange because I corner you. Ask me the question, I will speak. If you don't ask me, I'm just going to keep my mouth shut. Why, I will tell you. Many professional speakers have come here. When they tell you, do you have any question, everyone is just keeping their mouth shut. Right? Like Sir gave a beautiful speech. Right? I'm not in the technical background, but I know many of you had this question. So if I had made 1 or 2 people stand up and ask a question, I know next session you will stand up and ask that question. What I believe is asking is equal to growing. The more you ask, the more you grow. If you ask for promotion, you get your promotion. If you ask for better marks, you get your better marks from your teacher. If you want to ask the girl or boy you want to marry, if you ask only, or else they'll get married to someone else and they're going to go. So people have stopped asking. And they have become a blank listener. Right? Many people, sir, when I go for sessions for bigger groups and for college and all, they say, sir, I want to know your story. I said, if I tell my story, I can influence you in some form or the other. I don't want to influence you. I'm not here to impress. I do all my sessions as a giving back to the community. I don't charge, and some people, I had a ma'am, she wanted to be a motivational speaker and she was talking, sir, I'm sure after 5 years you will start charging. It's a promise to the world, all my sessions, as long as I'm alive, will be free of charge. Anytime you call me, I'll figure out a way to come and do it. Right? Because I have my work, that's going fine. This is basically as the giving back to the community. Right? So, questions or no questions? Now everyone is getting irritated. What to ask? Should I ask? What I'll tell you is, if you ask, yes ma'am, yeah, go ahead, 2 questions. They're all in my last show anyways. Go ahead.
You scroll Instagram or anywhere you see manifesting.
Yeah.
You train your mind, you train your subconscious, but then if you overthink so much and there is this negativity always, then what do you manifest and is this real? Like, I've never tried it.
Okay, good. So you're talking manifestation, law of attraction, secrets, and blah, 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 blah. Okay. So, let me give an example from my perspective. Some people need law of attraction, who want to attract the things in this world. Now, everything what happens in this world is positive. So that is also positive. But the question is, you need it or not? Like even drugs is positive. Now you'll ask me how. Even alcohol is positive. If you ask me, I will tell you. Right? But I won't tell now. If you ask me. Right? I need people to stand up and ask. Because I am a person who believes that life is all positive. There's nothing called negativity. You tell me a negative experience, I will tell you how it is positive. Right? I know I'm a strange guy. Right? So, the question is law of attraction. Yes, it is true. You can attract anything in your life. Right? Provided you use your mind. But the point is, it's such a distractive world. How much ever you focus, for example, law of attraction says focus on a red Ferrari. Right? You put your Ferrari pictures, Ferrari. But our mind gets so distractive that when you see a red Maruti, your mind will go suddenly. Red, no. So what happens there? You're focused. But this red red Maruti comes, your mind gets caught on the red thing and you might look into it. So what happens? The mind is getting confused in one form or the other. Because it's a very distractive world. You're seeing car, Ferrari. Now, the other thing is, if you believe in God, law of attraction won't work. You know why? Because God, you're saying, Bhagavan, please protect me, please protect me, please protect me. God knows if you give Ferrari, you build up so much of ego. You're going to drive rashly, you're going to meet with an accident, and you might be sitting in the hospital. One side you're praying, God protect me. One side, He's never going to give you Ferrari because you know you're going to meet with an accident. So that is the other problem. When God comes in the picture, law of attraction has no place. So it depends, you want God or you don't want God, then let's talk about law of attraction. Now, if you don't want God, you're going after law of attraction, it will work again. But what happens in law of attraction is, you can attract a certain thing. But you have to compromise a lot of things to get it. There are many people with a lot of money, but single. Right? Most of the rich people are generally either divorced or 2-3 times married or single. If you really look at it. Look at the 2, 3, 4 richest men in the world. Right? Either single or divorced is something else. They can't attract a good wife or what. Now you go and look at all the law of attracting speaker guys. Okay? You go research the biography. Either 2 times married or they are single. What? They can't attract to them? Only money and fame they can? So this is what you got to think logically. See, this is the problem with human beings, right? Bankly, they will say get up at 5 a.m., 5 a.m., 5 a.m., 5 a.m. And you are also going after getting 5 a.m. But a girl who is serving her sick mother late night, can I tell her to wake up at 5 a.m.? It's not right. But what happens? Law of attraction, attract. You need 8 hours sleep. What attraction is going to work? No, she's attracting. Yeah, she's sleeping at 9 o'clock. So what happens in law of attraction is, more than law of attraction, which is LOA, law of action is much more easier. Go and do. Go and be worthy of a Ferrari. Go be the best dentist you can. You can buy a Ferrari. Why attract it? And that too distractive world. So what you need to do is, what I need to do to get a Ferrari. Study well, be that good dentist, mint money, and then go buy that Ferrari. That time too much ego also won't be there. This you're attracting, someone will give you that. And the other problem is, in this law of attraction, you don't know if you're attracting the right thing. You will say, I want the most handsome guy as my husband. You forget I will ask about good character. He attracts and he'll come. Attraction, no. Anything can attract. But the guy is totally wrong. Then you filter good character idea. Right? But his tooth will be one out. Oh my God, big problem. So why use so much attraction? Because when you don't know what is needed for you, generally. Life is going to teach you and evolve you. With time, the choices will also change. Initially you went for MBBS, you didn't get it, you go to dentistry, after that you go in specialization, after you see her as a laser treatment, okay, that's a new thing to go. So you keep on changing. If you are changing, how can you attract one thing? You are attracting because they are saying. Now, why this law of attraction and all becoming very, very strong nowadays? People want shortcut. Sit and attract. You can attract law of attraction. Go in the forest and attract. Will it work? That's why, saints go far away and then meditate and to attract various powers and all that thing. You can do it. But real meditators are people who are in peace in the most disturbed world, if you really look at it. Right? So I hope I've clarified on the law of attraction. Okay, good. More questions? Yes, ma'am. Yeah.
Sir, do we really need to step out of our comfort zone to be successful or be where?
Okay, now I'll have some discussion point of view. How do you define success?
Sir, maybe सबके अलग-अलग perspective होंगे.
What's yours? See, when you don't know what success means, then again you're going after the wrong thing. So most people define success by two things in the current world. One is money, one is status. You have these two things, you believe that you're success. Now, from my perspective, the greatest, richest man right now are single, going through a divorce. Are they really successful? Is a question you got to ask yourself. Right? I've talked to many doctors, mother and fathers, whose children are totally lost because both their mother are busy working. And they say, sir, I feel alone. Are they genuinely being the right mother and father there? So are they successful? Is the question. You have all the money, but no money to share to anyone close to you. Is that success? You have all the money, but no health to enjoy that money. Is that success? You have this big famous doctor name next to your name. And people are all giving you, that respect which you want. But your son is just spitting in front of you and going. Is that success? So define what your success is. Because if that is not very clear, how much ever you try to define it, you will never have clarity. My belief of success is very simple. If you are improving from yesterday to today, in every walk of life, which is relationship, education, health, finance and love. These are the 5 main aspects of positive living. If you are being a better daughter every day, you are successful. If you are studying and trying to be the best dentist where you can have more skills, more participating on various conferences, you are successful. If you are working on your health, how you look, how you present yourself, you are successful. If you are working on the finance, okay, Papa is giving me 5,000 rupees as savings, right? I'm spending 3,000 and saving 1,500 or whatever it is. I'm sure most of the pocket money you're spending 100%, right? Stupidity, right? Because you have to say that always remember something. Finance is what? Every 1 rupee I get, 50%, 25% I'm saving. If you have that attitude, you will never be financially broke. So if you really look at, and then love, which is loving yourself, then God, if you want to bring him to the picture. So these are the 5 aspects. Am I improving every day? You are successful. Don't come, now for example, you are a 90% student. If you become 91% student, you are successful. So each one of you look at your life. Am I being a better human being in every walk of my life? Everyone sitting here is successful. So if you start seeing life from that perspective, success is very easy. For example, a farmer is making 10,000, right? Next year he makes 20,000. A doctor makes 1 lakh. Next year he makes 1 lakh. A businessman makes 5 crore. Next year he does 2 crore. Who's successful? Farmer, not the doctor. Sorry, not the businessman. He made 2 crore. Still, everyone sticking to farmer? 100%? Because growth is there. So what is success? Growth. Am I growing or not? If you're growing, happily be in that way. But what you do is, you compare your growth with someone else who's making 2 crore. That is when the problem of growth happens and the confusion really happens. Got it? Doubt clear? Okay, yes. More questions? Ask anything, any doubts about life. Whatever's bothering you, irritating you inside. My session is a strange session, I know that, right? That's the reason I'm giving you all the comfort feeling to ask. That's why I'm saying, meet me once, clear all your doubts and forget me. I'm not here to make followers. I will never tell you, hey, my Instagram is, please follow me. I will never ever say, because I don't want people to follow me. I want to get done with people once I'm done with them, right? Anyways, I'm here around after the session because some things can be personal which you can't talk in a public forum, that we can talk personally also, not a problem. But then what I tell people is, if you have a question, ask. Because sometimes you're asking question on the behalf of someone who doesn't have the guts to ask. So you sometimes will be doing a good deed by asking a certain question, because some people are, wanting to ask. You are stepping back and taking education. Questions? Yes. Yeah.
Sir, how to watch content fast, because I have to learn lot of things.
Yeah.
So like bade videos होते हैं. Then
Yeah. Okay. How to study faster?
Yeah.
Right. Now see, this is the problem. Most people focus on studying faster. No one focuses on how much I'm grasping. The concept is not about how much I'm reading in a day. How much I'm grasping in a day is more important, so that it stays with me forever. Right? Now, many people say, when there's a new technology which has come in. When you listen to a video and you read together, you grasp faster. Right? But that's also marketing. Why? You buy an audiobook and you buy a book. See, this marketing is a very beautiful thing now, if you really start looking at it, right? They're just scamming you with various concepts. Now, what I tell people, when is your concentration level at very high? There are different times you have different concentration. That time, go and do the most important thing. First, you can grasp much as you can. When your grasp you feel is dropping, take a break. There are some people telling me, sir, 16 hours my friends are studying. Right? It's a scam. No one can study 16 hours continuously. Right? Half the time they have a magazine, something else inside. Right? And half the time they'll be thinking about the boyfriend or the breakup which is going on. But 16 hours I'm studying. So the point is not about the 16 hours. The point is, can I repeat what I have listened? Right? So focus on that. Speed is never victory. Right? The more you fail, go speed in action. Fail more. So you learn faster, so you can grow faster. Most people are what? Thinking really all fast. Yeah, speed people always lost at the end. So see from that. Did I answer the question? Okay. Good. More questions? No? Yes? Yes. Yeah, go ahead. Let me take him. Yeah, go ahead. Yeah. Yeah, go ahead. Come in front.
Sir, if we see a video, motivational video, or we listen to a motivational speaker,
yeah.
It remains for a while, and then we feel like at the end of the day we are same, we are feeling low. How to be in that phase only, that if we are listening to you, if we compare energy of yours and ordinary people, there is a quite difference. So how we can be motivated all the day?
Good question. Now, first of all, I'm not a motivational speaker. Right? Many people think that I'm a motivational speaker, and that's the best brand they can put when you compare with the bigger crowd. I don't believe in motivation in general, because motivation from my point is taking a vitamin tablet for an unhealthy body. Right? Taking a vitamin tablet for an unhealthy body. So that is generally stupidity. Right? So what you're doing is, your mind is disturbed. You go and see these people. You get that temporary motivation, but your issue is sitting with your mother and father. If you don't solve that mother and father problem, how much ever I motivate you, that's why I'm saying, if you have any question, ask. Only if you start asking, I will get to the root problem. But many people will say, oh, he motivated me. Wow, positive motivation. Oh, law of attraction, I understood. Knowing law of attraction, knowing about, nothing is going to change your life. Your mother is sitting there, as long as that is not solved, no motivation can ever help you. You have an issue with your husband, or you have an issue with your wife, you have an issue with your children, you have an issue with your brother, you have an issue with it, you have an issue with a guy. That are the things which is actually tying you up from all these motivations. Now, that's why I'm saying, meet me once, clear all your doubts and forget me. I am not here to sell a book, my course, nothing. Mine is everything free, so nothing to sell. Right? Why I want that to happen is, so you meet me, clear your doubts. Once you know which are the core problems of it, and once you begin to fix it, you will automatically be motivated. Yeah, as a baby, were you not motivated? Every child is motivated. You are born like that. Why are you changing? That's why I'm saying, live like a baby. You're born like a baby, live like a baby, and die like a baby. What most people do, you live like a baby, you live like an adult, then when you die, you live like a baby. Why go straight only, no? Right? Now for me, I can lie down here. I have no problem. What do people think? I'm a baby always. Right? I don't give a damn how you respect me or you respect me or not respect me because I don't care. I'm a baby. So when you start living like a baby, you're always self-motivated. So my main job is to get you back to the baby. Then what happens? Hey, how are you, man? Everything happy, good. Now, the other problem, you're listening to motivational speaker. What I truly believe is if you're into motivation, you only need one book to figure out your life. Only one book is needed. The action are there. You take the action. Most people are into motivation in the name of entertainment also. Oh yeah, kya baat bola. Oh, what a quote. You know, many people share quotes. Yeah, bahut zabardast quotes. I have share. Hey, my mother's problem, who's going to solve? Right? So what you're doing is vitamin tablet, health is getting spoiled. Health is mother. No. My mama's problem is mama, not mine. I have issues with my mother. No, I won't solve that. Oh, motivation. So motivation is simple vitamin tablet. You just see from that point, you'll understand everything what I'm talking about motivation. Now, the other thing is, it's called by a great, speaker, a very old speaker. He said, it's like a cup of tea. When a motivational speaker talks to you, he gives an idea and it's a cup of tea. If you don't drink that cup of tea, which means bring it to practical life, your cup is always full. So whatever he sends, it is not going to get it. Or you will throw this and get new one. But your life is not changing until you drink that cup. So don't see, nowadays motivational speakers are so good that they have good stories, good emotional people telling a story, fairness, mother being hurt, father being hurt, children should be like that and blah. They have big, it's like now motivational movement to kind of movie driven now. Entertainment. So the more you're after, now you watch a good motivational movie. Your baby is crying. Forget all the baby cries, motivation will all go in there. So that is the problem with motivation. People want shortcut solution. Did anyone, like I'm not blaming or people need motivation also. I'm not saying they are doing it completely wrong. But your need for motivation is making them do more of it. Now motivation has moved into business if you really look at it. Like if I can strategically plan, I can make you all my customers right now. Because I'm influencing you, I know that. Right? Then I say, please buy my book. Ta-da-ta-da. Then you'll all buy my book. Yeah, I became rich because of your wanting of motivation. The motivation is within you. My job is that, to make you understand that. Once you understand that, you don't need me or any other motivational speaker. Sometimes I feel I am the threat to the motivational speaking business sometimes, right? But anyways, that's my job to do. Doubt clear? Yeah. Okay, yes. Sir, you had a question? Yeah.
How to not get carried away with people's opinion around this?
How to be carried away with people's opinion. So if you... Sorry?
Not get carried away.
Not get carried away. People's opinion. Yeah. Inside family or outside family?
Anything,
Generally, okay. Now, why people's point of view is important? Because somewhere around, you want their acceptance and recognition to find your value. You want their acceptance and their recognition to find your value. So when you are looking for value from outsiders, their opinion will start influencing you. Point number one. Second thing is limited information about yourself. When you don't know why you are doing what you are doing, when everyone says against that, that will bother you naturally because you don't know why you are doing. Like many people I ask, why are you doing dentist? Oh, I didn't get MBBS, that's why I'm doing dentistry. I'm telling you, your first dissatisfaction is there only. Right? Because I've talked to many dentist kids this time and my last session also. Most of you by no choice have picked dentistry. I didn't get MBBS. So you yourself have bringing a low complex. These were the people who were there in my last session, and whoever came back, I'll give you a very good tip. If you yourself think you are an unsuccessful MBBS candidate and you are going into BDS because I have no other choice, you yourself have gone your complex low. So every MBBS guy is going to talk to you, his opinion is going to matter to you. So what you have to do is Yeah, I keep saying, a toothache is a horrible ache compared to any part of the body. Even that MBBS guy have a toothache, he's going to run to you only. Understand that BBS itself is a very valuable course on its own. Don't unnecessarily compare yourself with the MBBS people because they get more status. Yes, people give them status, but that doesn't have to influence you, because body is a one whole thing, right? So this is the biggest joke. The heart surgeon was saying, I'm a heart surgeon and all that. So it's a joke, right? So what he says is, if I stop you from going from bathroom, right, whatever it is, all the body will reject then and there, right? Because you need to leave it out of your system, right? So if you really look at life is, when you are wanting people's recognition, only then they can influence you. Mama, how is this? You have a doubt? How is this? If you have a doubt, people will influence again. So the problem is, when you are confused or when you have limited information, third party will influence you. And when you are half informed, other opinion is important for you, because only their opinion will fulfill it. So what you got to do is get more information about why are you doing what you're doing, know yourself, find out why I'm doing everything, what I want to achieve, where I want to become. Others' opinion won't even impact you at all. And that's how you will. So did I answer the question? Okay, perfect. Go ahead. More questions? Ask so I can answer. You can ask me anything from birth. Don't ask before that and after that, right? Because no one has gone through it. If someone tells you, I know what happened before life and after life, generally they are scamming you. Right? Go ahead. More questions? Anything you can ask about career, about life, about future, about marriage, about love, anything. See, every second girl and boy who I talked yesterday had a breakup issue or a girl and a boy issue, and you people are not asking me yet. If you don't ask, I'm happy. You make my life easy. But I'm going to force you to keep asking, or until they say stop the show. Right? Anything from birth to death, whatever confusion, your parents' issue. But don't ask me one question, how I'm answering the question. Anything else you can ask me, because even I don't have a clue, right, how I'm answering it, right? Questions? Yes, yeah, let me, okay, two, yeah. Oh, my the 3-question girl. Okay, let me take a new one, yeah. Go ahead, you ask. No, let me finish it, yeah.
So, how do you actually stop holding grudges against people for a long period of time?
Grudges within family, outside family?
Outside family.
Outside family is a waste of time grudging them anyways, right? Okay, let me just tell you, sit down, right? There will be many reasons why you have grudge with a person, right? Yesterday you was there on the dog example? You were on the dog thing? Okay, new people, do I have to repeat the dog? No, forget it. New people, what happens is, okay, now this is what happens when two different group comes, okay, anyways, there's a dog example. I told the kids of how to win over when someone calls you a bad word. If someone new asks me the question, I'll repeat it, or else I won't repeat it. Why do you have a grudge against certain people? Because you have a feeling that this person has done something wrong to me. That's the general reason. But sometimes, even though he did something or he did something wrong to you, is that wrong experience has made you what you are right now. For example, a teacher hit you very hard, right? You will have a grudge against the teacher. But that hitting has made you a good student in your upcoming class. So that way, the teacher has actually brought that grudge, got you against it. I will prove the teacher that I am only well off, and you have become that new girl because of this person. So when you start being thankful to that person for making me who I am, then the grudge is no more there. Every bad experience in your life is something life trying to teach you. If you learn the lesson, the person will go or new person will come. Now I will tell you another joke of life. Whoever you hate or whoever you grudge will keep repeating in your life in different forms. Check it out. Whichever guy or you have grudge against, he will keep repeating or she will keep repeating. Now she's smiling there. Now she got the code. Right? So what you got to understand is, leave that grudge, then the person will also stop repeating. Right? Someone irritate you with a bad name, you'll see your college people will irritate. Now for example, that's the thing. You have a scar on your face, for example. Right? People are going to make fun of that scar on the face. Oh no, forget the scar. Let's make it more easier. A pimple on the face. Right? Girls are very worried they have a pimple on the face. You know, look at the mirror. Oh yeah, ye pimple kidhar se aa gaya. Tata, tension, 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 tension. Yeah. Then when you go to school, your friend said, hey, what happened to the pimple? Hey, Kaka, what happened? You didn't wash your face. Then you go for a marriage. Auntie will come. You know, uncles and the aunties of the world. They have nothing to do, free time. Who has pimple? Who has pimple? Ah, what happened? You not cleaning your face, blah, 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 and make you feel bad. But the joke of life is the day you accept this pimple is forever on my face, you will see people not asking why. So if you really look at it, it is you who's making people sin. And that's the beauty of God can't come directly and solve your problem. You have an irritation issue, God is going to keep sending you irritating until you fix it. So whoever you have grudge on will be grudged as a person, then will come as a friend, then will come. Sometimes, you know, I tell to girls and boys, don't show so much grudge to a girl and a boy. Generally, your husband also will turn up like that. Now, law of attraction, whoever asks me, you're attracting the grudge. So you'll attract a husband like that to figure out the grudge which you have also. Doubt clear? Forgive that guy? Happy now? Good. Go ahead. More questions? Yes, ma'am. Yes.
So how do we gain our trust from the parents? But first it was there, but now it's not there.
Okay. How do you gain your trust of your parents? Trust can only be built by taking actions and not by speaking. Most youth and people have this tendency that I will speak and build up trust. It doesn't work. Especially parents, so forget it. What happens is, what I tell people is, trust is like a it's like a rope. When that is broken, you have to tie a knot, and the knot will always remain there. But then what happens is, long time you use it and build that trust, the knot will stretch and become a rod, become a rope again. So, never ever tell to your mama, sorry, I broke your trust, aaj se main, I'm going to be good. Stupidity. Right? Because trust is broken. So trust can only be built by taking action. So what you broke for example, let me give a simple example, girls boys problem. You are talking to a guy, your mother found out. Okay? Gone, no? Trust is broken. Simple example. Right? Trust is broken. Now how do you fix this trust? You say, Mama, aaj se main baat nahi karne wali hu, Mama, forgive me. Still you're talking, huh? That's a different thing. Right? After saying that, also you're talking. So parents will feel the energy. That is a different thing. But if you genuinely feel that you made a mistake and genuinely you want to improve, you tell Mama, take my phone. Keep it with you. Only when I want to call, if any boy calls, you respond. Mama, whenever when I'm taking the phone, you can come to my room and listen who I'm talking to. Mama, I have opened my laptop for you. You see what I'm chatting to. So you do it. And that is how you build up trust. Not by talking to aaj se main baat nahi karni. So whatever mistake you did, do the corrective action. And keep doing the corrective action. If they're still not trusting, it's their problem and not your problem. Because God has seen that you've improved. So we all make mistakes. And you get caught for a chance to improve that mistake. You improve, God will put tick in the box. If your parents don't tick, it's their problem. And that is how you build up trust. Okay? Okay, good. Next. Yes. Yeah, go ahead.
Sir, exactly what is ego? And sir, why we are just, sometimes I'm just holding upon my self-respect and people are just calling it as ego. That she is very egoistic person.
Okay, good. So you have an ego? How do you define ego? Because because the problem, ego have a very different versions of ego. You have the psychological ego, you have the spiritual ego, you have the general ego, you have the attitude ego. So there's many egos. So which is the ego you're talking about in general?
So first I was asking what is exactly the ego is.
What exactly is an ego? Okay, now which perspective I will talk. But in general perspective, I will tell you what people say. Because I don't want to get into the spiritual side of things because it gets really confusing. In general, what people say ego is, you think that You are existing because of all your hard work. Everything what I have achieved is me, and everything which is revolved, the whole world revolves around me, and I have achieved everything because of my hard work, my contribution. I am what I am because of me. Is the general ego which people say as ego. Is that your ego also? Yes or no? Okay, then what is the ego? No, oh, you don't know at all ego. Okay, so my perspective.
I'm just holding upon my self-respect.
Yeah. So self-respect is okay. For me, self-respect is the most negative word in this world. If you have high self-respect, negativity is your friend. So self-respect. If I call you a dog, do you feel bad? Why? You're a dog?
No.
Then?
But still,
But you have kept a human being self-respect on your head that I am a human being. If someone calls me a dog, oh, my self-respect of a human being is hit. But my next question, do this I have done earlier talk yesterday also. If some mental person calls you a dog, how do you feel? No, that time self-respect have no issues over. So based on different people, your self-respect also changes. So again, it's not confirmed. Right? Now, if I tell you a dog in another language, right? I'm not calling kutta, in Malayalam it's called patti, right? If you know it. Your self-respect is hit. No, I'm telling you, I'm explaining you, right? It's not about the meaning of the word. Look at the dictionary, you will find it. I'm not here to give you the meaning of the word. I'm getting your self-respect concept out so you don't have an ego. For you, what you're saying, it's my self-respect, people are calling ego. Because you are, see, for me, when I talk word depression, when I talk about anxiety, each one of you have a different meaning for it. So my point is to clarify that meaning. I'm not here to clarify the dictionary meaning. Meaning you can go in dictionary and find out. So your concept is self-respect is ego. But having a high self, people are calling me ego. So what is this ego? This is the ego. When I call you a dog, you are getting hurt. Your self-respect made up ego is getting hurt. That's all. So now you want to ask me how to get over it? Then I will tell you. You want to know how to get over it? Okay. So how to get over it is, first of all, again, you are differentiating different people in different forms, which means one person is educated, they call me a dog, my self-respect is hurt. Other person is mental person, if he calls me a dog, I won't get hurt. So it is, you have a differentiation between each people, and each person controls you based on who they are. If you see everyone is mental person, where is your ego hurt? Now, if you really look at it, everyone needs an ego to live as human being. That's a spiritual aspect of it. Without an ego, you will just die. Right? But I don't want to get into that. But the question here is, if your friends are calling you have an ego, one is maybe you're too good. That's why I say, when people can't be like you, they make fun of you. When people can't be like you, they make fun of you, so they feel good that I can't be at them, but I made fun of them. Generally, if someone is making fun of you, they can't be like you. So if someone is saying, oh, you have an ego, maybe you have a good high self-respect. So keep that self-respect, but don't get hurt in the process when I call you a dog. Right? And that is how you work it out. Don't differentiate people. Yeah, if a guy calls a human a dog, don't you think he has a mental problem? Like, logically. Like when you, now for example, if this is flower, right? I'm saying this is a tree. What you will call me? Mad only, So everyone calling your dog is mad, they say a human, they're a mental person, no. Why take it to your heart and my self-respect? Now I'll tell you, if someone calls your mother a dog, what you will do? All anger will come, your mother is also a dog. So what happens there? You both become dogs, barking at each other. So humanity is gone. So go above. Be the human. Then there is no. That clear now? Good. Next question. More? Nothing? My job is yes. Yeah.
So what should be the limit of planning? As a human being, we plan alone. So
as a human being, we plan alone.
What should be the limit of planning?
Planning?
Limit.
For how much you have to plan?
Yeah.
Okay. So limits, what is stopping you from planning completely?
No, like we just plan and don't do actions and then leave it. So what should be the limit of planning?
Okay. So how much time do you spend in planning and how much time you spend on execution?
Yeah.
Okay, that's a beautiful question actually. Now, what I tell people is plan, right? Take how much ever you want time to plan. But after the planning is set, no, then no more thinking. Do until you get a result. But the other thing is much more easier, is if you have a slightest of idea of what you're going to do, go and do it. Let the result come and improve. Because anyways you have to fail. See, failure is the most positive thing in this world. Anyways you have to fail. Plan quick, fail. Plan quick, fail. Plan quick, fail. In the failing process, learn. So what happens? Growth is faster. The quicker you fail, the faster you learn. It's a simple formula of life. As a baby, you fell down. Many people say, sir, I can't take failure. Yeah, when you're a kid, you fell so many times. And then only you learn to walk. Cycling, how many times you fell down? Then only, but once you learned, you have learned. So, sometimes many people spend a lot of time in planning. So that is a waste of time also. So more than thinking and planning and all that, have an initial idea or go deep into it, conclude the plan, then execution. If the result is going against you, change your plan also. Some people are there, NETT exam, I will drop, I will try again, you fail. I will drop and try again, you fail. I will drop, yeah, 3 years are gone. The planning, no? Big planning, 3 years of planning of how to pass the NETT exam. 3 years are gone, others are sitting as doctors, me still NETT. So, once you fail first, find out why I failed. Is my planning wrong? Did I study or did I not study? Did I do my studies not that right way? And change that plan if it's not the same plan. Because if you do the same thing again and again, you're going to get the same result again and again. So if your planning is wrong, change it and shift it. Because if you don't shift it, the result is going to be the same. Now clear? Go ahead. More questions? Anything and everything and anyone can ask. Whatever is bothering you, irritating you, yes ma'am. Yeah.
Sir, same the planning thing.
Yeah.
Sir, how stop procrastination? मतलब हम plan करते हैं, फिर procrastinate करते हैं, फिर plan करते हैं, फिर procrastinate.
Okay, stand. Let me have a counter question. Whenever you come, I have very good counter questions. Okay. Do you procrastinate your birthday celebration? Yes or no? But you felt bad about it, no? Yeah. So, what is important, you will do. Do you procrastinate when your mother makes the most favorite lunch? Before she makes, you're in the kitchen, Mama, taste karne do. No procrastination there. When you want to, do you ever procrastinate brushing your teeth? No, because if you procrastinate, my teeth is going to go. Sit down. So we only procrastinate things which are not important for us. What is important, you procrastinate. I will tell you something. Every kid sitting here who is doing BDS because they didn't get MBBS are all going to procrastinate. Because your interest is still sitting in MBBS. As long as that is not moved out to BDS, you'll always, MBBS, milna tha yaar, BDS mein fas gayi, kya na karu, right? So when you're in that attitude, you'll always procrastinate BDS. When you can be a great dentist with this. Yeah, all these doctors are minting money, they're giving speeches, I'm sure they're making enough money there. Some GPs are not making what they are making. And you are going after, I want to be a GP with this MBBS. And they've been so specialized with laser treatment. First time hearing laser treatment, I was like, holy, even laser has started on the best part. What I liked was the teeth whitening by laser. Right? That is the other problem. Marketing, no? He was marketing white teeth. Who said you have a problem, you have a brown teeth? Hey, you are creating a complex within your that I need a pure white crystal teeth. If you have slightly shaded teeth, what is the problem? Right? So that's the other discussion altogether, right? But I don't want to get into that. So did I answer the question? Yeah? Sure? Okay, good. More questions? Yes, ma'am. Yes, the fifth question from her. She is just utilizing me 100%. No, do it. That's what I want, right? And so that you don't meet me again. My only condition is meet me once, don't meet me again. Because there's another billion people to serve, right? Go ahead, tell me. Is it good to be sincere? Okay, that's the question. So your basic sincere means, what is the opposite of sincere? Being selfish? Then, like when you say sincere, what do you mean? Okay. Oh, because sincerity towards the actions which you're doing. Okay. That I was thinking sincere relationship and also I was taking a different angle. Right? Okay. So okay, fine. No, you ask me the question, I will tell you, right? Because generally my average I get all these questions, right? So why are you not sincere? Again, is the BDS MBBS problem? This is the same question. Yeah, go ahead. Then what do you want to do? Forcing you to, now the real topic is coming, right? So parents are forcing to BDS, so you do. So what is your interest? Artist. Good. So if you are an artist, keep your artist job or whatever you're doing when you have your free time. So do BDS. When you're getting the interest will slowly go low, no? Go and draw. Your interest will come up again. Then what do you do? Sorry? No. See.
So the parents will say, what are you doing right now when we are spending so much money for your BDS?
Okay, parents will say that. So parents, Mama, I have studied chapter 1. I am taking 5 minutes break to do it. Have that open conversation. Because if you don't have that open conversation, they don't know. So you tell them BDS person needs to study 8 hours every day. Mama, now building trust also. Okay? Mama, 8 o'clock, go and tell her, Mama, 8 o'clock I am studying, don't disturb her. Right? So the trust is built up. Right? Mama, 2 ghante pad liya, just 5 to 15, 20 minutes, let me do art. Mama, 2 hours I study. Initially I was studying, not even studying.
In the lockdown, I was devoting my studying also and the sketching also. But my mom is, you are doing sketching for the 2 hours, and
That is the problem, no. So she doesn't know how much you have studied. Yeah.
she didn't see that.
Okay, that is the problem. Open, she didn't see that. So that's why, what did I tell you? When you start your studies, go and tell Mama I'm studying.
Why she only saw that we are sketching for the 2 hours?
No, because why? You're frustrated with BDS, right? You're frustrated with BDS, that mother will not see. What you love only, mother will see. Right? Because your interest shouldn't go too much into that. So God will send your mother only when you do artwork only. What I told you, not 2 hours studies, 2 hours art. 2 hours studies, 15 minutes, 20 minutes, half an hour art. Just to bring your sincerity back. And that is how you got to do it. So before studying, Mama, 2 hours I'm going to study. After that, half an hour I'm going to do art. After that, 2 hours I'm going to study. Which mother will say no? Right? If you or do fake studying also, but 2 hours study. Build up the trust first. Right? Because trust is important. Then what happens is, once you do it for 1 year, then the art time, oh, you're taking break, no, wait till you take break. That same mother will tell that back.
She is also saying to the teaching, but I am not interested in doing it.
First, you work on your art. Post it on Instagram. Post it on Facebook. Do art with serious art or time pass art? Okay, serious art. You draw people or art? How does the art work? You draw people, sketching. Go and do sketches for celebrities. Sketch them and tag them. Did they ever tag you back? Okay, so that's what you got to do. You have to promote your art. Then do uncle auntie's portrait. No, I will tell you how you getting your art right. You do uncle auntie's portrait. Uncle auntie will tell your mother, hey, your daughter is such a good artist. Then she'll come to, hey, you draw, huh? Hey, kab se shuru kiya ye? That same mother will come. But first you work on your art. Fine tune your art. Once you get a respect around the society for your art, your same mother will say, baby, great job, forget BDS, do art. But you got to build up to that level first. Because if you don't build up that level, now what you're doing, a frustrated artist in the name or working BDS. Let that positive artist come. Right? Then maybe sometimes when you do BDS, the doctor will say, sir, ma'am, sir, they'll come to you, ma'am, can you sketch the tooth in a very sketchy way? We have a new design which you're drawing. Your art is used in BDS in creating new models, new design, where you can mint money also. So BDS is good for you. When you see from that point of view how art can be used in the BDS designing and all, I've seen a lot of sketches. It's all artwork. You have a career there with BDS. And you are saying, oh, I'm stuck in BDS. Now automatic sincerity will come. Because now I know there is art in BDS also. Can I be the artist for the BDS field? So you are satisfied in drawing. Your BDS helps you because it gives you a core overview. And you become a dentistry artist. And you know, I will design the tooth in a right way so you'll have a great smile. Put an art that way, people will come out, hey, can you design my teeth? And then artist is also happy, BDS is also happy, mama, papa is also happy, BDS. Everyone is happy. That's why I'm saying life is all positive and life is simple. But when you hold on to this frustration, slowly you will go to the depression level. Slowly you will go and I have mental issues. Slowly you will think that I am an hopeless person. And so you have an artist alive in you. You are killing that. When you kill that is only when all these crazy mental things are going to hit you from back. And that is how you got to work. Now after this, she will not ask me any questions. I'm sure about it because she has come here to get it. She tested me one with a question, tested me. This is the main problem. So that's why I'm saying everyone have 5 problems in life. If she figures out a mother, now you will see a natural smile. You see after the session, no? You will see her smilingly walking. Because she has decoded the biggest issue, which is her mother sitting at home. That would clear 100%? Good, all thanks to God. Yes, perfect, thank you. Yeah, go ahead, more questions? Ask so I can answer and clarify. If you don't ask, you make my life easy. I have 5 more minutes to go by time. Or else until she says to stop. Ask. You know, this is what I tell. Everyone is getting irritated. Yes, ma'am. Yeah. Oh. See, now everyone is hearing. See, you should ask this way before. Right? Now, toxic relationship means, is it a family, outsider, or a boy? Okay, boy. Okay. So, now first of all, let me talk about love in general. Because most of, sit down. Because most of you are confused about love and is it love true? And you know, today morning also someone asked me about love. I'll tell you how love happens. It's simple. And I'll make all these things very simple so you all can understand. You want a girl's point of view or a boy's point of view? Girls, okay, I'm a boy, I'll take the boy's point of view, right? Oh, now everyone has come so serious forward and, you know, with all the sincerity has come back when this topic has come. See, this is why no one asks this question. See, I told you, right? You can ask me any question from birth to death, right? And feel free to ask. Because I will tell you, until she's not getting out of the toxic relationship, she can never be a good BDS. And that will constantly bother her. And that builds a frustration in the education. And that builds a more frustration in life and the mental thing aside. So, how love works. Let me tell a boy's point of view. And where it goes wrong. Right? Generally what happens is a boy will look at a girl. Right? Even girls attract. Huh? Don't think it's only boy. Right? I will say both sides of the story. So the boy will look at the girl. Technically what he does is he'll have a favorite celebrity. He will try to match her first. And then he will match her and then they say it's a good match. And his friends, he will discuss with friends, yeah, you know, she matches you quite well. Go, propose. It is stupidity for any guy to directly go and propose. Right? Best is to do indirect method. Be friend first and then go, right? That's always smart, right? Don't go directly, right? Because, yeah, she doesn't know you. And if she doesn't know you, you go and ask out, you know, it's dangerous, right? But I'm not giving you how to propose, right? Don't get into the relationship in general. So the boy looks at the girl, everything is matches, he might take a first step, let me be friends. Right? That's the smartest way to start. Friendship is the best way to any relationship. Even girls do attract. Girls in the front of the guy, they move their hair back, they will show that attraction. You know, some girls will look like this, that always, right? So they do that. It's not both sides attraction happen because it's a human instinct at the end, right? So once that happens, you start the friendship. You know, we become friends. Everything is okay with a girl and a boy. Not a problem. You can be friends. Best friends to a certain extent. Now, as I told you last time, best friends is all scammy relationship. There's no truth in best friends or best friends forever. If you ask me what it is for the new people, I will tell, but old people already know about it. So once you get into that step, when is the first time you cross this relationship, which is I'm against, is my problem is your problem is my problem. That is when you cross this friendship. I'm there to solve all your problems. I will help you, here I will help you. Mama's not talking to you. Yeah, I will talk with you. And so solving, which means all this while the girl was, or the boy was in the 5 senses. Now you took them in their mind. Right? Solving, my problem, your problem. Solving. Slowly you will take this person to your heart. Why? Solving. I cannot live without you, you cannot live without me. Solving problem, no. So that is a general process of love. This love at first sight is all movie stuff. Right? You won't see the guy coming in the horse, the wind flowing and all that all happens. Some flowers will be falling. That is all, movie. Love at first sight never happens. Or you have the other justification, Pichle janam ka rishta tha. And then, that we don't know what happened in your last life. Right? So we don't know what happened in your last life. So what happens is I said, ask me any question, birth to death. I don't know pichle janam ka rishta tha. So that is a made up stuff again. So everything is a process. You look at any relationship, it starts with friendship. And it is smart for any guy to start with friendship. Directly you say, I love you, the guy will slap you. Right? So the problem happens, my problem, your problem. Now, why does the relationship become toxic? Right? Sometimes the girl takes it to the heart and the boy keeps it in the eye. I'll give both examples. So how did it become toxic? The girl takes it to the heart. Now, why is the girl or the boy taking to the heart? What I say is gap filling. Which means my mother didn't give me the care, this girl is giving me the care, so I think this is love. My father didn't give me the protection, this boy is giving me the protection, so I think it's love. My brother didn't give me the time, and this boy is giving me the time, so I think that is love. No one gave me the attention, this guy is complimenting me, everyone is hating me, so that's not love. That is gap filling love, which is fake love. Right? Which you all assume as love. That is a joke, right? When I say gap filling love, you're all seeing as love. So get out of that thought. Now why this toxic relation happened is, when you take it to the heart, guy only puts it in the eyes, which means you look good, good match. When another good looking girl will go, he will look. Because he is going after beauty. So that time your heart will get irritated. Hey, why are you looking at other girls when I am there? Friction will start. Then the fight will start unnecessarily. Hey, you didn't take me. Oh, you didn't call me. Oh, you forgot my birthday. Oh, you you will start. But the main problem is that heart, he's looking at someone else. He's looking at someone. Now let me tell a girls. I don't want to, there are more girls, sometimes boys. So let me tell a boy's point of view how it happens. Now someday the guy will take it to the heart because her mother every day thrashes him, and this girl gives him all the attention and love. So what happens? Most of the guys in love is in the helping mode. Yeah, kuch bhi chahiye main karta hu. You want to drop you, I will drop you. I will carry the luggage, I will carry the luggage for you. All this thing will happen. But what you don't understand, carrying, he'll get tired, no? There's a limitation, people. Now there are, some girls have this, I have this problem, I have to share with someone. So continuously you're throwing garbage to the poor guy. He'll get tired, no? And he's carrying you and going. One day you will put him down. She will put him down. That is, oh, you never used to like me before. Now you like some other girl, I think. Friction, toxic will come, fight will come, and all these things will happen. Now, how you understood how toxic is coming in? It is an imbalance of that love. Which is someone has losing interest. Someone is not doing, so basically if you really look at it, you have a certain expectation and he has a certain expectation. When these expectations don't match is when the relationship becomes toxic. So you have two options, either to reduce your expectation or to get out of the relationship. My point is best to get out. At the age of 20 till 25, or what I say is till the time of your marriage, because every society, every community have a different marriage for girls and boys. You can never figure out a guy. You'll normally fall into the wrong relationship only, generally. Again, 70% of the girls and boys who talk to me came with a breakup issue only. So on average, every 70 relationship is breaking up. Now we don't call your boyfriend and girlfriend tell this, right? But it is going to happen. Now, if it is a toxic relationship, get out of it as quick as you can, because after marriage is going to be more toxic. Right? I know so many parents, not parents, the kids, whose parents marry because of love marriage, and this toxic is there, and the toxic is applied to the kid. Anger comes, kids get the shouting. And then the kid calls me and, sir, my parents are always shouting at me, I don't know why. Then we talk, it's love marriage, what happened? Then we come to, then I tell him how to get out of it, that's a different thing. So to get out of toxicity is, get out of it as quick as you can. Because the only person who's going to hurt is you only. Now, why you can't get out of it is the next question. Gap filling. He's giving me the care, no. Like many girls I've seen, especially girls, because of this care, you cross the line and go physical relationship with the guy also. And then it becomes very difficult to get out. Right? So, I always tell people very simple funda. Before even getting into this relationship, see if religion, caste is all good or not. I'm telling you the truth. Because 99% your parents are going to be the greatest strength. And what the youth tells me, sir, after we settle, parents will say yes. I will tell you, parents will say no. Because father's ego, back to your ego, right? Father's ego, you can never win. Now many girls say, sir, my parents are very forward. They give me everything what I want. If you really want to know if your parents are okay with love marriage, go on the dining table. As a joke, you ask your father, Papa, there is one Kerala guy, will he allow to marry? As a joke, joke discussion. You see his face. All the truth will be there on his face there. Yes or no or. So if you know your parents are going, like I have seen girls and boys come and cry in front of me. Sir, my parents are not allowing me to getting married. You already knew caste problem is there. Then why get into the first? When he knows different caste, okay, we'll stay as good friends only. No, my problem, your problem. Once you get into my problem, your problem, love and then break up and all these things will happen. So, if you're in a toxic relationship, have an open conversation and get out of it as quick as you can. Other thing is, why am I short of care? Maybe your mother didn't give you the love. Go and tell your mother, sorry, give me a hug. Maybe that will fulfill your need. Have good friends around you. That will fulfill your need. It is not that now many kids tell me, sir, everything I can't share with my parents, no? There's a typical dialogue there, everything. You're doing something wrong, that's why you can't share. So don't do it. See, that is what willful ignorance. You know it is wrong, you want to do it, and don't want to tell your parents. And you say parents don't give freedom. I'll give you freedom. You can do anything in this world, whatever you want, your full freedom, where you can stand in front of the stage and tell them, I did that. You can do anything. I give you full permission. But whatever you do, you should have the guts to stand in front of the world and say, I did it. If you're hiding it from there, you are hiding it from the world. And when you're hiding from the world, you fall into toxic relationship because it's all hidden. Stop hiding your stuffs because some person is giving you something which the world is not giving. So build up that relationship with your family. Now many people ask, sir, why do youth go into love in the first place? One is movies. You see celebrities loving. Now all movies are college movies only. Olden days movie, there is no college love story. Now it's all college. Now even school love stories are coming. Right? So school guys are also trying. Yeah, this also I will try. Right? So that is one way. Don't expose yourself to too much on this. See, other problem is girls are talking a lot about boys are not respecting. You yourself is reducing your standards to every guy who fills your gap. How can the boy respect you also? If you start saying no only, your value will increase. You are available for everyone, where the value will increase. So what you need to do, girls and boys, I am not comparing that way. Know that you are a diamond. When you are a diamond, you won't give it to everyone. You only give it to people who is truly worthy of it. And to know who is truly worthy of it, you have to be a diamond merchant to be that. So that is only at the age of marriage time you can actually figure it out. So that's the general overview. So how to get out of toxic relationship is, get out of it as quick as you can. That's point number one. Learn to love yourself. You don't need, like one of the sir asked, third person's point of view. You don't need him to say you look good to feel good. Alright? You can look into the mirror, I am beautiful the way it is with the pimple on my face. Once you start genuinely seeing that beauty, you don't need his acceptance to look beautiful. So when you begin to love yourself, you don't need another love. And when you believe you can bring that same love within the family, you don't need an outsider. Most girls and boys go outside in search of love is because somewhere around they have incomplete love within their family. Now, the next question, when you're getting out of relationships, typical question which I get from girls and boys, sir, at least we can be friends, no? After the breakup. Our girl is laughing, so she tried it out already, right? So at least I can be friends, no? You can't be friends because you already crossed the friendship level to lovers. There's no going back. So disconnect. Thank you very much. Today onwards, I don't want to see your face. Today onwards, I'll work it out from there. Right? Did I answer the question, ma'am? No? Yes? Did I answer the question indirectly? Clear, no? Okay, fine. More questions? Yes, ma'am.
How to take criticism positively and how to know that it is a good criticism and it's not just to pull you down.
Okay, so how to find out if a criticism is good or bad? My point is, listen to every criticism. Because you learn two things, something about you or something about them. Listen to every criticism because you learn something about you or something about them. So when someone gives you criticism, which can be, let me simple, you are looking ugly. Simple criticism, right? Someone tells you feel bad about it. So first thing you got to go and look in the mirror, am I looking ugly? If you think you are beautiful, and if you feel that you're beautiful, that criticism is to bring you down. Because hitting your self-confidence is hitting your point of view, it is the way you're going. Now second criticism can be a positive criticism, which means, you know you're looking like this, can't you dress this way so that you look better? So it is basically not hitting you directly, but indirectly using your positive thing to use that to make an improvement. That is generally a positive criticism. Now the third people are there, right? No, they're free time. I say the uncles and the aunties of the world. They have nothing to do. They like criticizing. It's their job in this world to teach you all about criticism. God selected few people to teach about criticism to people. So they will come directly. If you see, those aunties and uncles are in such a way that if you score 90%, they will say 10 marks you lost because you have a relationship with the guy. If you get 100 marks, they will say, oh, she copied, that's why she got 100 marks. So these are the uncles. So they will keep criticizing. So those people ignore and get out of it. Then, the third person is criticism within family. Now that you can't throw like the people or whatever it is. Those people listen but don't respond. When your mother, father says a criticism, listen, don't counter it back. Maybe they don't understand you. So make it a point when they're calm, explain. Most children, what they do when parents give you criticism, you directly counter. Nahi, mama, main aisa nahi hu. Oh, you know better than me? I saw you since childhood. Blah. She'll bring the parents card. I know better than you. So whenever parents criticizes you, pause, respond, ha mama, whatever you say. And mama will be in a good mood, no? Going picnic time. Mama, wo din aapne criticize kiya tha, explain to her. That time she'll understand. But when she's in the criticism mode, no, with some anger, and that anger is not that criticism, somewhere else you didn't help her, that criticism is coming as criticism. So parents' criticism, listen, don't respond. When a good time comes, talk to them and explain. Generally, you will work it out. Right? Because there the parents' ego also gets hurt. Now, there is this fourth point, which is the teacher's criticism. Right? Generally, teacher will generally criticize you for good only. Generally. No teacher are really crazy. But then, you have to see the teacher. Does she have favorites or not? If she has favorites, then that criticism can be manipulated. But if she's a neutral teacher, generally there is something for you to learn. Maybe they might not tell you the complete criticism, but there will be something within that. That's what I keep saying. A good teacher tells you how to be a good student. A bad teacher tells you how not to be a bad teacher. So criticism for teachers is always positive for me, because they are telling you be this or not be this. And that's how you see it. Ma'am, did I answer the question? All scenarios? Oh, great. More questions? Ask. Oh, my time is done? Or is still no, next doctor has not come yet? Okay, so you have more time to ask anyways. More questions? Anything? Everything. I know many guys have still questions there. Hey guys, all girls only ask me questions. No, guys have no questions or what? Now everyone looking left and right and left and right. See, ask so that you can get the answer. Yes?
Sir, how do we speak to our parents about our feelings, like real feelings? Because there is kind of communication gap between them and us, like generation gap.
Okay, so let me talk about generation gap. Generation gap is a made-up concept by both parties with the excuse that both shouldn't improve. Which means mama will say, oh, today's new generation are lost, I don't know. They are sitting in their own well. And new generation saying, old generation have known nothing. But what is the joke of life is 90% of everyone's problem is sitting with the family only. You look at, see, I tell you, I look at any problems. I've talked to hundreds and hundreds of people. 90% of problem is sitting with family only. And everyone is saying generation gap and splitting away from, and you're looking for motivational speakers to give you solution. That's why I keep saying the best book to read is your life book. If you are willing to learn, read that life, all the truth is there. And still you're done with your life, go and see your parents' life. What religious belief they have, what values they have, which gods they believe in. You start to connect with that values which made you bring into that family. Most of the solutions are there. Now, how do I start the communication? If you want to start the communication with your parents, talk what they want you to talk first. Talk what they want you to talk first. So what is your mother's favorite topic? Maybe it's cooking, maybe it's a TV series, maybe it is a news, maybe it's about her past. Talk that first. Everyone loves to talk about them. So make them speak first. Let the quota get over, then you have a chance. Most people want, I want to speak, Mama, be there, or else I'll pick a guy or a girl. So first thing is talk what they want you to talk. And then once they're done with it, then they're forced to listen to you because you have taken that has to go back. So Mama, how's your health? She'll say, oh, I have this leg pain. Mama, why are you not going to the doctor then? Do you want me to take to the doctor? Okay, let's go to the doctor. And when you go to the doctor, when coming back from the car, I tell Mama, I have this feeling from me, 99% mother will say. Because you have taken the one step. So if you want to be good at communication with your parents, first listen to their story. Listen to the struggles. Mama, how are you paying for this fees? Are you struggling? See, that's why, most fathers don't even tell their daughter or son they are taking loan and putting for education. And then you'll ask for a mobile. And there the fight will start. And Papa will never say that I have taken loan because Papa's ego. Right? So find their story. Find what they're going through. Talk their struggle instead of talking about your friend's struggle. Like dentistry, what I've seen right now is every person knows everyone's story. Like I talk to a person, the friend knows everything. Like, why are you sharing so much of your crap into other people? Because you're just creating more negative environment there. So how to deal with your mother and parents is very simple. Talk to them. Any communication. The secret of communication is talk what the people want first. And then talk your stuff. No one can say no. Okay? Good. Next. Yes, ma'am.
My mother is she's kind of nice. I can share anything, any stuff with her. But my father is a little bit complicated with the stuff. He's kind of cool and I can share with him and still I am afraid because sometimes it takes kind of fight.
You want? Can we talk this personally? Yeah, we can talk after this, because not family into the inside stuff. It's not right for me to talk about, because I see all fathers as mothers as my father and mother. So publicly I'm talking something bad about a father, it doesn't look nice, right? So everyone I talk to I see as my brother and sister. So that's how I'm naturally talking with you from that perspective, right? So let's talk later, because it's very, very personal, and when mother-father fight comes, then I will leave it personally only, right? So not a problem, we'll talk later for sure. More questions? Ask anything. Don't miss this. Yes, ma'am.
Which one should we choose, being single or being in a relationship?
Being?
Being in a relation or being in single?
Being in this, okay, good question. Okay, so again back to love again. This is the most interesting. I told you, once I touch the topic, then everything will revolve around this. Next, the marriage topic have to come. Till now, no one has touched that. Because after 22, 23, girls' biggest tension is marriage. After 25, 28, boys' biggest tension is marriage. And none of you have a clue about it. Right? Love marriage or arranged, nothing. No one asked, then I won't talk, right? Okay. Is it better to be single or be in a serious relationship or time pass relationship? Serious relationship, okay. How do you define serious relationship? Let me talk that. Because you should understand what a serious relationship is. If it is gap filling, it is not serious relationship. Right? Serious relationship, what I mean is 99%, no, 100% you're getting married to that guy. If I ask you if you're having a relationship, even you can ask your boyfriend or girlfriend, are we going to marry? बाद में सोचेंगे, that's not serious relationship. Later parents will decide what is going to happen. Girls have this excuse, no? Later, parents will say, that is not a serious relationship. A serious relationship is, I'm going to live with you and die with you. So get that clarity. I'm going to marry you and that's it. And the joke of life is, at the age of 22, no one can give the guarantee. So generally, every relationship which you're going through is generally not serious. Now, how to be single or have a time pass relationship? Because that's what you're doing. Right? So see, this is what everyone thinks, I'm in a serious relationship. But every relationship I talk to broke up only. Like the first simple question I will ask, many people, girls say, I'm very serious, caste is same, they say no. Parents will allow? No. You're going to leave your parents? No. Break up. Right? No, I will fight with my parents and get him back. And I know many girls who just go in the name of love, fight their parents. After marriage, you come to know the guy have no finance, can't even take care of you. And I've got girls cried after me, sir, I made a big mistake, how can I go back to my parents? Right? So that's the thing I tell them, and they went back also. But the point is it a serious relationship? If not, get out of it. Now, is it a time pass relationship? You are time passing. So the husband or wife who you get will be also time pass today. Now, boys have this thing, no? I will do time pass with all the girls. Girls should be very pure girls. Hey, God doesn't work that way. If you time pass while he's coming. See it from that point of view. Right? So see it from that perspective. So what you need to do, so now next question, time passed out. So okay, now coming back to single. Single is you control your life. Right? That's why I always say, be someone first, then go after someone. Because right now you are attracting a BDS guy into your life. But when you do NDS, the BDS is still BDS, later the conflict will start coming. Hey, yaar, tum padho yaar. I am NDS, Papa won't allow if you are BDS. मुझे पढ़ना नहीं है, I just love you, that is more important for me. Serious relationship, no. The conflict will start. MDS, BDS, fight will start, breakup will happen. Be someone first and then attract the person who you become. Generally, the guy will be right. Right? As the joke I say, most of the Hindus over here. When you become Sita, Ram will come. But first become Sita, not waiting, doing all Ravan stuff and I want Ram back. So see it from that perspective. Right? It's always best to say single. But I know the trend is there. Right? Like I seriously know one girl who I talked to, the guy comes in front of her, takes the blade and says, I will cut my hand if you don't say yes. She was worried, her parents were worried, I talked with them and make that. So boys are going to come, Ravan is going to come. It depends on you, you fall for it or not. Right? So see from that perspective, is he the right guy? And then work it out from there. Doubt clear? Serious relationship, is it really serious? Are you mostly time pass? I'm guaranteeing it's time pass only. On an average, I never saw anyone, there are few people who get it. But now you'll ask me, sir, so love marriage is all scam or what? No. Love is way beyond astrology, way beyond religion, way beyond status, everything above. But what happens is after marriage, you'll bring this husband and wife. That time the love drops. And when the love drops, astrology, caste, religion, mother will come. Yeah, मैंने बताया था यहाँ caste का problem है ये. And some husband and wife, you know why they fight love marriage? तुम्हारा caste ऐसा ही है. Boom! There the fight will come. Divorce, you caste and bam, it's gone. Right? More questions? Ask so that I can give you the answer in the best possible way. Right? If you don't ask again, you make my life easy. The next doctor is ready. If the next doctor, I can continue as long as these people stop. Right? So utilize me in the best possible way. See, you all have questions. You all have doubts. I know that. So that you don't come back with any more doubts in life. Right? Future, career, whatever it is, anything from birth to death you can ask me, or any doubts which people have put into your head, any concepts which people are putting into your head, anything can be asked. No? Yes, ma'am. How to stop overthinking? This is a very standard question I get from most of the people, and I keep saying overthinking main reason is free time. Serious, no? You look at it, you overthink. See, mind is a thinker. Many people would have told you control your mind, I'll help you control your mind, mind is to control, remove all the desires, you will control your mind is a thinker. Like the eyes that can see, like the ears which can listen, like that the mind is going to think. It is a thinker. So let it think, but give it good things to think. You are never exhausted overthinking good things. Have you noticed? Think, if I tell you, when you go to a beach, you've gone to a beach? Yes? There's a beach around this? No, no? Okay. Everyone has gone to the beach? Oh, waterfall? Okay, waterfall. Let's take a waterfall. So if you go to the waterfall, and you go and stay underneath the waterfall, no overthinking. Because why? The nature hits you, the water sound goes into your ears, the water touches you, the smell of the nature, the fish which is dying, that smell, everything fills your senses so much that the mind can't think. So the solution for overthinking is to go and take actions. For example, if you have overthinking problem, stand here, start running up and down, up and down, up and down. Your mind will stop thinking then and there. Or do 10 sit-ups. When you're tired, when you want to breathe, you will stop thinking then and there. So actions is one way to stop your overthinking. Second reason for overthinking is unanswered questions about your past and your future. Some call it, for future they call it anxiety, for past they call it some other word. Now the girl who's in toxic relationship will always overthink about the guy. Yaar, kya relationship hai mera? The other girl is so happy, my life is so messed up, think and think and think and think. Right? Is it something? Then later, overthinking, the problem is, at the end when you don't get answers, later you blame yourself. The main problem of overthinking is this, you end up blaming yourself. Right? And that blaming may again overthinks. So what you need to find the answers. My past is this. What is the reasons behind it? My future is this. Plan out well. What is the reason? Mind will stop thinking. Now if I ask you a simple, after BDS, what's your plan? How many of you don't have a plan after BDS? Okay, one has raised, 2, 3. So you don't have any, you're going to overthink about your future. यार BDS में बात क्या करना है, क्या करना है, क्या करना है, यार क्या करना है, research करो. Once you know what you're going to do after BDS, the thinking will stop. But आप तो plan नहीं करने वाला. And then you will think. What thinking? Nothing. You're BDS only. After BDS, pressure will come. The mother, what after BDS? What? Mama, मुझे पता नहीं क्या करना है. Then pressure, tension. Then you will say, I am anxious. I have anxiety, and all these things will come. So plan properly after BDS. What? Right? Can I get into the artist side of dentistry? How I can get into like what is there? Who is designing all this tooth? Who's drawing all these graphs? There is someone who's drawing it. Is there a profession related to it? And then you go into the profession. So overthinking is what? Free time, kuch nahi hai, yeah, socho. And the mind is so good that it is always interested in negative things. Right? Positive, you're never tired. So how do you stop it? Force your mind to think good. Like as I told yesterday also. When I say not to think of a monkey, you're going to think of a monkey. Right? So what you do? Put everywhere peacock. When monkey comes, hey, peacock. Your mind is always going to think of it. Mind can never think what you don't know. Mind can never think what you don't know. Give your mind good things to think. It will know only good things and it's going to think only good things. So overthink good things. Not a problem at all. Then law of attraction will work there also. Right? Overthinking good things, will be good things. Doubt clear about overthinking? More questions? Anyone else? This is next doctor or no one has done? They're all fed up. Do I continue? I can continue until the questions come. I can go on until anyone has stopped. More questions or no? Because or else I'm going to wind up the show. If there's no questions, I know I'm going to talk to you personally. If anyone wants to talk personally, you can talk personally. I'm going to be here around anyways. But utilize it as much as you can so you all benefit at the end. That's my only objective. If you have learned something, feel free to share it in the world in your name also. Doesn't matter. If you like something what I told, put that quote with your name and post on social media. At least through you, let that positivity spread. My ultimate objective is to make everyone who comes in contact with me to understand positivity so they themselves become an instrument to further spreading the positivity. Right? I'll wind it up. Yes? Or ask? No? No one wants to ask? Done? See, don't miss this opportunity because I still have time. Or I'm bored of you, your Rosh. How much have you heard about positivity? Anyways, I'll wind up if you have no questions, right? So first of all, thank you. I see the crowd all back again. I made you sit for 2 hours. Thanks a lot for that. Yeah, most of my sessions I told, even when Anmol and sir gave me 1 hour, I said it is going to go 2 hours of fine ways to find it out. Because mine is question answers, right? So, and I believe that if your doubts are clear, you don't need any other motivation. So my main concept is kill this motivational, temporary motivation, get you that permanent motivation so you can positivize yourself and figure out life, right? And thank you for everyone team. They gave me, yesterday and today for giving this opportunity to talk in such great crowd. I heard you all had fun from the serious technical stuff, right? Because at the end of the day, to know technical stuff also, you should have a peaceful mind and a peaceful relationship. Because I'll tell you, when you're seeing these sessions, if you're having a toxic relationship and you're sitting way back, 99% you're thinking about that toxic relationship and not there. So if I can clear that toxic relationship there, then your focus is much more stronger and then you can grasp more, and that's my only objective, right? Thank you and the whole team and CynoDent and CynoDent.
Thank you so much, sir, for such an interactive session. I hope everyone had a good time. Now, up next, I would like to call on stage Dr. Binti Mishra ma'am. She is an Associate Professor, Department of Pedodontics from Sri Aurobindo College of Dentistry, Indore. Ma'am, please come on stage.
Very good afternoon to all of you. So, as usual, it's taking a bit of time to load the presentation. So, I think so all of you have got enough motivation now. So I can bore you with my lecture a bit. Although it would enlighten you a bit more on how to handle certain, it's actually a clinically oriented topic. So perhaps you all are now more awakened and will not sleep throughout my lecture. I have this floaty kind of voice, can't help it. So, okay, the topic that I am going to deal today with is one of the most interesting topics, since I am a pediatric dentist and I love talking about scenarios that occur in children. And we all know how naughty children can be at times. So you know they tend to वो सारा सामान घर का इधर उधर तोड़ते हैं, वो अपने दांत को भी तोड़ लेते हैं कई बार और उनको निकाल भी लेते हैं. Let the presentation load. What I was talking about, when I had completed my graduation in BDS, and suddenly I joined clinics. So there was a scenario in front of me where a mother comes to me and she is very anxious. So I asked her the reason why she is so anxious, and she tells me that her kid was playing, and while he was playing and running, he he collided with a lamppost on the road, and his teeth fell off. At that time, I didn't know how to exactly deal with this, so I had my seniors who guided me how to deal, and things were not very clear. So the reason for choosing the topic of today was just this, to give you an outlook कि अगर आपके पास एक ऐसा clinical scenario आ जाता है जहाँ पे एक बच्चा आता है आपके पास, obviously अपने parents के साथ ही आएगा जो कि बहुत anxious रहेंगे, and the reason for the anxiety would be that the teeth has come out or the tooth has come out. तो दो चीज़ें होती हैं. When there is a child जिसका दांत निकल गया है जब वो खेल रहा हो, या उसको चोट लग गई हो, या कोई RTA हो, जो एक्सीडेंट्स होते हैं, दो सिनेरियोज होते हैं. कई बार पेरेंट्स वो लेके आते हैं जो टूथ रहता है, कई बार नहीं भी लेके आते हैं. तो इट इज़ ऑल्सो देयर इज़ अ लैक ऑफ अवेयरनेस. कई बार पेरेंट्स को पता नहीं होता है. तो हम नॉर्मली क्या करते हैं कि इन आवर क्लिनिकल सेटअप व्हाट वी डू, वी ट्राई एंड रिप्लेस द टूथ बैक. So throughout the presentation, what I would be focusing is on the clinical aspects of how you should replace back the tooth. What are the considerations you can do to make the tooth back into the cavity? So finally, As I have finished my introduction, the presentation has loaded. So this is a very good thing. So we'll talk about the therapeutic protocol for the avulsed permanent teeth in the child and the adolescent patient. So I welcome you all again. Now what is avulsion exactly that we are going to talk about? It is the total displacement of the tooth out of the socket. So this is known as the avulsion, when the tooth is totally come out from the socket. Now whenever you have a tooth that is out of the socket, usually you will be presented with, as I told you earlier, anxious patients and a fearful child. ठीक है? उसके अलावा आपके पास दो और चीज़ें होंगी, एक्स्ट्रा ओरल राइट टाइम और ट्रांसपोर्ट मीडियम. कई बार क्या होता है कि द टूथ हैज़ avulsed in the night and the patient is being brought in the morning. कई बार पेशेंट्स बहुत दूर रहते हैं कोई डेंटल सेटअप से या कोई डेंटल क्लिनिक से, तो वो नियर बाय जगहों पे ट्रीटमेंट ले लेते हैं और कई बार वो तुरंत रिपोर्ट करते हैं पेरेंट्स. हम इस बारे में बात करेंगे जब पेशेंट के पेरेंट्स ने दे हैव बॉट द टूथ टू द क्लिनिक एंड दे वांट करेक्शन of whatever has happened. So whenever you try to reimplant or when you have decided कि आपको टूथ को वापस लगाना है सॉकेट में, तो there are two important determinants जो आपको ध्यान में रखना चाहिए. सबसे पहले है एक्स्ट्रा ओरल ड्राई टाइम, कितना देर वो मुंह के बाहर रहा है, और ट्रांसपोर्ट मीडियम, वो आपके पास दांत कैसे आया है, कौन से मीडियम में आया है. ठीक है, कई बार आपके पास ऐसा सिचुएशंस आएगा कि वो न्यूज़पेपर के रैप में टूथ को न्यूज़पेपर में रैप करके लाते हैं पेरेंट्स. कई बार वो पानी में लेके आ जाएंगे, मोस्ट ऑफ द टाइम्स वो पानी में लेके आते हैं या फिर एक पीस ऑफ पेपर में रैप करके आ जाएंगे. सो द टूथ हैज़ रिमेन ड्राई फॉर अ लॉन्ग टाइम. ओके, सो दीज टू आर वेरी इंपॉर्टेंट थिंग्स कि जब भी हम कोई भी ट्रीटमेंट करते हैं avulsed टूथ के साथ में, तो ये हमारा बहुत ज़रूरी होता है एक्स्ट्रा ओरल ड्राई टाइम. बाय एक्स्ट्रा ओरल ड्राई टाइम वी हैव दिस टाइम ऑफ लेस देन 60 मिनट्स या मोर देन 60 मिनट्स. ठीक है, सो हमारा गोल क्या है, ऑब्जेक्टिव क्या है. हमारा गोल ये होना चाहिए कि वी हैव टू इंश्योर द रीअटैचमेंट टू द पेरियोडोंटल लिगामेंट. अगर हमें हेल्थी टूथ चाहिए बच्चे में, तो जो पेरियोडोंटल लिगामेंट उसका डिटैच हो गया है वो रीअटैच होना चाहिए. एंड देयर शुड बी सर्वाइवल ऑफ द फाइब्रोब्लास्ट ऑफ द पीडियल. सो दीज टू आर द मेन इंपॉर्टेंट गोल्स टू इंश्योर दैट द टूथ रिमेन्स हेल्दी इन द माउथ. ठीक है, मोस्ट ऑफ द टाइम्स दीज टू थिंग्स आर नॉट पॉसिबल, बट हमारा गोल एंड ऑब्जेक्टिव ऑफ रिप्लेसिंग द रीइम्प्लांटेड ऑफ avulsed tooth is this. For this it is very important that we should have a suitable storage medium. So slowly we will proceed to that. So at firstly, if the patient is aware and the patient has reported to you at an appropriate time, that is before 60 minutes has elapsed. So if the patient has undergone any trauma, the first things you do is to keep the patient calm. You ensure that there is avulsion of the tooth. ऐसा नहीं हो कि tooth टूट गया हो, उसका एक पार्ट सॉकेट में ही रह गया हो, तो आपको इंश्योर करना है कि पूरा का पूरा दांत बाहर आया है. ठीक है, यू पिक द टूथ बाय द क्राउन, यू आर नॉट सपोज टू टच द रूट. वाई वी डोंट टच द रूट? बिकॉज द पीडियल सेल्स आर ओवर देयर, वहाँ पे हमें उसको डिस्टर्ब नहीं करना है. इफ दिस इज बिफोर 60 मिनट्स हैज elapsed for the avulsed tooth, you wash it briefly. That is brief washing for 10 seconds and the medium should be cold running water. यहाँ पे बहुत इंपॉर्टेंट है कि आप टैप वाटर ना यूज़ करें, क्योंकि टैप वाटर में बहुत ज़्यादा सॉल्ट रहता है, तो वो फिर हमारे पीडियल को डैमेज कर सकते हैं. सो यू हैव टू अगेन वाइप ऑफ द होल रूट with preferably with a handkerchief. Okay, and you just place the tooth back into the socket with very light pressure. बहुत ज़्यादा प्रेशर डालने का ज़रूरत नहीं है. ठीक है, and then the patient is advised to meet the dentist for appropriate treatment.
Now these instructions are basically on an awareness level, जहाँ पे आप community में बताते हो कि क्या करना चाहिए अगर बच्चे की दांत निकल गई तो। कई बार पेरेंट्स को पता नहीं होता है और फिर वो सोचते हैं कि ये यूजलेस है या उसको कैसे रिप्लेस करेंगे ये उनको आइडिया नहीं होते। तो ये जो है ये अवेयरनेस लेवल पे करना है। अगर बच्चे की दांत निकल गई खेलते वक्त या फिर कोई ट्रॉमा की वजह से तो आपको बस उसको ठंडे पानी में धोना है, ठीक है, और उसको स्लाइड प्रेशर से वापस डाल के फिर आपको एक डेंटल सेटअप में जाना है। नाउ व्हाट इज इम्पोर्टेंट इज जब आप ये सीखते हो कि हमें क्या करना चाहिए, मोर इम्पोर्टेंट इज दैट यू शुड लर्न व्हाट नॉट टू डू। So when you should not replant a tooth, there are three most important place when you should not try to reimplant the tooth. First is if there is a periodontal disease, there is severe caries with the tooth that has got avulsed, and it is an uncooperative patient. Uncooperative patient may you have special care children, most commonly the mentally retarded ones. Why we say this? Because the uncooperative patient might swallow the tooth if you just keep it like that in the mouth. So it is very important that you should see. For cardiac conditions also we avoid so that we don't transmit any more infections in the body. Okay. So now the situation is you have an avulsed tooth in your clinic. The patient has got it. How do you assess it? So first you have to see whether it is an open apex or a closed apex. अभी हम बच्चों के साथ में generally आपका जो सेंट्रल इंसाइजर्स होता है वो 9 years के on an average 9 years you'll be having a complete apex formation. Sometimes it goes beyond that also. So you have to assess कि कितना उसका root maturity है, वो open apex है या वो closed है, ठीक है। अब इसमें दो चीज़ें हैं। After you assess the opening the maturity of the root apex, you see the condition of the PDL cell. Now the PDL cell का जो condition है, उनकी जो viability है, वो live है या नहीं है. So it depends on the storage medium and the extraoral dry time. Okay. So now coming to the reimplantation protocol, there are 3 categories. So first is the PDL cells are most likely to be viable. They may be viable but compromised. And if the extraoral dry time is more than 60 minutes, they might not be viable. So now what happens if the patient has come when the extraoral dry time is less than 60 minutes? So if the tooth has been kept in a physiologic storage medium यानी कि the medium is osmolarity has been balanced and the extraoral dry time is less than 60 minutes. So the PDL cells are supposed to be viable. If it is more than 60 minutes, the PDL cells are supposed to have been dried and non-viable. Okay. So what do you do when you have a closed apex and what do you do when you have an open apex? Now there are 3 possibilities. The tooth has been reimplanted before the patient's arrival at the clinic. So if you have a closed apex, as you can see in the X-ray, that if the tooth has been replaced back in the socket and you have a closed apex, आप क्या करते हो? You leave the tooth in the socket when the tooth has been reimplanted at the site of the trauma. So what you do, you leave the tooth in the place, you clean the area with water space, saline or chlorhexidine, you suture the gingival lacerations if present, and verify the normal position of the reimplanted tooth both clinically and radiographically. Okay. So after that, to retain the tooth in the mouth, what we do? We put a flexible splint. For that, what you do? After putting a flexible splint, you give systemic antibiotics. You check for the tetanus protection. Give the patient post-operative instructions. And if required and indicated, you initiate the root canal treatment 7 to 10 days after reimplantation. Okay. The root canal treatment also should be done after the splint has been removed. So now there is a condition that there may be the presence of viable cells in the closed apex case. In that, what you do? You clean the root surface
and the apical foramen with a stream of water and soak the tooth in saline. This saline is written because it is most commonly present. Ideally, this is not the medium. So the medium should not be the pH should be as normal. So in saline generally, since salt is present, you have reverse osmosis. So this root surface should be decontaminated and dead cells should be removed from the root surface. Administration of local anesthesia. Irrigate the socket with saline. The alveolar socket should be examined for any dirt, fragment, etc. And if there is fracture of the alveolar wall, it should be repositioned with a suitable instrument. Reimplant the tooth slowly with slight digital pressure. Do not use force. If there is any gingival laceration, it should be sutured. And you have to verify the normal position of the tooth. Sometimes it would so happen that the tooth wouldn't be in the normal position. It would be 1 to 2 mm below the normal position of the adjacent teeth. So you apply a flexible splint for about 2 weeks. The splint should be away from the gingiva. So again we give systemic antibiotics, tetanus protection, patient instructions, and again initiate a root canal if required and indicated radiographically and clinically 7 to 10 days after reimplantation. So now the last scenario, first is you have viable cells, second you have maybe viable cells, and last is not viable cells. So if you don't have any viable cell, what you do? You just have to clean the root surface, for example with a gauze, okay? There are many discussions on which is the best way to clean this root surface, and root canal treatment preferably, or again this is a matter of discussion whether it should be carried out after reimplantation or not. And in cases of delayed reimplantation, root canal treatment should be either carried out on the tooth prior to reimplantation or it should be carried out 7 to 10 days later. There are many authors who say that we should do the root canal along with the reimplantation before, and some say we should do it afterwards. So again, we administer local anesthesia, irrigate the socket with saline. There is examination of the alveolar socket. If fracture is present, repositioning is done and reimplantation of the tooth. Followed by systemic antibiotic administration and tetanus protection. Okay. Now there is intermediate treatment that we do with the root surface for the closed apex is that we would prefer to treat it with 2% of sodium fluoride solution for about 20 minutes. Now this is thought to slow down the osseous replacement of the tooth, a fluoride treatment. Also sometimes we give an antibiotic treatment which we will be discussing in the later slides. So the next is whether if you have an open apex. If you have an open apex, again you have 3 possibilities. The extraoral dry time is less than 60 minutes or more than 60 minutes. So in between. The tooth has been reimplanted before the patient's arrival at the clinic, so obviously the cells would be viable at that time. The tooth is kept in a physiologic storage medium and it has been bought prior to 60 minutes, the cells would be viable. The dry time longer than 60 minutes. So the viable cells, if are present in an open apex, our main aim would be revascularization of the tooth. So what you do, you clean the area with water spray, saline or chlorhexidine, suture the gingival lacerations, verify normal position of the reimplanted tooth both clinically and radiographically. So you apply a flexible splint, administer systemic antibiotics, check for tetanus protection and patient instructions. So as I told earlier, the goal for reimplanting an open apex tooth, immature tooth, is to ensure revascularization of the pulpal space. So if that doesn't occur, root canal treatment would be recommended. Now maybe viable cells, if they are contaminated, clean the root surface and apical foramen with a stream of saline. Again, topical application of antibiotics has been advised to enhance chances for revascularization of the pulp. Administration of local anesthesia. Examine the alveolar socket. If there is fracture, reposition it with a suitable instrument. So, the coagulant that has been formed in the socket, it should be removed. Reimplantation of the tooth slowly with slight digital pressure. A flexible splint. All suturing of all the gingival lacerations and administration of systemic antibiotics. So you have to ensure that the tooth is in a normal position, both radiographically and clinically. So again, you have to see for the tetanus protection, and to reduce the chances of any infection and root resorption. So you have to see against the chances of revascularization. So if you see that there is any chance that there might be any infection, so the revascularization has to be weighed against that. If there are chances of infection or any such thing, then you have to undergo with root canal therapy. So if the cells are not viable, it is an open apex, what you do? You have to do a root canal treatment to ensure it is disinfected, administer local anesthesia, clean the coagulum of the socket with a stream of saline, examine the alveolar socket, and if there is a fracture in the alveolar socket, you have to reposition it. So replant the tooth slowly, the digital pressure has to be very slight, gingival lacerations have to be sutured, and the normal position of the reimplanted tooth has to be verified clinically and radiographically. So you stabilize it with a flexible splint, antibiotics and tetanus protection to be checked. And fluoride treatment is always recommended. We go with 2% sodium fluoride solution. So, now the follow-up that has to be done for short-term flexible splints. Splints has to be done for 2 weeks. Again, you have to check whether the tooth is mobile or not. Continue it for 4 weeks, 3 months and 6 months. 6 months in the case of non-viable cells you have, that is the extraoral dry time might be more than 60 minutes and the tooth is not stabilizing in the socket. So in that cases you can go, but there are many people who don't permit the use of the splints beyond 4 weeks. So when to do RCT in these reimplanted tooth, as I told you, when the extraoral dry time has exceeded 60 minutes, we preferably go with RCT to remove any infection that is there in the root canal. Or else, if the cells might be viable or the tooth has been bought before 60 minutes in our clinic and the storage medium is physiologic, we go for RCT 7 to 10 days after splinting has been done and reimplantation has been done and after the splint has been removed. So, do we need systemic antibiotics? Yes, it is required. Tetracycline is the first choice, although we go for amoxicillin mostly. And also, we go for antibiotic treatment of the surface of the tooth roof. At 1 milligram per 20 ml of saline for 5 minutes, we soak the root. Now, patient instructions are: you have a soft diet, no contact sports, and the soft brushing with a soft brush, and chlorhexidine mouthwash. Now, since we are talking a lot about splints, we never use rigid splints in these cases. We always go for a flexible splint. What is a flexible splint? Flexible splint, basically a splint is a rigid or a flexible device which is used to support, protect and immobilize teeth that have been weakened. In this, the flexible splint is the one that allows for functional movement of the tooth. So examples of the flexible splint are 016 nitrile, 016 stainless steel wire, and also lately we are using the titanium trauma splints, the TTS, and it is basically a mesh splint. So the following are the benefits. It is quicker, cleaner, more adaptable. It has better aesthetics and it is more effective and it is comfortable to use. Basically, it allows the functional movements, the physiologic functional movements. So this is a case report which I had performed very early, and it is now now the tooth is there after 8 years. So the patient has reported the tooth was bought in a newspaper, and this is the picture of the child. We did extraoral RCT with that tooth, and there was fluoride treatment that was done. For 20 minutes, we soaked it in 2% of sodium fluoride, and we put it back into the socket after removal of the coagulum. The patient had reported 24 hours after the tooth had been avulsed, and this reimplantation was done. Splinting was done with the SS wire, and as you can see that the tooth is almost 2 mm below the adjacent tooth. So this tooth is still running fine. She was a 7-year-old patient when she had come to us. Now 7 years hence, she is 14 to 15 years of age, but still the tooth is almost resolved and it is continuing in the socket. So this is her post-op pictures. After 1 to 2 years, now I have been contacting her on phone and asking her for regular follow-ups, but she doesn't turn up for the X-ray. But I have her pictures. Okay. So with this, I end my presentation. Thank you all for a patient hearing. Thank you so much.
Thank you so much, ma'am.
सब लंच पे निकल गए
डेंटल इम्प्लांट। तो हम लोग क्या पढ़ने वाले थे? डेंटल इम्प्लांट। तो इम्प्लांट के अंदर बहुत सारी चीज़ें रहेंगी। टाइप्स ऑफ इम्प्लांट कौन कौन से हैं, उसके बाद इम्प्लांट्स के पार्ट्स क्या क्या है, फिर इम्प्लांट्स के बाद अलावा इम्प्लांट कहाँ प्लेसमेंट करना है, ये सब बात की बात होगी। लेकिन बट जब भी आपका पेशेंट आएगा तो हमको चेक क्या करना पेशेंट्स के अंदर, किस उसके अंदर इम्प्लांट प्लेस कर सके, क्योंकि इम्प्लांट इज़ अ सर्जिकल प्रोसीजर। तो ओनली उसका पेशेंट का पूरा सिस्टमिक कंडीशन भी चेक करना पड़ेगा कि व्हाट आर सिस्टमिक पैरामीटर्स ऑफ द पेशेंट, देन ओनली यू कैन प्रोसीड फॉर द इम्प्लांट और सर्जरी। ठीक। Now what is dental implant? Dental implant is an artificial titanium fixture which is placed surgically into the jawbone to substitute for a missing tooth and its root. अभी तुम सब लोग थर्ड ईयर में हो, सेकेंड ईयर का चैप्टर था आप लोगों को डेंटल इम्प्लांट मटेरियल, अभी याद आया कुछ? कौन से कॉलेज से आप लोग? बढ़िया सर, बढ़िया सर, भैया सर मेरे कॉलेज से। ठीक। और कौन है? आप जूनियर कपाड़िया भी है, कम्युनिटी पीएचडी है ऑन पेपर, अब जाके पता करके आना पड़ेगा। ठीक है। तो जो डेफिनेशन दिया है डेंटल इम्प्लांट का, तो क्या एक आर्टिफिशियल सब्सटेंस है जो हम लोग कहाँ इंट्रोड्यूस कर रहे हैं? जो बोन के अंदर, मतलब बोन के अंदर, या फिर हो सकता है मैंडिबुलर हो या फिर मैक्सिलरी हो। वो किसको रेप्लिकेट कर रहा है? टूथ सरफेस को या फिर रूट सरफेस। ठीक है। तुम लोगों का वॉइस पोस्टिंग वगैरह हुआ होगा या लेक्चर हुआ होगा, उसमें क्या देखा हम लोगों ने? टूथ का पार्ट क्या था? वन इज क्राउन सेक्शन, वन इज root. So the implant is a replica of a root. Okay. And the prosthetic part which comes over the implant body is termed as the prosthesis or the crown of the implant. ठीक, ये point here. Then next. ये सब बोलने का लिखने का बहुत कुछ है इसमें कि डेंटल इम्प्लांट है फास्ट डेवलपिंग ये सिंपल शॉर्ट में चलते हैं कि अभी तुम्हारे क्लिनिक में या फिर ओडी में पोस्टेड होगा आपका किसी का OMDR में, OPD किया होगा, पेशेंट को दांत नहीं है, कुछ नहीं है, तो अलग अलग ट्रीटमेंट ऑप्शंस होते हैं। फॉर एग्जांपल देयर इज मिसिंग टीथ, मे बी 3, 6, 4, 6, 5 हो सकता है ना, 3, 6 मिसिंग है, 3, 7 मिसिंग है या फिर 3, 5 मिसिंग है, तो पोस्टरली कुछ भी सपोर्ट नहीं है। तो उस केस के अंदर हम लोग क्या कर सकते हैं? इम्प्लांट तक बात नहीं जाएगा, एफपीडी पॉसिबल नहीं है, पोस्टर कुछ भी सपोर्ट नहीं। फर्स्ट ऑप्शन है आरपीडी। आरपीडी मतलब रिमूवल पार्शियल डेंचर। आरपीडी होता है 3 टाइप, बुक के अकॉर्डिंग ओनली 1 टाइप, और जो आप लोग करते हो 2 टाइप का होता है। जो तुम यूज़ करते हो क्या करते हो? एक्रेलिक का बनाते हैं ना, एक्रेलिक का। बट आइडियल आरपीडी और आइडियल रिमूवल पार्शियल डेंचर इज कास्ट पार्शियल डेंचर। आइडियल आरपीडी इज कास्ट पार्शियल डेंचर। ठीक है, सुना ये? एक चैप्टर है प्रिंसिपल्स ऑफ आरपीडी डिजाइनिंग, मेजर कनेक्टर, माइनर कनेक्टर, गाइडिंग प्लेन के अलावा पाथ ऑफ इंसर्शन, एक्स क्लास आरपीडी सिस्टम, ये सब पार्ट, दिस आर ऑल द पार्ट्स ऑफ आरपीडी। What you are doing third year, it is not actual RPD. The scarce partial denture which we are doing is actual RPD, because all the forces acting on the major connector or minor connector are distributed evenly on the bone. Okay? कहीं होगा ना लाइन देखा होगा, fulcrum line is passing from this tooth to this tooth. सुना है कहीं? हाँ सर, सुना है। Lever 1, Lever 2, Lever 3 फंक्शन, ये पूरा खेल अपना आरपीडी का, और यही प्रिंसिपल एक्ट करेगा हमारे इम्प्लांट के ऊपर। ठीक।
बंद कर दे इसको।
Now there are 4 scientific breakthroughs in implants. The first one is the introduction of biomaterials such as titanium, vanadium and aluminum oxide. Then second one is the application of CT, computer tomography, and then or CBCT. Third one is concept of osseointegration, and the fourth one is biological or transmutual seal of the gingival tissue around the implant surface. हम ये 1 by 1 सीखेंगे तो एक आइडिया हो जाए आपको रफली कि इम्प्लांट में क्या क्या हो सकता है। तो फर्स्ट पॉइंट क्या है, द बेसिक बायोमटेरियल्स इंट्रोडक्शन। स्टार्टिंग में क्या था, वन वॉज टाइटेनियम, देन वॉज वैनेडियम और फिर एल्यूमिनियम। बट रिसेंटली व्हाट वी आर यूजिंग इज टाइटेनियम वैनेडियम alloys. Why we are using titanium vanadium alloy? Because the density of titanium vanadium alloy is approximately same as the jaw bone. ठीक है, इसलिए that's why the success of titanium vanadium alloy is 99% in compared to other materials. And what is this aluminum oxide? Aluminum oxide पढ़ा सेकेंड ईयर के अंदर कुछ तो होगा, पॉलिशिंग एंड abrasive and polishing agents, sandblasting, in that we use aluminum oxide. कुछ तो एयर प्रेशर जाता है, उसमें से क्या निकलता है, सैंड ब्लास्टिंग होता है, कास्टिंग प्रोसीजर। लॉन्ग क्वेश्चन आप लोगों का, स्टेप्स इन कास्टिंग प्रोसीजर अभी आया। अभी सोचो अगर हम एल्यूमिनियम ऑक्साइड से बॉम्बार्डिंग करेंगे इम्प्लांट के ऊपर तो क्या होगा, डिस्टॉर्ट नहीं होगा। Aluminum oxide is a abrasive agent, first point. Second, when we apply abrasive particle to any body या फिर anything, what will happen? It will abrade that part. Surface rough हो गया ना? When the surface of an implant or anything is made rough, voids बन जाएंगे microscopically. अब जब voids बन गया तो क्या होगा, रिटेंशन। कैसे बढ़ेगा मुझे वो समझाना है आपको। व्हाट इज सरफेस एरिया, अपन पूरा बेसिक ही पढ़ेंगे, थर्ड ईयर हो ना, मैं तो वो बोलेगा सर हमको तो पता ही नहीं था। व्हाट इज सरफेस एरिया, तो एरिया होगा ना, नहीं बोल दे तो वही समझ जाएगा। ठीक है, जो कुछ भी अभी मुझे यहाँ से लेके उस कॉर्नर तक जाना है गेट के, मैं सीधा जाऊंगा, कितना टाइम लगेगा, हो सकता है मैक्सिमम 30 सेकेंड्स, 30 सेकेंड्स लगेगा ना, ज़्यादा होगा। एग्जाम्पल मैं भाग के मैं रैंक के जाऊंगा, 30 सेकेंड में पहुँचूंगा तो आराम से। हाँ, वो जल्दी नहीं है। अभी वही चीज़ मैं यहाँ से बीच में जाऊंगा, वहाँ तक पहुँचूंगा तो टाइम लग रहा है। अब टाइम को हटा दो साइड में, ये डिस्टेंस तो एक ही था ना, मतलब लास्ट पॉइंट, स्टार्टिंग पॉइंट एंड लास्ट पॉइंट तो कांस्टेंट है, बट द वे ऑफ अप्रोचिंग दैट पॉइंट इज डिफरेंट। डायरेक्ट गए मतलब इम्प्लांट पूरा स्मूथ है, सेकेंड हमने बम्बार्ड किससे कर दिया, एल्यूमिनियम ऑक्साइड से, मतलब सरफेस को क्या कर दिया, रफ कर दिया। यहाँ से मैं वहाँ जा रहा हूँ, कैसे जा रहा हूँ, रेंगते हुए नहीं है, घूमते हुए। अभी खाना खाया क्या, चाय पिया क्या, हवा खा ले बस। अभी ऐसा गए हम लोग तो मतलब यहाँ से वहाँ जाना है, बट मैंने एरिया ज़्यादा कवर किया है, मतलब डिस्टेंस ज़्यादा कवर किया है। तो जब हम लोगों ने एल्यूमिनियम ऑक्साइड को बॉम्बार्ड कर दिया है तो हम लोगों ने क्या क्रिएट कर दिया, माइक्रोस्कोपिकली वॉइड्स क्रिएट किया है, मतलब रफ हो गया, मतलब वॉइड्स क्रिएट कर दिया। तो अभी जब बोन जो रहेगा, इम्प्लांट कहाँ प्लेस करना है, बोन के अंदर। ठीक है, जितना ज़्यादा एरिया उतना ज़्यादा एंकरेज ज़्यादा ना। कनाइन का रूट लेंथ कितना है, 17, 16 to 18 mm। ठीक है, अगर वो कनाइन निकालने ज़्यादा टाइम लगता है कि लेटर इंसाइजन निकालने में, क्यों, तो कितना लेंथ ज़्यादा है। लेंथ ज़्यादा है मतलब बोनी कवरेज ज़्यादा है। तो सेम इम्प्लांट का वैसा ही है, इम्प्लांट हम लोगों ने प्लेस कर दिया, आसपास बोन कवरेज ज़्यादा हो गया है, और सेकंड चीज़ हो गया हमारा जो वॉइड्स के कारण मैकेनिकल रिटेंशन बढ़ गया है। ठीक, यहाँ तक क्लियर हुआ? अभी नेक्स्ट पॉइंट जाएंगे, व्हाट इज सरफेस एनर्जी। हाँ बोल, सही बोल रहा, वेरी गुड। उसके आगे बोला अभी, तब मुझे तब तो यही बोल देगा। सरफेस एनर्जी अब बोलते एनर्जी एट सरफेस। अभी जैसे बोन है और इम्प्लांट है, वहाँ से मुझे कुछ फोर्स लग रहा है उसको वहाँ से हटाने के लिए, तो द ऑप्टिमल फोर्स रिक्वायर्ड टू डिसलोकेट द एटम और एलिमेंट फ्रॉम द सरफेस ऑफ अ मटेरियल इज टर्म्ड एज द सरफेस एनर्जी। ठीक, अभी इम्प्लांट के फोर्स लगेगा, अभी 6 स्लिपरी सरफेस है पूरा और एक पूरा रफ है, तो ज़्यादा फोर्स कहाँ लगने वाला है? रफ पर ना, इंटरलॉकिंग ज़्यादा है ना, तो सरफेस एनर्जी क्या हो गया? वहाँ ज़्यादा है। ठीक है, तो हमारा इम्प्लांट ज़्यादा सक्सेसफुल रहेगा कंपेयर टू स्मूथ वाले। ये पॉइंट सबको क्लियर? चलो आधे इम्प्लांट बन गए आप लोग। अभी चलते सेकंड पॉइंट पर, एप्लीकेशन ऑफ CT स्कैन और CBCT। इससे क्या चेंज हो गया जो बोन्स के ऊपर या फिर इम्प्लांट के अंदर? IOP देखा, आज भी देखा कभी किसी ने? वो क्या है, 2D है ना, और CBCT सब कुछ देख सकते हैं। अभी जो IOP वगैरह रहेगा या फिर RBG लेंगे हम लोग, उसके अंदर हम लोग लेंथ मेजर कर सकते हैं, वेरी गुड। IOP में कर सकते हैं, स्केल से कर सकते हो। अगर मैं थोड़ा एंगल चेंज कर दिया तो नहीं, फिर भी स्केल से कर सकते हैं, लेकिन मेजरमेंट क्या आएगा? चेंज हो जाएगा। अगर पेशेंट करना चाह रहा हूँ मैंने IOP ले लिया, जो मैंने IOP लिया शूट किया उसमें मुझे 13 mm आया, ठीक है, IOP घूम गया मुझसे जाते जाते, मैंने उसको बोल दिया डॉक्टर को, सर आप एक IOP निकाल लो और लेंथ मुझे बोलो। उसने चलते चलते क्या किया, लगाते पेशेंट एकदम मुड़ गया, हिल गया। यहाँ पे क्या था अपना एक्सरे का सेंसर, ये था कोन था, हिल गया, ये टेढ़ा हो गया, एंगल चेंज हो गया, मेजरमेंट चेंज, एंगल चेंज, लेंथ बढ़ गया या शॉर्ट हो गया, इधर घुमा ऐसा घूम गया, बढ़ गया, ऐसा किया तो शॉर्ट हो गया। फिर मैं तो लेके गया इम्प्लांट 10 मिलीमीटर का, वहाँ पहुँचा कि जगह ही नहीं, 8 mm की जगह, या गलती से ऊपर से मुँह कर दिया, लेंथ शॉर्ट हो गया। मैं देखे क्या 10 mm का, वहाँ देखा जगह 16 mm की है। ठीक है, तो डिपेंड करता है एंगल पर भी। वो सब चीज़ हम लोग कहाँ चेक कर सकते हैं? CBCT में, बिकॉज इट गिव्स यू आइडियल, ये देता है 3D मॉडल। ठीक, चलो अभी नेक्स्ट क्या है? द कंसेप्ट ऑफ ऑस्टियो इंटीग्रेशन। ऑस्टियो इंटीग्रेशन मतलब फॉर्मेशन ऑफ बोन अराउंड द इम्प्लांट। ठीक है, इट वॉज गिवन बाय द ब्रेन मार्क, ये तुम लोगों का MCQ फाइनल ईयर का। द concept of osseointegration was given by the brain mark, okay, and किसके ऊपर बेस्ड था ये? It was based on the quality of the bone के टाइप होते हैं D1, D2, D3 and D4। इसमें तुमको अब एक बार MCQ बोलता, the D2 bone is the best bone for the implant prosthesis, D2 bone is the best bone for the implant prosthesis, D1 नहीं, D1 is the hardest bone, लेकिन फिर भी D2 बेस्ट है, क्योंकि D2 बोन का क्या होता है, जो आउटर पार्ट हार्ड है, सेंटर का पार्ट सॉफ्ट है। अगर हार्ड बोन रहा, एक दीवार के अंदर बहुत कॉन्क्रीट मजबूत दीवार है, वहाँ ठोको इम्प्लांट को, क्या होगा? इम्प्लांट नहीं, कील को ठोको, टेढ़ा हो जाएगा या फिर टेढ़ा जाएगा। अगर बाहर का सीमेंट जो है बहुत कड़क है, लेकिन उसका तो मिट्टी आ गई, थोड़ा ठोकोगे, टैप करोगे तो थोड़ा टाइम बाद जाएगा, लेकिन उसका स्ट्रेट ही जाएगा। यही फर्क है बोन में। D1 के अंदर वस्कुलेचर नहीं है, वाइल D2 में है, मतलब ब्लड सप्लाई अच्छा है और जो अमाउंट ऑफ बोन है वो भी अच्छा है। तो मेन ब्लड सप्लाई ज़्यादा अच्छा है, तो उससे क्या होगा? हाँ, कैसे? नाम क्या? मणिदीप बोला कि ऑस्टियोब्लास्टिक एक्टिविटी बढ़ेगा क्योंकि यहाँ ब्लड फ्लो हो रहा है। अब ये पूछूँगा ऑस्टियोब्लास्टिक एक्टिविटी बढ़ेगा कैसे? गडर के ऊपर नहीं आ रहे तो बस चलिए नहीं घूम रहे हैं। बोलो। हाँ? अपन वीडियो में जाएंगे चलो। फर्स्ट के पास सब लोग आए ना कि डायरेक्ट फर्स्ट के 100 में आए। 5 लोग आए ना अभी बताओ। वीडियो जब उसने बिल्कुल सही बोला, उसने DADH पढ़ा है, ऑस्टियोब्लास्टिक एक्टिविटी होगा। अब मुझे कोई बताएगा कि ऑस्टियोब्लास्टिक एक्टिविटी क्यों होगा वहाँ पर? जो स्लाइड को जो अपन कहीं और खेल रहे हैं, बताओ। अरे सिंपल, फिजियो तुमने कुछ पढ़ा था, हीमोग्लोबिन, ब्लड का मेन फंक्शन क्या है? हीमोग्लोबिन है द ऑक्सीजन कैरिंग कैपेसिटी, ठीक है? ऑक्सीजन कैरिंग कैपेसिटी है। ऑक्सीजन क्या करता है? ऑक्सीजन कैरिंग कैपेसिटी है, एक तो वहाँ प्रोवाइड करा ऑक्सीजन, सेकंड इट हीमोग्लोबिन हैज द आल्सो द क्या न्यूट्रिएंट्स को फॉलो करती आता है। जब बॉडी को आपको न्यूट्रिएंट्स मिल रहा है, सब कुछ मिल रहा है, तो क्या होगा? अच्छे से होगा ना बॉन फॉर्मेशन। जब भी तो ऑक्सीडास्टिक एक्टिविटी होगा। अगर वहाँ पर ब्लड ही फ्लो नहीं हो रहा तो बोन क्या हो जाएगा? नेक्रोज, और इम्प्लांट वहाँ बाहर आएगा। तो सही में लगेगा तुमने किल ठोका है उसके अंदर। क्लियर हुआ? थर्ड पॉइंट। एंड फोर्थ पॉइंट, बायोलॉजिकल और ट्रांसम्यूकोसल सील of the gingival tissue around the implant nail. इम्प्लांट हमने कहा था प्लेस कर दिया बोन के लेवल पे। अब इसके बाद क्या आने वाला ऊपर? सॉफ्ट टिश्यू। देन सेकेंड स्टेज सर्जरी का आता है। सर ने बताया था, डॉक्टर ये सर ने सेकेंड स्टेज सर्जरी लेजर से ओपन किया था, कुछ याद आया क्या? सर और हम मिलकर इम्प्लांट करते क्यों? ठीक है, तो वो जो जंक्शन है वहाँ पर उसको बोला है वाला जंक्शन ऑफ इम्प्लांट एंड द म्यूकोसा। और जो अपना इम्प्लांट है, इम्प्लांट राउंड आएगा ना पूरा, उसके आसपास जो रहेगा उसका सील म्यूकोसा के साथ में, उसको बोलेंगे ट्रांसम्यूकोसल सील। वो क्या चाहिए? प्रॉपर चाहिए। ठीक है, उसके लिए भी थर्ड ईयर पहले में पढ़ना तुम बायोलॉजिकल बिट, वो मेरे साथ में बताता। ठीक है, तो शायद 1.4 है बायोलॉजिकल बिट, 1.24 मैंने रेड बोल दिया, मतलब 1.4 से वर्ड का सिस्टम हम डिस्कशन सोचते हैं प्रॉपर वाले, वो कंफ्यूजन सोचते हैं। चले नेक्स्ट पर बैकग्राउंड कुछ चौहान टाइम वाला कुछ नहीं पढ़ सकते हैं। हाँ, ये इम्प्लांट्स पार्ट्स पता है? ऐसा मत बोला तुम अभी सब पास हो गया सेकेंड ईयर, शॉर्ट नोट है उसके ऊपर, डिफाइंड इम्प्लांट, क्लासिफाई इम्प्लांट, मटेरियल। चलो, इम्प्लांट के पार्ट्स हैं। वन इज बॉडी, जो प्लेस होता है जॉ के अंदर। देन सेकंड इज अबटमेंट, जो उसके ऊपर लगेगा। उसके बाद प्रोस्थेसिस, मतलब क्राउन, और उसके अंदर क्राउन और इम्प्लांट को जो टाइट कर रहा है, फिक्स कर रहा है, वो प्रोस्थेटिक स्क्रू। ठीक, सबसे मेन पॉइंट, इंपॉर्टेंट पॉइंट, द फर्स्ट स्टेप इन द क्लिनिकल प्रोटोकॉल is a thorough medical and dental evaluation to screen out those patients who are or can be better served by the treatment modalities. मतलब क्या है इसका मेन चीज़ क्या है? मेडिकल एंड डेंटल एवल्यूशन, मतलब सिंपल लैंग्वेज में बोला जाए तो केस हिस्ट्री। केस हिस्ट्री बहुत इंपॉर्टेंट है। ऐसा नहीं है एग्जाम में पेशेंट वहाँ बैठा है, पेशेंट को चिट देती है, वहाँ बोल रहा है, लिख रहा है अपन, ये बहुत इंपॉर्टेंट है। क्लिनिक में जब काम करोगे आप, अभी तो कुछ हुआ सर्जिकल का, आप कुछ कर रहे हो, कुछ गड़बड़ हुई तो हम लोग हैं संभालने को। एक क्लिनिक को वही काम करोगे, डर लगता है, चाहे कोई भी हो। मैं भी जब पास आउट हुआ, मैं फर्स्ट सर्जरी कर रहा था अकेले, तो कॉन्फिडेंस नहीं देता है, वो इजी नहीं है। ठीक है, तो उसके लिए सबसे बेस्ट चीज़ है, जो पेशेंट क्लिनिक पर आया है उसका सबसे पहले हिस्ट्री लो, खासकर मेडिकल हिस्ट्री। और अभी तो कोविड के बाद तो ज़रूरी है बहुत, क्योंकि मैक्सिमम पेशेंट ब्लड थिनर्स पर हैं। दांत निकाला, ब्लड सीन हुआ, ब्लड बाहर निकला, पेशेंट के ऊपर तुम अंदर, गलती में डॉक्टर की आ जाएगी। सेकेंड ऑप्शन, पेशेंट आया, नहीं भी दिया, साइन दे दो कंसेंट फॉर्म, आप लोग कंसेंट फॉर्म आ गया, बात खत्म, ठीक है। Now indications for treatment. First one is severe morphological compromise, मतलब कि डेंटिस जो पूरा है रिजॉल्व है। देन पुअर ओरल मस्कुलर कॉन्डिशन, पेशेंट को कुछ सिस्टम डिसऑर्डर है जैसे कि पार्किंसन सिंड्रोम, हाथ पाँव से मिल रहे हैं, डेंचा या आर्टरी दे दिया है, उनको ट्रेमर वगैरह है, हिला, मुंह बंद कर लिया, अंदर होता है, देखा है, देखा तो नहीं होगा, सुना तो होगा ना, निकल लिया है पेपर वगैरह, वो हो सकता है। देन लो टॉलरेंस ऑफ म्यूकोरल टिश्यू, आरबीसीडी की तो गलती है, बार बार पेशेंट आता है, अल्सर हो रहा है, अल्सर हो रहा है, उस केस में भी फिक्स कर सकते हैं। देन पैराफंक्शनल हैबिट्स लीडिंग टू रिकरेंट सॉरनेस एंड इंस्टेबिलिटी ऑफ प्रोसेसेस, पैराफंक्शनल हैबिट्स, पेशेंट को हम लोगों ने दे दिया डेंचर, बट वो हैबिट वो क्विक नहीं हो रहा है, फिर अटेंशन ज़्यादा हो रहा है, डॉक्सिज्म कर रहा है, वो हैबिट्स है, तो क्या होगा, जो फोर्स है, फोर्स ज़्यादा आ रहा है कहाँ पर, म्यूकोसा पर, बार बार अल्सर्स हो रहे हैं, तो वो भी हम हटा सकते हैं, क्योंकि आरपीडी वगैरह जो भी है वो क्या कवर करता है, पूरा रीजन कवर करेगा। बट इम्प्लांट जो है कहाँ पर है, वो पूरा जॉ बोन के अंदर है, इट इज रेप्लिका ऑफ द रूट। कोई फोर्स एक्ट करेगा प्रोसेसिस पार्ट के ऊपर, मतलब क्राउन के ऊपर, वो डायरेक्ट का डेसिपेट होगा बोन के अंदर, बट सीडी या आरपीडी कुछ भी किया तो वो कहाँ डेसिपेट होगा, पहले म्यूकोसा पे आएगा, सॉफ्ट टिश्यू पे, उसकी रेजिडेंसी कितना है, जितना रेप आएगा शॉक एब्जॉर्ब करेगा, उसका डेसिपेट करेगा बोन के ऊपर, ठीक, मतलब हमने सॉफ्ट टिश्यू को हार्म कर दिया, ठीक है। जब ज़्यादा हार्म हो रहा था हम लोग वहाँ भी यूज़ कर सकते हैं। उसके बाद हाइपर एक्टिव गैर रिफ्लेक्सेस, ये तो बहुत लोगों के साथ हुआ होगा, पेशेंट के साथ कि नहीं हुआ अभी तक, पेशेंट नहीं करे, अब वो क्यों उसमें गैग रिफ्लेक्स आता है, कुछ लोग एक्चुअल में हाइपर सेंसिटिव होते हैं गैग के लिए, बट आधों को तो हम लोग गैग प्रोवाइड कर देते हैं। आप लोगों को 7 तक चाहिए, एक पॉइंट हमें याद रखना, कभी भी आप इम्प्रेशन लो, सीडी हो, आरपीडी हो, एफपीडी हो, कुछ भी हो, अभी तुमको इम्प्रेशन लेना है 7 तक का ही कवर करना है, मान लो 8 तक कवर करना पूरा, तो ट्रे यूज़ करो कि जहाँ 8 तक कवर हो रहा है, बट मटेरियल डालो तुम 7 तक ही, जब आप प्रेस करोगे तो एक्सेस फ्लो होता है पीछे, वो पूरा बराबर कवर करेगा। सेम फॉर तुम्हारा सीडी, जब तुम एफआई लेते हो तो रेडो डालते हो, पूरा पीछे तक भर दोगे, इसको जब प्रेस पर जगह दो निकलने के लिए, बाद कहाँ से निकलेगा, पीछे से निकलेगा ना, वो पीपीएस कहाँ है, पोस्टर पैलेट सीधे कहाँ है, पीछे, फिर जंक्शन ऑफ हार्ड एंड सॉफ्ट पैलेट, हार्ड पैलेट कुछ कर सकते नहीं और दबा के भी, लेकिन सॉफ्ट पैलेट क्या है, वहाँ कुछ हुआ सॉफ्ट पैलेट ऊपर हो जाएगा, ऊपर हुआ जगह खुल जाएगी, वहाँ कुछ गया कि गैर रिफ्लेक्स, बिकॉज सॉफ्ट पैलेट इज ए ट्रिगर पॉइंट फॉर गैर, ठीक। तो अभी इसमें क्या करना है, जहाँ तुम लोगों ने पीपीएस रिकॉर्ड किया होता है ना, वहाँ तक सिर्फ जेडोई या फिर जो भी मटेरियल यूज़ कर रहे हो आप, लाइट बॉडी, वहाँ तक डालकर ही छोड़ दो, फिर प्रेस करो, वो बराबर आपका पीछे तक जाके फ्लो होगा और रिकॉर्ड करेगा। ये क्लियर हुआ आपको, ये एक्सरसाइज दिया आपको, ठीक। सेम पीआई लेते हो, प्राइमरी इम्प्रेशन फॉर कंप्लीट डेंचर, समझा ना, प्राइमरी इम्प्रेशन फॉर कंप्लीट डेंचर, जनरली आप लोग मोल्ड नीट किया, गोल किया, रख दिया ट्रे पे, पेशेंट में लगा दिया, ऐसे करते हैं कि कोई और कुछ करता है, ऐसा नॉर्मल डॉक्टर ही पढ़ रहे हैं ऐसे, आपको काम में आया क्लिनिक को, जब काम में याद करना है, उसमें क्या करना है, नेक्स्ट टाइम ट्राई करो, या फिर कास्ट में ट्राई करके देख सकते हो, मैक्सरी हो बाई चांस, तो क्या करना है, उसको बनाया, राउंड किया, उसको फिर रखा ट्रे के ऊपर, अच्छे से उसको सब लोग फैलाया, रोटी बनाते हैं ना, छोटे गोला बनाया, रखा, ऐसा किया, सेम ट्रे पे करो, उसका हाथ से जो तुम पूरा शेप दो ना, उसका वेस्टिब्यूलर डेप्थ का दे सकते हैं ना, रख के उसको प्रेस करोगे, यहाँ पे तो ये पार्ट ऊपर होगा ना, ये पार्ट तो हल्का सा मुंह के अंदर प्रेस करो, मोल्ड करो, तो जो तुम लगाते हो प्रेशर, तो प्रेशर ज़्यादा रहेगी ना टेक्निक के मुंह के अंदर। सेकेंड चीज़, तुम इजीली उसको मोड़ कर सकते हो। मैं तो देखा बच्चों को मोड़ चल रहते हैं, एक बार नहीं, 2 बार नहीं, 5 बार घुमाते हैं। मैक्सिमम 2 बार में रिपोर्ट हो जाता है, प्रीमियम वगैरह सब कुछ, मैक्स टू मैक्स। EPS मैक्सिमम 30 सेकेंड में हो जाता है रिकॉर्ड, मैक्स टू मैक्स। ठीक, तो वैसा करके एक बार चेक करो। चले, साइकोलॉजिकल इनएबिलिटी टू वियर द रिमूवल डेंचर। कुछ पेरेंट्स होते हैं, फॉर एग्जाम्पल मान लो कोई एडवोकेट है, कोई टीचर है, ठीक है, या फिर कोई डॉक्टर है, अपन ही मान लो आगे जाकर तुम मेरे कोई MDS करेगा, कोई लेक्चर देगा, मेरे जैसे आकर कोई लेक्चर देगा, मैं वहाँ बैठ के सुनूंगा, फिर मैं बोलूँगा मैंने पढ़ा नहीं है। आशीष, अभी नाम याद हो गया मुझे, मेरे को नाम बताया, इन लोगों ने बताया, मनीजीत ने बताया, कुछ ही बोला तो बोल रहा आशीष। ठीक है, आपको चलो साइकोलॉजिकल एबिलिटी, तो हम लोग बात कर रहे हैं, अगर एडवोकेट है तो काम क्या नहीं, बोलना ही काम है, चिल्लाना। अबे सोचो वो RPD आगे लगा है, बहुत इंपॉर्टेंट केस चालू है, ऐसा खड़ा है जज के सामने, जज बोल रहा है उसने कुछ बोला, आप निकला जज के पास, दोनों मतलब जो कल्पेट है वो जो एडवोकेट है, दोनों बैठ के अंदर लूडो खेल रहे हैं। हो सकता है ना, दिमाग घूम गया, मतलब ऐसा होता नहीं है, लेकिन ऐसा होता भी सकता है कि आदमी बाहर निकल रहा है। जैसे क्लिनिक बहुत पेशेंट आते हैं, ये टीचर पेशेंट बहुत आते हैं, रिमोट लेक्चर लगा के रखा उन लोगों को, हम लोगों ने, वो लेक्चर ले रहे हैं, क्लास में हैं, कभी खांसी भी आता है तो बेंच से बाहर निकल जाता है। ठीक है, जैसे बाहर निकल जाता तो क्या है होगा, डिस्कम्फर्ट छोड़ देगा, तो चलते दें गिर गया तो एम्बैरेसमेंट होता है। तो वो लोग क्या होते हैं, नहीं ऐसा नहीं होना चाहिए, तो साइकोलॉजिकली उनको वो ठीक नहीं है, क्योंकि वो कहते हैं कुछ फिक्स मॉडलिटी मिल जाए हम लोगों को तो अच्छा होगा, तो उस केस में हम लोग इम्प्लांट कर सकते हैं। ठीक, अभी इसमें एक चीज़ और बोलता है आपको, ये वाले में 7 पॉइंट, ये भी हो सकता है ना, मेरे पास पेशेंट आ रहा है, उसका एबिलिटी इतना नहीं हो, इतना नहीं कर सकता हो, अगर फिक्स करना है तो मिनिमम 4 इम्प्लांट लगते हैं हमको प्लेस करने, और 4 इम्प्लांट अगर अच्छी कंपेयर किया प्लेस तो कितना चला जाएगा, मिनिमम 4 इम्प्लांट प्लेस करना है। अच्छा इम्प्लांट बात करो तो 1 लाख क्या हो जाएगा, सिर्फ इम्प्लांट प्लेस में 4 इम्प्लांट, प्रोफिट पार्ट के बाद अलग है, और कम से कम 2 बीस तक जाता है लोअर तक। अभी हर पेशेंट इतना पैसा नहीं पे कर सकता है, ठीक है, तो उसमें हम लोगों को ट्रीटमेंट प्लान चेंज करना पड़ेगा। उसमें क्या कर सकता हूँ मैं, 4 इम्प्लांट की जगह 2 इम्प्लांट डाल सकता हूँ। अगर मैं वहाँ 2 इम्प्लांट डाल दिए, अभी यहाँ से वहाँ जाने का रास्ता नहीं, नीचे पूरा पानी भरा है, तो हो सकता है ना मैं एक टेबल मारूँ, एक टेबल आपको बीच में से एक रख के डाल दूँ, मैं इतनी क्लियर जा पाऊँगा कि जो 2 टेबल है वो 2 इम्प्लांट है मेरे। ठीक है, तो इम्प्लांट के ऊपर जब हम लोग डेंचर देंगे उसको बोलते हैं ओवर डेंचर। ओवर डेंचर भी होता है 2 टाइप का, वन इज टूथ सपोर्टेड एंड सेकंड वन इज इम्प्लांट सपोर्टेड। अगर 2 टूथ बच गए, 2 टूथ कौन से, कनाइन या फिर प्रीमोलर्स, उसके आगे पीछे के अपने लिए ओवर डेंचर का कुछ काम नहीं करेंगे। ठीक है, कनाइन एंड प्रीमोलर्स, दिस आर द 2 आइडियल टीथ फॉर ओवर डेंचर। अगर वो रहा नेचुरल टीथ रहा तो उसमें वहाँ पे वो यूज़ करेंगे, और नहीं रहा तो हम लोग वहाँ इम्प्लांट डालेंगे। आइडियल पार्ट कौन सा है, कनाइन नहीं तो फिर फर्स्ट प्रीमोलर, बस। अगर वहाँ मैंने 2 इम्प्लांट डाल दिए और उसके ऊपर उसको फिक्स कर दिया तो भी बढ़ जाएगा, टेंशन निकलेगा नहीं, क्योंकि जो ओवर डेंचर होता है उसका होता है बॉल एंड सॉकेट जॉइंट होता है, जो बॉल टाइप रहेगा वो आता है इम्प्लांट के ऊपर, जो सॉकेट पार्ट रहेगा वो आएगा डेंचर में। जब उसको प्रेस होगा तो वो क्या होगा, इंटरलॉक हो जाएगा, धक्का मारो कुछ भी निकल के नहीं आएगा, बट रहेगा तो रिमूवेबल ही, मेरे को निकालना तो है ही, 1 दिन नहीं 2 दिन नहीं 3 दिन बाद निकालना तो पड़ेगा, नहीं निकाला तो दांत अंदर खराब होगा ना, म्यूकोसा खराब होगा, ठीक। तो हम लोग वहाँ अपन ना बजट को कॉम्प्रोमाइज़ करवा सकते हैं, अपना काम भी कर सकते हैं, ठीक। नेक्स्ट इज सिंगल टूथ लॉस, अवॉइडिंग इन्वॉल्विंग नेबलिंग टीथ एंड अबर्ट्स। जैसे कि कोई तो बोला था एफपीडी का, तो व्हेन वी आर डूइंग एफपीडी और फिक्स पार्ट डेंचर, कोई एक दांत मिसिंग है तो 2 दांत को अपने को कट करना, ट्रिम करना पड़ेगा, ठीक है। अब 2 दांत कट करने से अच्छा है कि जो पार्ट नहीं है वहाँ इम्प्लांट डाल दो। फॉर एग्जाम्पल इफ वी आर गोइंग फॉर एफपीडी एंटीरियर है तो क्या करेंगे, सिरामिक क्राउन तो करना ही पड़ेगा मिनिमम, और वह अच्छे चाहिए तो जिरकोनिया करना पड़ेगा। जिरकोनिया क्राउन का जितना चार्ज पड़ेगा 3 इम्प्लांट मिला के, उसमें उसके आप चार्ज में अप्रॉक्सिमेटली इम्प्लांट डल जाएगा, ठीक है, और आपका 2 दांत बच जाएंगे। तो सबसे अभी सब कुछ तो हो गया, ये सब थियोरेटिकल हो गया पूरा। तो सबसे मेन बात है पेशेंट को कन्विंस करना, पेशेंट को कन्विंस करो। उनको सबसे पहले एडवांटेज में बताओ इम्प्लांट क्या है, उनको पहले बताओ डिसएडवांटेजेस क्या है। अगर इम्प्लांट नहीं कराया अबटमेंट यूज़ किया तो डिसएडवांटेज तुम लोग उसका क्या रहेगा, उसके बाद डिफरेंट मालूम पड़ने के बाद फिर बताओ एडवांटेज क्या उस चीज़ का, ठीक है। लेकिन सबसे पहले केस हिस्ट्री पता, सब कुछ बता दिया है, पता चला कि पेशेंट का 2 अटैक आ चुके हैं, स्टेंट वगैरह लगा है, पेशेंट आ गया सर आपने बोला था फिक्स करना है मेरे को, तो वो पहले देखना है केस, ठीक। नाउ व्हाट आर काउंटर इंडिकेशन। फर्स्ट अनकंट्रोल्ड डिसीजेस, डायबिटीज में भी इम्प्लांट कर सकते हैं, हाइपरटेंशन में इम्प्लांट कर सकते हैं, और अनकंट्रोल्ड डायबिटिक, ठीक है। डायबिटिक पेशेंट में भी इम्प्लांट करते हैं। फिर तुम दांत कब जाता है पेशेंट्स का, जनरली है ऐसा तो टूट गया अलग बात है, 40-45 के बाद दांत गिरता है, और आजकल तो 40-45 के बाद सबको मैक्सिमम लोगों को डायबिटिक वगैरह हो ही जाता है। डायबिटिक नहीं है तो बीपी तो रहता ही है, ब्लड प्रेशर उसको हाई बीपी, ठीक है। तो अनकंट्रोल डायबिटिक पेशेंट होगा वो नहीं चलेगा। क्यों नहीं चलेगा, हीलिंग प्रॉपर नहीं होगा, हीलिंग प्रॉपर नहीं होगा तो ऑस्टियो इंटीग्रेशन नहीं होगा, ऑस्टियो इंटीग्रेशन नहीं होगा तो इम्प्लांट को ग्रिप नहीं होगा, ग्रिप नहीं होगा तो बाहर आ जाएगा, ठीक। सेकेंड प्रेगनेंसी। थर्ड लैक ऑफ एडिक्वेट ट्रेनिंग ऑफ प्रैक्टिशनर, कुछ समझाना है थर्ड पॉइंट में, मतलब इम्प्लांट जो करना है उसमें ऐसा नहीं है सिंगल डे जाके आके सीख कर लिया, नहीं, ये प्रॉपर ट्रेनिंग मिलना पड़ेगा। देन कंडीशन डिसीजेस ट्रीटमेंट एंड सीवियरली कॉम्प्रोमाइज हीलिंग। देन पुअर पेशेंट मोटिवेशन, और पेशेंट का मोटिवेटिंग कर पाए, क्योंकि इम्प्लांट डालने के बाद अगर कंडीशन आइडियल नहीं है तो इट में भी गो टू 4 to 6 months पूरा क्राउन लगाने, ठीक। पेशेंट रेडी होना चाहिए मेंटली कि 4 to 6 month हमको कैप नहीं मिलने वाला, ठीक। एमरे कैप भी नहीं, वो इमीडिएट इम्प्लांट अलग चीज़ है, कि पहले इम्प्लांट मालूम होगा तब इमीडिएट इम्प्लांट जाए। फिर साइकेट्रिक डिसऑर्डर that interfere with the patient understanding and compliance with the necessary procedure। कुछ साइकेट्रिक प्रॉब्लम है, कुछ मेंटल डिसऑर्डर है, आप पेशेंट बोल रहे हैं मुंह खोलने के लिए मुंह ही नहीं खोल रहा है, ठीक है। पेशेंट को बोला है कि वो गार्गल करना है, गार्गल नहीं कर रहा है, और वो दांत साफ नहीं कर रहा है या फिर डॉल कैविटी क्लीन नहीं रख रहा है, तो मतलब ही नहीं कुछ करती, क्योंकि वहाँ क्या होगा, अक्यूमुलेशन ऑफ फूड या डेब्रिस होगा एंड इट विल लीड टू द इन्फेक्शन, ठीक है। अनरियलिस्टिक पेशेंट्स एक्सपेक्टेशन, मतलब पेशेंट बोलते हैं ये बात हाजिर नहीं है तो लगा के दो, मतलब पेशेंट्स जब भी आपके पास आ रहा है तो सबसे पहली बात तो आप कितना अच्छा कर सकते हो, इफ यू कैन गिव 100% टू पेशेंट, उसको अपने बारे में 80% ही बताओ तुम इतना कर पाओगे, ठीक है। मतलब क्या, अगर मुझे लग रहा है कि 2 इम्प्लांट पे काम कर सकता हूँ तो बोलो कितने इम्प्लांट पे काम होगा, मतलब उसका एक्सपेक्टेशन बढ़ाओ मत। वो बोलेगा मुझे पूरे वाइट दांत ही चाहिए, तो बोलने का इतना वाइट नहीं होगा, इतना हो सकता है, बस मैक्स टू मैक्स। हम मान लो कर सकते हैं उससे ज़्यादा, लेकिन उतना नहीं बोलना कि बाई चांस उतना नहीं हुआ तो पेशेंट सीधे आके बैठता है, मतलब पेशेंट को ज़्यादा एक्सपेक्टेशन देने का नहीं, नॉर्मल रखना है बस, ठीक। अनअटेंडेड प्रोस्टेटिक रिकंस्ट्रक्शन, मतलब जहाँ पर रिकंस्ट्रक्शन पॉसिबल नहीं है वहाँ इम्प्लांट अवॉइड करना है। फॉर एग्जांपल अभी एक लेक्चर तुम बैठे थे क्या म्यूकर माइकोसिस के अंदर, ठीक है, डॉक्टर सुनील नोडर सर का 2016 में केस किया हुआ है, जब हम लोग एक ही कॉलेज में थे सुनील सर वो। उस केस के अंदर इम्प्लांट डालना पॉसिबल नहीं था। क्यों पॉसिबल नहीं था? क्योंकि मैक्सिला पूरा गायब था, ठीक है, मैक्सिला के साथ साथ जाइगोमेटिक बोन पूरा गायब था। अगर जाइगोमेटिक बोन वहाँ पर होता तो हम लोग वहाँ जाइगोमेटिक इम्प्लांट डाल सकते थे। वहाँ सिर्फ यहाँ पे डेरिवेट यहाँ पे बोन था, इसलिए वहाँ पे प्लेटिंग किया गया, फिक्स किया, ठीक है। तो जहाँ प्रोस्टेटिक बोन नहीं कर सकते वहाँ इम्प्लांट अवॉइड कर देना है, ठीक। सेकेंड, ऑन्को पेशेंट्स, इस तरह थेरेपी चालू है उससे भी इम्प्लांट प्लेस नहीं करना है, ठीक है। क्यों नहीं करना है? उसका बोन नेक्रोस रहता है। देन पेशेंट हाइपर सेंसिटिव टू स्पेसिफिक कंपोनेंट्स ऑफ इम्प्लांट, मतलब कि एलर्जी, ठीक। नेक्स्ट, बोल तो नहीं हो रहा? हो रहा तो बोल देना, हम जाएंगे वहीं पे। नेक्स्ट, स्मोकिंग। पहला पॉइंट क्या है? स्मोकिंग इज नॉट एक्सेप्ट कॉन्ट्रा इंडिकेशन, ठीक है। इसका सब छोड़ के डायरेक्ट बात करते हैं, मतलब पेशेंट आया, पेशेंट से पूछेंगे हम लोग, स्मोकिंग वगैरह में पूछते हैं ना, सब लोगों ने देखा था ना केस3 का फॉर्मेट तुम्हारे कॉलेज का, उसमें कुछ है सर नेम, ओपरी नंबर, एड्रेस, सबका ऑलमोस्ट सेम ही है। स्मोकिंग का क्या इफेक्ट होगा? वर्सेस डिलेट बोनिंगली, हाँ कैसे होगा बोलो ना, छोड़ दो वो ओडी वाले से पूछना। बस अगर स्मोकिंग ज़्यादा रहेगा पेशेंट का तो वोनिलिंग कम होगा, एक तो फर्स्ट पॉइंट। सेकेंड, अगर पेशेंट ज़्यादा स्मोकर है या पेन स्मोकर है तो रेट ऑफ सलाया फ्लो विल बी डिक्रीज। अब रेट ऑफ सलाया फ्लो डिक्रीज होगा तो एक प्रॉपर्टी सलाया की सेल क्लींजिंग प्रॉपर्टी, इम्प्लांट प्लेस कर दिया, सलाया फ्लो कम हो गया, मतलब सेल क्लीनिंग प्रॉपर्टी कम हो गया। अब सेल क्लीनिंग प्रॉपर्टी कम हो गया तो डेट लीड टू द इन्फेक्शन। कोई पॉइंट क्लियर हुआ? ठीक। अभी इन्फेक्शन का चांस हो गया। थर्ड पॉइंट क्या है? इंक्रीज इंसिडेंस ऑफ पेरी इम्प्लांटाइटिस, मतलब इन्फेक्शन ऑफ द इम्प्लांट, टिश्यू अराउंड द इम्प्लांट। उसके बाद वो हो गया तो क्या करने का है? सर को फ़ोन करने का है, क्योंकि पेरे वाला वो करेगा उनको ही फ़ोन करता कि सर मैंने ऐसा ऐसा कर दिया है। सर बोलते हैं तूने क्या पकड़ा? हमने पेशेंट ने किया, कि वो काम करते हैं पेरेंट कंट्रोल, ठीक है। तो इसका मेन चीज लास्ट पॉइंट ये है, अभी ऐसा तो नहीं है ना कि पेशेंट स्मोक कर रहा है तो इम्प्लांट डालोगे नहीं, तो इम्प्लांट प्लेस कर सकते हैं बट विथ फॉलोइंग गाइडलाइन। कौन सा? पेशेंट शुड cease smoking for minimum of 1 week prior to and at least 8 weeks after implant surgery। बस सर्जरी की 1 वीक पहले से स्मोकिंग बंद करना है कि और 8 हफ्ते तक बंद रखना। 8 हफ्ते मतलब कितने मंथ हो गए? 2 महीने तक नहीं करना। इम्प्लांट प्लेस जिस दिन करना है उसके 1 हफ्ते पहले से लेके इम्प्लांट प्लेसमेंट के 2 महीने तक नहीं करना है, क्योंकि उस समय वही मेन टाइम होता है जबकि फॉर्मेशन ऑफ बोन होता है या फिर ऑस्टियोब्लास्टिक एक्टिविटी स्टार्ट होता है, ठीक। अगर ऑस्टियोब्लास्टिक एक्टिविटी नहीं होगा तो इम्प्लांट बाहर निकलेगा, बस हर चीज़ बाहर ही निकलने वाला इम्प्लांट आपका। हाँ, मेडिकल हिस्ट्री ये सब फिजियो में कभी तो पढ़ा होगा। कौन सी बुक थी? सेम्बोलिंगम, तूने पढ़ा है? उसमें एक चार्ट दे रखा है ऐसा कुछ कि वाइटल होता है, वाइटल पैरामीटर, ब्लड प्रेशर कितना होना चाहिए आइडियल, पल्स कितना है, टेम्परेचर कितना चाहिए, रेस्पिरेशन रेट कितना चाहिए, ठीक है। तो अगर ब्लड प्रेशर 160 अबव है तो उस केस में इम्प्लांट प्लेस नहीं करना है। मे बी बॉर्डरलाइन हाइपरटेंसिव पेशेंट। सेकेंड, अगर पेशेंट नीचे से स्टेयर से ऊपर आया है और स्वयं बीपी चेक किया तो बड़ा ही रहेगा वो। आने दो, बैठने दो, थोड़ा टाइम बैठेगा, ठंडा माहौल होने दो, उसके बाद चेक कर। ठीक, पल्स रेट का भी सेम रहेगा बीपी ऐसे। देन टेम्परेचर, पेशेंट शुड बी अफेब्राइल। अगर फीवर रहा तो सर्जरी का कुछ भी नहीं करना है, क्योंकि बॉडी जो है इसको रेसिप्रोकेट नहीं कर पाएगी, या फिर कुछ इन्फेक्शन रहा तो फाइट नहीं कर पाएगा। ठीक, नाउ डिफरेंट लैब एवेल्यूशन, मतलब लैब टेस्ट कौन कौन से करने फॉर इम्प्लांटोलॉजी। फर्स्ट इज CBC और कंप्लीट ब्लड काउंट। सेकंड इज ब्लीडिंग डिसऑर्डर। थर्ड इज ब्लड शुगर लेवल। फोर्थ इज T3, T4, TSH और थायराइड हार्मोन टेस्ट। देन इज HIV टेस्ट, हेपेटाइटिस टेस्ट। लेकिन अभी 7 नंबर पे इसको पहले फर्स्ट नंबर पे ला। कोविड RT-PCR टेस्ट पहले करना है, नहीं तो अपन ने ये करवा लिया, पेशेंट का इंजेक्शन भी लेके रख लिया पहले ही, अपन वॉच भी नहीं किया, अपना यहाँ पोर कर रहा है, सबको बांटते आ रहे हैं। ठीक है, प्रसाद है। सबसे पहले क्या करना है, RT-PCR, उसके बाद फिर भेजना पेशेंट सब टेस्ट के लिए। तो CBC क्या इंपॉर्टेंट है, कंप्लीट ब्लड काउंट। हमको क्या क्या मालूम पड़ेगा, हीमोग्लोबिन काउंट, हाँ, HB, BT, CT सब चेक होगा। HB क्या है, हीमोग्लोबिन, BT ब्लीडिंग टाइम, CT वेरी गुड। उससे क्या मालूम पड़ेगा हमारा, ब्लीडिंग टेस्ट, BT एंड CT से ये कब जाके क्लॉट फॉर्म हो रहा है कि नहीं हो रहा है। तो इम्प्लांट प्लेस करने के बाद क्लॉट फॉर्म नहीं होगा तो ब्लड लॉस ज़्यादा होगा। ब्लड लॉस जाने से क्या होता है, पेशेंट सिनकोप में जा सकता है। ठीक है, तो वो अवॉइड करना है। फिर ब्लड शुगर लेवल, RBS है, FPS है, मतलब रैंडम ब्लड शुगर भी लेना है, फास्टिंग भी लेना है, दोनों लेना है। जरूरी नहीं कि पेशेंट आया तो खाना खा के आया होगा या नहीं खा के, अपने को पता नहीं है। पेशेंट आया तो हमको पता है कि रैंडम ब्लड शुगर करवा दें, उससे एक अपने को अप्रोक्स आइडिया मिल जाए। ठीक, थायराइड हार्मोन वो क्यों कराएंगे, उसको बोल के क्या फर्क। अरे कुछ था ना, फर्स्ट ईयर में था थायराइड, तो 2 बुक में था, वो भी याद है। एनाटॉमी के अंदर भी था, फिजियोलॉजी के अंदर भी था, हार्मोन्स के अंदर। बोन वीक हो जाएगा, ठीक है, डेंसिटी ऑफ बोन कम हो जाएगी, तो फ्रैक्चर चांस होगा कि बोन फ्रैक्चर हो जाए, तो वो भी चेक करना है कितना है क्या है। थायराइड को प्रॉब्लम नहीं है तो कंसल्ट टू फिजिशियन। HIV टेस्ट, देन दोनों क्यों कर रहे हैं, इन्फेक्शन खुद को बचाने के लिए, सामने वालों को खुद को बचाने के लिए। ठीक है, देन bone density. Bone density is the key for successful implant. Bone density मतलब क्या, कि वहाँ पर एक जगह पे कितना मैक्सिमम चीज़ें हैं, मतलब वो डेंसिटी हो गया पर्टिकुलर। हम लोग ये वाला पढ़ेंगे। According to this, the bone density is classified into 5 types: D1, D2, D3, D4 and D5. What is D1? Dense cortical bone. मतलब वहाँ पे सिर्फ cortical bone ज़्यादा है, मतलब hard bone ज़्यादा है, तो density located है, वो हो गया dense cortical bone। यहाँ पर thick dense to porous cortical bone, D2 क्या on crust ऊपर and फोर ट्रैक्टर बोन विथिन, मतलब हार्ड बोन है, इस सेंटर में क्या है, पोरस बोन है, पोरस बोन है। पोरस बोन बताया था कि मस्कुलर सप्लाई वहाँ पर ज़्यादा है, एक मस्कुलर सप्लाई ज़्यादा है। सेकंड, ऊपर का पार्ट ऊपर से हार्ड है, अंडा कैसे होता है, बाहर का सेल हार्ड है, छूटेगा ही वो, हार्ड है, अंदर सॉफ्ट है। यही मानो एग्जाम्पल के लिए, जो अंडे कवरिंग है वो पार्ट हो गया, कौन सा बोन है, क्रिस्टल बोन, कॉर्टिकल बोन, क्रिस्टल बोन, ऊपर जो क्रिस्टल बोन है। उसके बाद अंडा देखा है, नॉन वेजिटेरियन वालों ने देखा होगा अंडा तो, ठीक है। उसके अंदर क्या आएगा, येलो पार्ट एंड वाइट पार्ट। एक पार्ट समझ लो वस्कुलर का है और एक पार्ट न्यूरॉन्स का है। येलो पार्ट वस्कुलर समझ लो, वो क्या है, प्रोटीन सप्लाई करता है, प्रोटीन पार्ट है ना वही, जो वाइट वाला है, वाइट वाला है, देखो अलग से हाँ बोला ये वाइट एल्ब्यूमिन प्रोटीन, ठीक। सोच सोच के मुझे बताना, ठीक, सेम वैसा ही, ठीक। नेक्स्ट है D3। अब D3 में क्या है, थिन पोरस कॉर्टिकल बोन, वहाँ पर ठीक है, यहाँ थिन है, ठीक। नेक्स्ट इज फाइन ट्रेबिकुलर बोन, मतलब पूरा ऊपर से लेकर नीचे का बोन ट्रेबिकुलर, मतलब ऊपर हार्ड बोन कुछ भी नहीं है, हाँ। इम्प्लांट का प्रेशर दिया है कि अंदर चलेगा। उसके बाद आएगा इमैच्योर और नॉन रेस्ट बोन, मतलब पूरा पोरस, ठीक है। फॉर जनरली इन मैक्सिलर देयर इज D3 टाइप ऑफ बोन, और मैंडिबल जनरली होता है D2 टाइप ऑफ बोन। इसलिए द हीलिंग इन केस ऑफ मैक्सिला, द हीलिंग पीरियड फॉर मैक्सिलर इम्प्लांट इज मोर इन कंपेयर टू mandibular implants because the bone is porous in case of maxilla. Now इतना ही पढ़ना बाकी है, किसी नींद तो नहीं आ रही है, आज तो चाय पी लो, मेरे लिए लेके आइए। Now diagnostic imaging and techniques. Diagnostic imaging important क्यों है? These are the objectives of imaging. First one is to identify diseases. Second is to determine bone quality, bone quantity, and to determine the position of implant. ठीक? उसके लिए क्या क्या यूज कर सकते हैं हम लोग? पहले यहाँ पर रेडियोग्राफ, मतलब तुम्हारा IOP है, ठीक है, या फिर RVG। सेकंड वन इज मतलब OPG, PG, प्लस या CBCT और MRI, ठीक है। तो जो आइडियल हम लोग इम्प्लांट यूज करते हैं वो कौन सा है, CBCT, ठीक है, CBCT। तो वहाँ से कैसे मालूम पड़ा ये सब चीज़ें, वो बताता। फर्स्ट वन इज टू आइडेंटिफाई डिसीजेस, सिंपल OPG रहा। अभी आप लोग क्लिनिक प्रैक्टिस करोगे फ्यूचर में जाके, ठीक है, तो अगर आप फुल माउथ CBCT कराओगे तो मिनिमम कॉस्टिंग विल बी अराउंड 3000 to 4000, ठीक है। हो सकता है कि फर्स्ट विजिट के अंदर पेशेंट से आप बोलो कि तुमको ये रिपोर्ट करके लाना है, 4000 रुपये का है, पेशेंट सोचेगा ये तो रिपोर्ट के 4000 बोल रहे हैं, तो फर्स्ट गो फॉर OPG। अगर आइडियल देखेंगे बुक के अकॉर्डिंग इट शुड बी डायरेक्ट CBCT, बट अभी क्लिनिकल बेस पे जाएंगे तो इट शुड बी OPG, ठीक है। पेशेंट को बोलो कि OPG करा के लाइए, उसमें हम थोड़ा सा चेक करेंगे कि बोन है कि नहीं है और तुम्हारे नर्व्स कहाँ से पास हो रहे हैं, और नेबरिंग टूथ का कंडीशन क्या है, उसका डिसाइड करेंगे कि आपको इम्प्लांट करना है कि नहीं करना है। अगर पॉसिबल होगा तो हम लोग फिर क्या कराएंगे, CBCT, ठीक है। कई बार ऐसा होता है डायरेक्ट पेशेंट को CBCT बोल दिया है, लेकिन जब CBCT करा के लाया पेशेंट, उसके अंदर बोन ही नहीं है। पेशेंट क्या बोलता है, सर का वहाँ कट होगा इसलिए उन्होंने वहाँ भेजा है, 4000 का बिल बनवाया है, वहाँ से कुछ मिला होगा। तो सबसे पहले गो फॉर OPG। अगर OPG आप लोगों को लग रहा है कि हो सकता है इम्प्लांट, तो CBCT पे जाओ, ठीक। ये क्लिनिक की बात है, लेकिन आइडियली CBCT, ठीक। अब CBCT में क्या देख सकते हो, कोई भी अगर सिस्ट रहा तो दिक्कत आएगा, कुछ पेरियापाइकल पैथोलॉजी रहा तो वो भी दिक्कत आएगा, ठीक। बट तुम नॉर्मल OPG वगैरह पेरियापाइकल में टर्न नहीं कर सकते क्योंकि वो 2D में। सेकंड, अभी जो चीज़ बताया बोन क्वालिटी एंड क्वांटिटी, ये हमको मालूम पड़ेगा CBCT से ही। अभी आप उसको जब CBCT लगाओगे, चेक करोगे, तो उसमें ऐसा नहीं रहेगा कि अपन ने कोई एरिया आपके पास गए तो दिखा रहा है दिस बोन इज D1, दिस बोन इज D2, नहीं। उसके लिए D1 D2 का डेंसिटी होता है, ठीक है, उसका वैल्यू होता है हॉर्स के अंदर, ठीक है। उसमें लिखा अभी कोई पार्ट रहा बोन का, वहाँ जाके आप राइट क्लिक करोगे तो वहाँ पे आपको नंबर दिखाएगा, हो सकता है 1200 नंबर्स दिखा रहा हो कहीं 1600। उसका एक क्लासिफिकेशन डेंसिटी का 4000 to 3000, 3000 to 2000, 800 to 1200, तो वो वैल्यू D1 में आ रहा है कि D2 में आ रहा है, D3 में आ रहा है, वो देखना है। मतलब वो वैल्यू जहाँ पे क्लिक करोगे वो वैल्यू देखा, उस कंपेयर किया कि किस में आ रहा है, D1 में आ रहा है तो ठीक है, मतलब हो गया D1 क्वालिटी। ठीक, ये पॉइंट क्लियर हुआ। नाउ फोर्थ वन इज डिटरमाइन द पोजीशन ऑफ इम्प्लांट। एक बार बोन क्वालिटी मालूम पड़ गया है, क्वांटिटी मालूम पड़ गया, तो अब हम जाएंगे इस पर कि कहाँ पर उनको इम्प्लांट प्लेस करना है। ठीक है, अब इम्प्लांट प्लेस करने के लिए क्या इंपॉर्टेंट रहेगा, अगर लोअर है या मैंडिबुलर है तो द नर्व पासिंग थ्रू, मैंडिबुलर नर्व कहाँ से पास हो रहा है। कि जब भी हम लोग इम्प्लांट प्लेस करते हैं इट शुड बी अबाउट 2 mm अवे फ्रॉम द नर्व। इट शुड बी 2 mm अवे फ्रॉम द नर्व। ये तुम लोगों का फाइनल ईयर का MCQ है। ठीक, इट शुड बी 2 mm अवे फ्रॉम द नर्व। ये हो गया क्लियर। और मैक्सिलर आएगा तो वहाँ क्या काम करेगा CBCT, अपने को वहाँ दिक्कत आएगा साइनस लाइनिंग। ठीक है, हो सकता है कि साइनस लाइनिंग और बोन में लेंथ या डिस्टेंस कम हो। अब जब तुम प्लांट प्लेस करोगे तो कहाँ जा चले जाएगा, साइनस के अंदर। ठीक है, तो क्या होगा, फंक्शन ऑफ साइनस एनाटॉमी एज शॉर्ट नॉट। हाँ, इट इज न्यूमेटिक स्पेस, इट इज न्यूमेटिक स्पेस फर्स्ट, सेकंड वॉइस रेजोनेंस, थर्ड लाइटनेस। वेरी गुड, मेन पॉइंट भूल गया कोई, एक पॉइंट मेन जो फर्स्ट पॉइंट बुक के अंदर वो भूल गया। हवा को वार्म करता है वो, मेन पॉइंट तो वही है ना। जब सर्दी तुमको हो जाती है, ये सब भारी लगता है, गला सूखता है क्योंकि तुम्हारा एयर का वार्म नहीं हो पा रहा, इसलिए हो रहा है। ठीक है, तो मेन फर्स्ट पॉइंट वो आएगा। आगे यार हम लोगों ने साइनस परफोरेट कर दिया है तो इट माइट गो, साइनस कितना है, पूरा है ना, मतलब इसके बाद तो पूरा हॉलो कैविटी आ गया, तो यहाँ भी जा सकता है, यहाँ भी जा सकता है। यहाँ गया तो एक बार ठीक है अटक जाएगा, और यहाँ चले गया तो वहाँ भी नर्व जा रहे हैं ना, उसको इम्पेक्ट कर सकता है। सो हमको साइनस लाइनिंग भी चेक करना है, बट अगर साइनस पास में भी है तो भी हम इम्प्लांट कर सकते हैं। जो साइनस मेम्ब्रेन है उसको हम लोग हल्का हल्का करके लिफ्ट कर सकते हैं, एंड दैट प्रोसेस नोन एज साइनस लिफ्ट। ठीक है, अलग अलग टाइप का डायरेक्ट साइनस लिफ्ट है, इनडायरेक्ट साइनस लिफ्ट है, वो भी है, विंडो टेक्निक है, वो तुमको अभी ज़रूरत नहीं है। तो वहाँ पर हम लोग इम्प्लांट प्लेस कर सकते हैं। तो वहाँ से हमको क्या मालूम पड़ के आ रहा है, पोजीशन ऑफ द इम्प्लांट। ठीक, ये सबको क्लियर हुआ, खत्म अपना टॉपिक। अभी किसी को कोई डाउट पूछ सकता है, बोलो। नहीं ना, चलो फिर मिलते हैं अपन नेक्स्ट ईयर फाइनल एग्जाम के अंदर। हो गया।